Hello, hello, hello. Good morning. Good morning. I thought I had longer to chew my food. I'm so sorry. That's so rude of me. That's so rude of me. I'm sorry. Well, we have changes today. We have changes today. Court TV. Sorry, let me swallow here. So, yeah, Court TV, I guess because of all the drama surrounding um, the way Court TV is doing things, they had to change up their um, wonder why the dad's not wearing his glasses. Okay, Regina. Reginald. I can't even talk today. Good morning. Good morning. And Denise is here and William's here. And I know 80 stuck his foot in the door. I seen 80's foot in the door for just a minute. Yeah. So how is everybody today? Just say it. Oh, Hannah. Good morning, sweetie. How are you? So yeah, so they did some change up with their screen, so I kind of had to go and revamp my screen a little bit. So we may look a little different today. I feel like I'm really huge up here, but I'm really not. I just kind of had to make it just to cover certain things, and yeah, just transformative. So anyways, our screen's a little different today. And Court TV has decided that they're going to stop in, and I think Julie Grant is the one that's jumping in and doing breaks and stuff like that. So, but I did talk to, that's fine, Hannah. You lurk all you want, sweetie. You lurk all you want. Oh, I'm sorry. Oh, that was rude. I'm sorry. So, anyways, I spent the last 30 minutes trying to revamp my screen to accommodate Court TV's new screen that they have up. So I may look a little funny in the corner. I feel like I'm awfully big in that corner over there, but it's okay. It's okay. And I did talk to Kathy at Gossip, Rumor, and Innuendo, and I will drop her channel here. In a little while when we go to watch her video, I will drop her channel. She did give me permission to use the episode called Phone a Friend, where she talked to a beautiful woman named Ravi, and her and Ravi had a conversation about the cultural differences, and I think it will be great to play during a break to get somebody else's perspective on the culture. So I did get permission for that from Kathy, so we will be watching that today during break. So anyways, I'm going to hit play, and I hope everybody had a great evening. I know I did. I sat around and just watched drama stuff and just relaxed all evening. So yeah, I'm ready to get into it today. I already cooked the bacon for Hector since we had the grocery dilemma yesterday with him not delivering. So I cooked bacon already this morning. So all I have to do is warm it up. So we're one step ahead of ourselves today. All right, I'm going to hit play. I paused it where it jumps right in. So here we go. Let's roll.
Just a reminder, if you could talk a little bit slower for the court reporter and also the interpreters. When we left off yesterday, we were talking about strangulation in general. Is that correct?
Correct.
And I believe you testified that the medical definition of strangulation is, in essence, when external pressure is applied to the neck such that the airflow and also blood flow are compromised?
Yes.
Okay. And I want to ask you some questions about the different ways that blood flow can be compromised. Can you, what is the jugular vein?
In our neck, there are two jugular veins. A vein is a thin-walled blood vessel that takes blood from an area of the body back to the heart and the lungs. So the jugular veins are on the outside of the neck, bringing the blood down from the brain after the oxygen has been used. So it's deoxygenated blood coming down from the brain, going back into the heart to go to the lungs and get oxygen again. There's 2 jugular veins, one on each side of the neck.
Okay. And for the record, when you were explaining the location of the jugular veins, you were pointing to the opposite sides of your neck.
Opposite sides and outside. The jugular vein is on the outside of all the structures on the neck.
Okay. And you started talking about sort of the blood flow when it comes to the jugular veins. Can you sort of explain to the jury the relationship between sort of the heart and the lungs when it comes to blood flow?
Yes. So the heart has 4 chambers, and 2 of those chambers will send blood to the lungs, where all of the air sacs get the oxygen, and that oxygen goes across the thin membranes into the blood. The blood then goes back from the lungs to the other 2 chambers of the heart, where the heart pumps oxygenated blood everywhere into our body. It's a closed circuit, and it works constantly without us even thinking about it.
Okay. And what is the what is the function of the jugular veins?
The jugular veins bring all of the blood that's in the head back down to the heart. There are many veins inside the head and the brain, and they all condense together to give the blood to the jugular vein. So there's just 2 jugular veins bringing all the blood from the head down through the neck and back to the heart.
Okay. And you testified that the jugular veins are responsible for bringing the blood from the head down to your heart. What kind of blood is being sort of, trying to figure out a way to smartly ask the question. What kind of blood is sort of being taken out of the brain through the jugular veins?
Blood does many functions in our body. It brings oxygen and it brings nutrients to every cell in our body. The jugular veins are bringing the used blood, deoxygenated, so the oxygen has been taken out of it, and all the nutrients that the brain cells need have been used. So this is blood that's been used that needs to be regenerated with oxygen and nutrients by the heart and the lungs.
Okay. And with regards to deoxygenated blood, what is deoxygenated blood?
Again, that's the blood where the oxygen has already been taken out and utilized by whichever part of the body we're talking about. And in this case, all the brain cells have taken the oxygen out of the blood, and there's no legitimate amount of oxygen left, so it has to go back to the heart and the lungs.
Okay. And with regards to the deoxygenated blood, you indicated that it travels back into the heart from the jugular veins. With the deoxygenated blood itself, is it just simply blood that no longer contains oxygen, or is it also blood that sort of contains all the other materials in the brain that should not be there?
So correct. The deoxygenated blood has carbon dioxide in it because that's what our cells produce as they metabolize the nutrients. The oxygen is used and the carbon dioxide is the byproduct. All of the nutrients, the blood sugar and all of the other nutrients and vitamins that the brain cells need have been taken out of the blood. So again, this used blood is coming back to be regenerated by the heart and the lungs with all the nutrients it needs to then go back to the brain again.
Okay.
We have some breaking news out of Florida in the other trial that we are following. The state has just rested their case in the penalty phase. Stop prompting this fight. Let's head back now.
See, this is what I'm saying. It's going to be a little bit rough today. We're going to have to get through and fast forward through some of this stuff because, Court TV decided to do a big change up today. And it's a good thing we started an hour late to get through this. So, all right.
Into the courtroom. The jury is hearing from...
Okay. And when somebody is When strangulation occurs, could the jugular veins be compromised?
Yes.
And how can it be compromised?
A vein is a thin-walled vessel, so it's easy to compress a vein and stop the flow of the blood coming out of the head and down the neck and into the heart. So simple compression will stop that blood, and then it will build up in the head.
Okay. And if external pressure does apply to the jugular veins, where there's compression to the jugular veins, which part of the body is mostly impacted?
The head and the neck region.
Okay. I know this may sound like a silly question, but you indicated the head would be one of the parts of the body that would be mostly impacted. Would it be impacted in a positive way or a negative way?
A negative way.
Okay. And why is that?
The blockage of blood coming out of the head causes a backup of pressure in the head, so the blood has no other way to get out except those jugular veins. So when pressure is placed on the jugular veins, that buildup of blood has nowhere to go, and it builds up in the face, in the brain, in all structures of the head.
Okay. And you testify, Dr. Gilbert, that when there is pressure applied to the jugular veins, there's a buildup of the blood in the brain. The buildup of the blood you're referring to, would it be the deoxygenated blood?
Correct.
Okay. And when there is that buildup of deoxygenated blood in the brain, what are some physical symptoms that can manifest?
There's a higher blood pressure in the brain. There is accumulation of the byproducts that should be coming out of the brain, all of the carbon dioxide and the used up chemicals from the brain cells. All of that is being trapped inside the brain and inside the head without the ability to be cleansed and recirculated.
Okay. And when that happens, if a person has a buildup of deoxygenated blood in the brain, what are some symptoms that they may experience?
Many symptoms. They may get confusion. Their brain cells aren't going to think and react appropriately. They will get a headache because that increased pressure will cause pain in their brain. They may not be able to talk clearly or make sense out of what's going on. They get fuzzy. Eventually, they will lose consciousness because of that pressure on the jugular vein.
Okay. And why would the buildup of deoxygenated blood in the brain cause a headache?
Again, the deoxygenated blood, not enough oxygen for each of the cells to do their job, and the pressure of having that extra blood not going anywhere is what causes the headache.
Okay. And why would it cause dizziness?
Dizziness comes from, again, the center part of the brain, the brainstem area, gets dysfunctional, and the brainstem controls almost everything that goes on in our body, our heart rate and our blood pressure and our consciousness and so many things, hearing, speaking. So all of those things are impacted or affected with that buildup of pressure and deoxygenated blood.
Okay. And why would it cause dizziness?
Again, the dizziness comes from the dysfunction in the brain. That balance that comes from our brainstem area is impacted by the buildup of the blood and the lack of oxygen.
Okay. And Dr. Gilbert, when you testified about the different causes of the buildup of the deoxygenated blood and the impact from that, you use the word brainstem several times. What is brainstem?
So our brain has sections of it, hemispheres up here, but it all condenses into something we call the brainstem. And the brainstem is connecting the brain to the spinal cord, and it is giving all the information from the brain to the rest of the body. So the brainstem is like the powerhouse of the brain. And when we have strangulation, we're impacting blood flow coming out of the head and blood flow going into the head. And the biggest, it impacts everything in the head, but one of the biggest areas is that brainstem. That's that computer that runs the show. So alertness, awakeness, thinking possibilities, heart rate, blood pressure, the things that we don't think about our body doing are all controlled by the brainstem. And all of that control is dysfunctional or lost when we have pressure on the neck, causing that obstruction of blood flow.
Okay. And if I'm under,
And Dr. Gilbert, while she has been testifying, has been often using her hands to demonstrate for the jury what she is verbally explaining to them in her head and neck region.
thank you, Your Honor.
Thank you.
And Dr. Gilbert, based on what you just described as the function of the brainstem, is it fair to say that in order for any person's brainstem to function properly, that they need, in essence, they need deoxygenated blood to be removed from the brain,
Correct.
and then also oxygenated blood to be traveling to the brain?
Correct.
Okay. And if the brain,
Listening to Dr. Gilbert testify there. We're going to squeeze in a quick break, but don't go anywhere. Lost consciousness. Now, he and his wife, Zahraa, both face attempted murder charges. Let's
See
get
what I'm
back
saying?
inside that courtroom now, right where we left off,
We
with
gotta
more
fast
from Dr.
forward.
Joyce Gilbert.
We'll get through these.
and if the
We'll get through it.
brainstem has if the brainstem is in essence dysfunctioning due to the buildup of the deoxygenated blood, can it also cause vision problems?
Yes.
And how does it cause vision problems?
Well, again, the brainstem is right near the vision center, so that buildup of pressure causes dysfunction of the vision cells as well as the lack of oxygen. Makes it difficult for somebody. They describe blurry vision and eventually loss of vision with obstruction in the neck.
Okay. And you testified about blurry vision and then eventually loss of vision. With regards to the loss of vision, would it be temporary or permanent?
It's most of the time temporary. There are situations where somebody has survived a severe strangulation episode with lasting effects on their vision.
Okay. And what about if the brainstem is impacted due to the buildup of the deoxygenated blood, can it also cause hearing issues?
Yes.
Okay, and how does it cause hearing issues?
Again, in a similar fashion, the hearing part of the brain and the brainstem function for our ears to hear and make sense out of sound. And when that is impacted by pressure on the neck, then our hearing becomes diminished and sometimes to the point of complete loss of hearing during the episode.
Okay. And Dr. Gilbert, you testified about the sort of when the brainstem is impacted, its function becomes impaired. Besides sort of the brainstem being impacted and impaired, can the buildup of deoxygenated blood in the brain also cause other complications?
Yes.
Okay, and what are some of those complications?
Again, every aspect of the brain is impacted by this backup of blood with the pressure and the lack of oxygen and the lack of nutrients. So our cortex, our thinking part of the brain is impacted. Our motor centers are impacted. Our ability to move in a concerted effort and make a point of what we want to do is impacted. And again, eventually, everything is impacted to the point of unconsciousness.
Okay. Dr. Gilbert, have you heard of the term cerebral hypoxia?
Yes.
And what is that?
Cerebral means brain. Hypoxia means lack of oxygen. So cerebral hypoxia is lack of oxygen to brain cells.
Okay. And is there also a relationship between muscle tone loss and jugular vein compression?
Yes.
And what is that? And how does jugular vein compression cause muscle tone loss?
Again, with the deoxygenated blood, so lack of oxygen, lack of nutrients, the muscle control center is in the.
Okay, I don't mean to pause, but y'all, call me grandma today because I just realized the shirt I have on and the shirt she has on are real similar. This is me finding the humor in this fucking trauma, this whole trial ordeal of Off the Rails. I just looked up and looked at her shirt. I had to look down at mine. I'm like, oh, it's close to the same pattern. Okay, I'm sorry, guys. I'm sorry.
Center, the temporal part of our brain. And so we lose control over our ability to move any of our muscles in our body, arms, legs, all of the motor skills are diminished or lost with the pressure on the neck.
Okay. And what is, have you heard of the term asphyxia?
Yes.
And what is asphyxia?
Asphyxia is a term to describe lack of oxygen to a certain area of the body. It just means the oxygen isn't getting to where it needs to be.
Okay. And you testified about the effect on the brain from the buildup of deoxygenated blood. Is the magnitude of the effect, is it somewhat dependent on whether the brain is that of, let's say, a minor child versus a grown adult?
That is a really interesting question because most of our research on strangulation has come through adult victims. We don't study children in the same way that we study adults. And children don't have that same ability to give us history and to tell us the symptoms that they had. Some of that, clearly not studying a child is one of those things that we as a society feel really strongly about. We don't experiment on children. So when we are utilizing the literature and the information from adults and what they are able to tell us during a strangulation episode, we are also utilizing that information on our pediatric patients. The person we're talking about today is closer to adult than, say, a 6-year-old would be. So it's easier for me to say that the adult literature and the science that we know about strangulation will apply to her. And I might have had a more difficult time if I was talking about a 6-year-old strangulation child, simply because we don't have the same amount of science to talk succinctly and clearly about all the effects of strangulation on a child.
Okay. And when it comes to strangulation, Dr. Gilbert, how much pressure is needed for jugular vein occlusion?
Again, the jugular vein is like other veins in our body. It's a thin-walled vessel, and it requires 4.4 pounds of pressure to occlude the jugular vein.
And when you...
Hitting the pause button on this testimony.
Pause button again. Pause button again. Okay, hold up. We're gonna zip through. That's why I say y'all gonna have to bear with me because the court TV is doing some major change up.
In the attempted murder trial for Ihsan and Zahraa Ali.
Prosecutors say the two parents attacked their teen daughter, Fatima, in an altercation outside her high school in October of last year.
And we're listening to testimony from a pediatrician, Dr. Joyce Gilbert, talking about the injuries on the victim.
And when you when we talk about occlusion, what do you mean by that?
I mean compression, inability to have blood flowing through that blood vessel.
Okay. And is it fair to say when the jugular vein occludes, it is, lack of a better way of describing it, is in essence the jugular vein is closed off?
Correct.
Okay. And when you say 4 pounds of pressure, what do you mean by that?
To put that in context, pressure is a force, and the amount of force that it takes to close off the jugular vein is very small. It takes 6 pounds of pressure to pull the trigger of a well-oiled gun. It takes 20 pounds of pressure to open a can of peas with a flip top on it. A simple handshake between adults is between 60 and 80 pounds of pressure. So when I say 4 pounds of pressure, that's very little force to occlude or stop the blood flowing down the jugular vein.
Okay. And when you say the amount of pressure that it takes for an adult handshake, are you referring to, in essence, I describe it as a very firm grip handshake?
Actually, the very firm grip handshake is higher force.
Okay.
The science says that that's about 160 pounds of pressure. I'm talking about my handshake. My handshake as a female is about 60 to 80 pounds of pressure.
Okay. And you testified that jugular vein occlusion can sometimes result in loss of consciousness. How long does it take, based on your training experience, for jugular vein occlusion to result in loss of consciousness?
Again, according to the science that we have, it takes about a minute of occlusion of the jugular vein for a person to lose consciousness.
Okay. And then, Dr. Gilbert, are you familiar with the term petechia?
Yes.
And what is petechia?
Petechiae are the breakage of very tiny, small capillaries or blood vessels in our skin. Every cell in our skin is supplied with oxygen and nutrients by very, very, very tiny veins. And petechiae is a breakage of those veins that causes a red dot visible on the surface of the skin.
Okay. And can jugular vein occlusion cause petechia?
Yes.
And how does it cause petechia?
Again, it's the backup of blood without an area, without a way for that pressure of that blood to dissipate or go away. So when you have occlusion of the jugular veins, all of that blood that should be coming down from the head is backing up, and it backs up with pressure into those tiny little capillaries, those tiny little blood vessels in the skin. And so from the point of pressure upward is where you will see petechiae.
Okay.
Petechiae will be above the point of impact.
And for the record, you've been using your hands to demonstrate petechiae on the different parts of your head and your face.
Correct.
Okay. And besides petechia, well, let me ask you this question about petechia, Dr. Gilbert. When there is jugular vein occlusion, you testified it can cause petechia. Does it only occur in your eyes, or can it occur and appear on other parts of your body?
It can be anywhere above the point of occlusion. So we see petechia most commonly in the skin, in the lining of the eyes, so inside the eyelids, in the white of the eyes themselves. Petechia is a visible thing, but we can't look into the brain. If in fact we do, and we have a person deceased, there's petechiae all over the brain also. So it's the little tiny, tiny blood vessels that are rupturing, causing blood to leak out. And that can be anywhere in the head.
Okay. You testify that it can appear in the head, but also it can appear on the lining of your eyes. Can it also appear just on your face?
Yes.
Okay. And then based on your training experience, how long does jugular vein need to be occluded for petechia to be present?
Again, based on the science, it's about 20 to 30 seconds of occlusion to then break those blood vessels and cause petechiae.
Okay. And Dr. Gilbert, you testify that it takes about a minute to reach loss of consciousness from jugular vein occlusion. Let's say in a situation where external force is applied to the neck, such as from strangulation, and the jugular veins are occluded, and an individual loses consciousness. what comes after loss of consciousness if the pressure is not removed from the neck?
If that pressure continues, loss of consciousness can be followed by a seizure. It can be followed by loss of bowel and bladder control, and eventually it can be followed by brain death.
Okay. And when you talk about brain death, is that in essence when the person is also dead?
Yes.
Okay. And you talked about sort of, it takes around 4 pounds of pressure to cause jugular vein occlusion. I want to ask you some questions about that. Between when a person loses consciousness to when they eventually reach it, to eventually when they have a seizure from jugular vein occlusion, the amount of pressure, does that need to change or can it stay the same?
It can stay the same, or
Okay.
it can change. Actually, it can be both. And with just jugular vein occlusion, you can have a seizure before you lose consciousness.
Okay. And then with regards to jugular vein occlusion and the approximate 4 pounds of pressure, you testified that after loss of consciousness, there could be the seizure and then eventually there could be brain death.
Coming up, more testimony in the trial for parents Ihsan and Zahraa Ali. We're coming right back. Joyce Gilbert, she's a pediatrician and
Damage to the areas of the brain that keep us alive, our respiratory center, our blood pressure center, all of the things that are imperative for our body to be alive. Death by strangulation happens in the time frame very quickly. 3 to 4 minutes of occlusion can cause death. So it doesn't take very long to occlude those veins and arteries to then cause death.
Okay. And you testify that it takes approximately 3 to 4 minutes to reach brain death. Is that just from jugular vein occlusion itself?
That's a hard thing to say simply because when there's a strangulation event, typically there's occlusion of both the jugular vein and the carotid arteries. That's the arteries that are bringing the blood up to the brain. But occlusion of just jugular veins can result in death.
Okay. And so just want to make sure I understand your testimony that when external pressure is applied to the neck, the jugular vein will result in compression. Is that right?
Correct.
And then when jugular vein gets compressed, it can cause occlusion, which as it continues to be occluded, then loss of consciousness will occur.
Correct.
And then if once loss of consciousness happens and the pressure is not released, then the same amount of pressure can eventually cause brain death.
Correct.
Okay. And earlier when you testified about brainstem, you sort of described it as the powerhouse of the brain. Is it fair to say, if I'm understanding your testimony correctly, that a person's brain is somewhat, it can be compared to sort of like a computer?
That's the comparison we like to use. Yes.
Okay. And does the brainstem in the brain also sort of controls every aspect of our body?
It does.
And does it control how our body functions?
It does.
Okay. And with regards to let me ask you this question. With regards to the brainstem, when there is jugular vein occlusion and there is a disruption to the function of the brainstem, does it disrupt the function of the brainstem that controls all aspects of our body and how it functions, or can it just control certain aspects of our body?
The brainstem controls all of our non-thinking aspects of our body. So again, breathing, blood pressure, eyesight, just everything that we do without thinking about it, heart rate, all of those things are controlled by the brainstem. But the brainstem is the combination of all parts of the brain feeding into the brainstem, which then gives the signals and the information to the body. So when there's damage in the brain, then that damage is interpreted by the brain stem. When there's damage to the brain stem, then we have serious complications within our body. Our heart rate doesn't work well. We don't breathe on our own. We're breathing all the time without thinking about it. That's our brain stem. So when the brain stem is impacted or injured, all of the things that we take for granted are not happening.
Okay. And have you heard of the term cerebral edema?
Yes.
And what is cerebral edema?
Cerebral again means brain, edema means swelling. So when there's occlusion or pressure on the jugular veins and all that extra blood is staying up in the head, it's causing intense pressure and swelling of the brain cells.
Okay. And the intense pressure and the swelling of the brain cells, how does that impact the human body?
In a very negative way. Every aspect of the brain is impacted by that excess pressure. And when we have excess pressure in the brain of an adult or essentially anybody over the age of 2, we have no way to release that pressure. When you're under 2 years of age, all of your bones aren't glued together yet. And so the bones can expand and can absorb some of that pressure. But over the age of 2, our bones are all glued together in our head. So there's no way to let that pressure out. And so that's why all the brain cells get so impacted or damaged by that elevated blood pressure in the brain.
Okay. And can cerebral edema also result in brain death?
Yes.
I want to ask you some questions about switching topics from jugular veins. I want to ask you some questions about the carotid artery. What are carotid arteries?
So the carotid arteries are the thick muscle-walled blood vessels that are coming straight out of the heart, out of the aorta, and up through the neck to provide oxygenated blood and nutrients to the head and to the brain. The jugular veins on the outside, the carotid artery is on the inside, and then the windpipe, the trachea, is right in the middle. So the carotid arteries are protected by the jugular vein on the outside and the windpipe on the inside. Arteries, thick-walled, are very important to any part of our body to bring that oxygenated blood and all the nutrients that our cells need.
Okay.
And Dr. Gilbert was using her hands to demonstrate her discussion of arteries and where they are located as she was testifying.
Thank you, Your Honor. And Dr. Gilbert, you testified that the carotid arteries are responsible for bringing oxygenated blood into all parts of our body. Does that include the brain?
The carotid arteries are bringing oxygenated blood to the brain. Arteries bring oxygenated blood to every part of the body. But the carotid arteries specifically their job is to bring oxygenated blood to the brain and the head.
Okay. And with regards to oxygenated blood, is it fair to say that oxygenated blood contains oxygen?
Correct.
And so therefore it contains the nutrients that our body, or in this case, our brain, needs to function properly.
So in addition to oxygen, there's many other nutrients, the glucose and all of the substrates that our cells need to be able to survive. All of that is carried through the artery.
Okay, to include the carotid artery.
The carotid artery, correct.
And why would external pressure on the carotid arteries cause blood flow to be compromised?
Again, if the pressure is occluding the carotid arteries, no oxygenated blood is coming up to the brain. So it's not providing the things, the substrates, the things that each cell needs to be able to function. no oxygen, no glucose, no other nutrients. None of that is coming up from the heart and the lungs if there's occlusion of the carotid arteries.
Okay. And you testified earlier about some of the physical symptoms that a person can experience when there is a jugular vein occlusion. What about when there is carotid artery occlusion? What are some of the physical symptoms that a person can experience?
We're hitting the pause button on this testimony so we can get to a break. But first, let's bring in our guest for this hour. Still with us from Los Angeles, California, we have criminal defense attorney Marie.
They will faint.
And Zahraa Ali, get you back inside the courtroom, where the jury is hearing from Dr. Joyce Gilbert, a pediatrician who treated the victim, Fatima Ali.
Again, the symptomatology is they have visual changes, they have breathing changes, they have panic, the emotions of not getting oxygenated blood and nutrients. They have motor skill symptomatology. Eventually, with compression of the artery, they will faint and they may stop breathing.
Okay. And with regards to, you testified with regards to jugular vein occlusion, the impact on the brain is due to the dysfunction of the brainstem. With regards to carotid artery occlusion, is it the same idea behind it?
The carotid artery occlusion actually is much more global because the artery is bringing the nutrients to every single cell in the brain. And so again, in a strangulation episode, it's hard to differentiate because generally when you're being strangled, you're going to have occlusion of both the jugular vein and the carotid artery. But the carotid artery has more impact in every aspect of the brain because every single cell in the brain needs the oxygen and the nutrients.
Okay. And what are some complications that can occur from lack of oxygenated blood traveling to the brain?
Again, loss of consciousness, inability to control movements, seizures, eventually brain death will occur because every single cell is lacking the oxygen and the nutrients that they need.
Okay. And have you heard of the term carotid sinus?
Yes.
And what is that?
The carotid sinus is a tiny little powerhouse in the carotid artery. We can't actually see it. It's not something that you see like on an x-ray or a picture. It's a nerve cell area right inside the carotid artery. And the carotid sinus helps control heart rate and blood pressure to a maximum amount. So for instance, if your blood pressure falls just a tiny bit, your carotid sinus tells your brain, again, comparison to a computer, tells your brain, well, we got to fix the blood vessels throughout the body and fix the heart rate to fix the blood pressure. It is a minute control center for heart rate and blood pressure.
Okay. And when there is pressure applied to the carotid artery, say from strangulation, can the carotid sinus be impacted?
Oh, yes.
And how does that get impacted?
So we have something called a carotid sinus reflex. When there's pressure on the carotid sinus and the blood pressure falls and the heart rate falls, then the brain immediately tries to correct that. And it tries to increase blood pressure and increase heart rate. Of course, with occlusion of the carotid arteries, that process is thwarted. It doesn't work well. But that's what the carotid sinus is meant to do. When there's any pressure there at all, then its job is to fix the blood pressure and the heart rate for the body.
Okay. And if the blood pressure and the heart rate for the body goes down, and let's say in that situation, and the carotid sinus cannot sort of speak to the brain, so to speak, what ends up happening to the heart?
So again, with a low heart rate and a low blood pressure, eventually death.
Okay. And Dr. Gilbert, you testified earlier about the compression of jugular veins can cause muscle tone loss. Do you remember that?
Correct.
And if there is muscle tone loss from the compression of the jugular veins, what, if any, effect will that have on the pressure to the carotid artery?
I'm not understanding the question.
Okay. I will go back to that question. With regards to the amount of pressure for carotid artery occlusion, how much pressure is needed for occlusion to happen?
So remember, jugular vein occlusion is 4 pounds. Carotid artery occlusion is 11 pounds. Still not very much pressure compared to the other examples I gave you of what we need pressure for.
Okay. And with regards to carotid artery occlusion, you testify that it can result in loss of consciousness. How long does it take for loss of consciousness to occur?
Again, this is much quicker than with the jugular vein. Loss of consciousness with carotid artery occlusion will be within 20 to 30 seconds.
Okay. And then once loss of consciousness occurs from carotid artery occlusion, in essence, what comes after loss of consciousness if the pressure is not released?
Eventually, death.
And the amount of pressure that it takes to cause carotid artery occlusion, you testified that within 20 to 30 seconds, it can cause loss of consciousness. And then you testified that after that, it will result in death if the pressure is not released. In order to result in death, does it require more pressure or can it be the same amount of pressure?
Just the sustained pressure, same amount of pressure sustained.
And then how does carotid artery occlusion, how can that result in death?
Again, lack of blood flow into the brain, lack of oxygen and nutrients to the brain. Every single brain cell is impacted by that. And most importantly, of course, our heart rate, our respiratory rate, and our blood pressure are the 3 big things that are impacted that will eventually lead to death.
Okay. And approximately how long does it take to reach death from carotid artery occlusion?
Again, the science says 1 to 3 minutes for carotid artery occlusion to lead to death.
Okay. We talked about the medical definition of strangulation is when there's external pressure that compromises blood flow and airflow. I want to ask you some questions about compromise of airflow. How does strangulation, the external pressure on the neck, how can it impact or affect airflow?
So our trachea is our windpipe. It's in the center of our neck. The trachea comes from the back of the mouth. So we breathe in through our nose and our mouth, and the air goes in through our vocal cords where our voice is. And then our trachea connects to the lungs, and all of the, it's like a super highway. All of the tubing that comes off of the trachea sends oxygenated blood to every air sac in our lungs. Then when the air is exchanged, the carbon dioxide, the bad air, comes back up through the trachea and we breathe it out. We don't think about this, we just do this. Breath in through the trachea, everything exchanged in the lungs. Breath out through the trachea, all the bad stuff goes away.
Okay. And for the record,
Jurors are certainly getting a lesson on how the body works.
Yeah.
Really, there inside of the courtroom. We do have to get to a break before. For allegedly trying to grab the girl's boyfriend. Now, the focus right now is on the victim's injuries. We have a pediatrician on the stand, Dr. Joyce Gilbert, who is talking about what happens. It really sounds like an anatomy lesson. Let's go in.
Yeah, I will tell y'all, I don't feel like we're going to get full testimony watching it this way, which really sucks because all their little breaks and little interruptions, and I mean, you know, they have to do it, whatever, but yeah, I just feel like we're missing some.
record when you were explaining airflow compromise and talking about trachea, you were demonstrating it on your own body.
Yes.
Okay. And with regards to, and which part of the human body is affected when there isn't enough airflow?
Well, everything's impacted, but immediately the impact is in the lungs. When there's occlusion of the trachea, air isn't getting in to the lungs, air isn't getting out of the lungs.
Okay. And this might sound like a silly question, but does a person's lungs need air to function?
Yes.
And when airflow is impacted, say from strangulation, what are the symptoms that can manifest?
Our body is so amazing. There is immediate panic when there is occlusion of the trachea because our body wants oxygen in and carbon dioxide out. So the first response with any pressure to the trachea is panic and try to breathe. The patient, the person who is being strangled, is fighting and working and trying to take in deep breaths. And with occlusion of the trachea, no air is going in or out. So the air that was in the lungs is trapped, and the air that wants to come in is not able to pass through that obstruction.
Okay. And you testify that with regards to the function of the trachea, in essence, I believe your testimony is air goes in and the air comes out in the form of carbon dioxide. Is that right?
Correct.
And what happens when there is occlusion to the trachea or airflow is impacted and carbon dioxide does not come out and it stays in our body, let's say in our lungs? What, if any, effect can that have?
So again, the carbon dioxide is the bad air, the toxic substances that come from the cells doing their job every day. It makes carbon dioxide. So if that is staying in the lungs, there's a number of things that happen. The carbon dioxide is building up in the body, so all of the cells in the body are impacted by that. But also the pressure of having the air trapped in the lungs can cause the air sacs, the tiny, tiny little air sacs in your lungs to rupture because that pressure is building up as the carbon dioxide is being trapped in there.
Okay. And what about the spinal cord? Can strangulation have any impact on the spinal cord?
Yes, it can.
And how can it impact the spinal cord?
Again, depending on the method of strangulation, the spinal cord is in the neck. It's in the back part of the neck. So everything we were just talking about is up front, the jugular vein, the carotid artery, and the trachea. The spinal cord is in the back. But with the right amount of force or the right hold for strangulation, there can also be damage to the cervical neck bones, and those cervical neck bones are protecting the spinal cord.
Okay. And Dr. Gilbert, do you know someone by the name of Fatima Ali?
I do.
And how do you know Fatima?
So as my job in the hospital, as a pediatric-based hospital medicine doctor, I was on service on the Saturday that Fatima was a patient in our pediatric floor.
Okay. And you indicated on the Saturday that Fatima was a patient on the pediatric floor. Would that have been October 19th?
That's correct. That's the date that I would have worked. I work Saturdays for a 24-hour shift consistently. And so my Saturday was that October 19th when Fatima was a patient.
Okay. And you indicated on Saturdays, it's your day to work. It's your day to work a 24-hour shift. What do you mean by 24-hour shift?
Our shifts start at 7 o'clock in the morning. Some of my team, there's 6 of us. Some of us work just a day shift or a night shift, and some of us work the day and night together. So when we work a 24-hour shift, we work from 7 o'clock in the morning to 7 o'clock the next morning.
Okay. And were you one of her treating physicians while Fatima was admitted to the pediatrics floor at Providence?
Yes.
And are you familiar with a doctor named Dr. Jamie Murphy?
Yes.
And how do you know Dr. Murphy?
Dr. Murphy is one of our 6 pediatric hospital-based doctors. She was the doctor working the night shift on Friday, October 18th, when Fatima was admitted. She was the admitting doctor. In other words, the emergency room had taken care of Fatima and determined that she needed to stay in the hospital for ongoing observation. So the emergency room doctor contacted Dr. Murphy to admit her to the pediatric floor.
Okay. And are you familiar with a doctor by the name of Dr. Parliament?
Yes.
And how do you know Dr. Parliament?
Dr. Parliament is also one of our 6 pediatric hospital-based physicians. He is actually our lead or our boss over the 6 of us. We're all employed by Seattle Children's Hospital. Dr. Parliament also was a doctor that took care of Fatima during her hospital stay.
Okay. And based on your training experience, when you are a doctor that is also a treating physician for a patient, do you document your observations or what you did as far as it relates to that patient in what's essence called chart notes?
Yes.
And are chart notes contained in a patient's medical records?
Yes.
And as one of Fatima's treating physicians, would you be able to review her chart notes?
Correct. Yes.
And do you have the ability to review her chart notes before you started your 24-hour shift?
The way we do it, we do what we call sign out from 7 o'clock to 7:30, and we get a brief report from the person going off shift as to who the patients are and what's going on. Typically, we don't know what's going on before our shift starts. And so after 7:30, we then do a complete chart review on each of the patients that was just signed out to us. So that's when I would.
Hitting the pause button and bringing back in criminal defense attorney Marie Pereira. Marie, we are
Stop
getting
hitting
close
that
to the
pause
state
button.
resting their case in chief, likely tomorrow. How should they end their case?
And done a complete chart review.
And they are talking about the state being completed with their case tomorrow. So, that will, okay, court TV, stop.
That to the jury.
That's when I would have looked at Fatima's chart and done a complete chart review.
Okay. And then as a physician that with Providence St. Peter's Hospital, do you also have the ability to review a patient's chart notes even or medical records even after they have been discharged from the hospital?
I do, as long as I have a reason to do so. I can't get into a patient's chart for no reason. But to give adequate medical care, I need to look at the chart notes every day that we are giving service within the hospital. And then sometimes after discharge, if we are doing follow-up or there is a reason, maybe there's some lab tests that were not completed and I need to follow up on that, then I can open the chart and continue to give care to that patient. But I can't just randomly say, oh, today I'm going to go look at Joe Blow's chart and do it without a reason.
Okay. And with regards to Fatima, was there follow-up evaluation or care that was provided to her at Providence Abuse Intervention Center, in which you're a medical director of?
Yes, there was.
Okay. And Dr. Gilbert, based on your training experience with strangulation, can strangulation also cause a seizure?
Yes.
Okay. And what is a seizure?
A seizure is abnormal muscle movements, and it comes from, again, the motor part, the central part of the brain. If there's a lack of oxygen to the motor part of the brain, then the message from the brain to the muscles is a spasmodic seizure. And generally that looks like one part of the body or the entire body shaking uncontrollably. When somebody's having a seizure, you can't stop it by holding the muscle. When somebody's just trembling, if you hold their muscle, you'll stop the trembling. But when somebody's having a seizure, that excess muscle movement is coming from the brain, and it occurs because lack of oxygen. There are actually many other reasons also to have a seizure. Sometimes children have a seizure from a fever. Sometimes somebody gets brain cancer and they have a seizure because the cancer is doing abnormal things. But when we're talking specifically about suffocation, the seizure is coming from lack of oxygen to the motor part of the brain. And whichever part of the motor part of the brain is impacted will define whether an arm has a seizure or a leg has a seizure or the whole body has a seizure.
Okay. And based on your training experience, you indicated the lack of oxygen going to the brain can result in a seizure, and you also testified depending on which part of your body is impacted. Is it your testimony that when the lack of oxygenated blood, when oxygenated blood is not traveling to the brain, that it could be a situation where only a certain body part is impacted that results in a seizure?
A certain part of the brain may be more impacted that results in a seizure. Yes.
Okay. And Dr. Gilbert, based on your training experience as a pediatrician and then also as a pediatrician with the subspecialty of child abuse, have you ever seen any of your patients that have had a seizure?
Yes.
Okay. And during your involvement with this case, during the course of your involvement with this case, were you at some point made aware that there was a video taken by a student capturing the incident at the bus stop in front of Timberline High School?
Yes.
Okay. And prior to your testimony today, did you have a chance to review that video?
Yes.
All right, talking about reviewing some of the video there. We're working in criminal defense attorney Marie Ferrer. Marie, I want to ask you, some people are writing in, can they slow the video down? They really want people to be able to see this hour, where testimony is underway in the attempted murder trial for two parents, Ihsan Ali and Zahraa Ali. Now, prosecutors in this case, they are expected to rest their case tomorrow. They say these two parents attacked their daughter at a school bus stop last year. It's an incident that was caught on camera, not only by to show this father, her ultimately the jury, that she did run away from Iraq. Gilbert, that was
Call the cops!
See, this is yesterday's stuff. This is yesterday's stuff.
The video for earlier right around with their, based on your training, if you're about the
It was purpose. So the relaxing.
All right, we're back to live.
And with regards to when a patient has a seizure, after a situation where they have a seizure and CT scans or x-rays are done on their brain, are you able to, just based on the review of the scans or the x-ray, tell that they in fact had a seizure?
No, the cellular damage at the cellular level, we can't see that on CT scans or angiograms or any of our imaging. So we can't tell that there was brain damage in that one area unless there was something much greater, such as a stroke or something that would show up on a CT scan. But you can't define a seizure based on a CT scan.
Okay. And with regards to, you indicated that if it was something greater, such as a stroke, that can cause it, that you can view it. If a stroke caused a seizure, you can view it on the CT scan. When in that situation, when you're reviewing the CT scan or the CT angiogram scans, is it the seizure itself that you can see, or is it the stroke or what's causing the stroke that you can see on the scans?
That's correct. You see an abnormality in a certain part of the brain. A stroke is a lack of oxygen for some reason to a certain part of the brain. And that lack of oxygen can cause cell death in that part of the brain. But what you see is the evidence of the stroke. So you might see a ruptured blood vessel or an occlusion of a blood vessel in the brain on the CT scan, and it might correlate with the part of the brain that could have given that person a seizure.
Okay. And as part of being one of the treating physicians for Fatima while she was admitted at Providence St. Peter's Hospital, did you also review the exam that was conducted by the forensic nurse examiner, Synovia Rivas?
Yes, I did.
Okay. And on that exam, were you aware of the portion that documented some of the questions that was asked Fatima, such as whether she had a headache or whether she had a sore throat?
Yes.
And did you in fact review what her responses were?
Yes, I did.
Okay. And based on your training experience, Dr. Gilbert, the exam, when Ms. Rivas did the exam, there was the indication of Fatima indicated she had headaches. What is the relationship between a strangulation and headaches?
Again, the headache is typically caused by the backup pressure from occlusion of the jugular vein, and that excess amount of blood in the head will cause the headache.
Okay. And we also heard that there was also the feeling of dizzy or lightheadedness. Is the relationship between strangulation and feeling dizzy or lightheadedness also what you described earlier with regards to the combination of the buildup of deoxygenated blood and or the lack of oxygenated blood traveling to the brain?
That's correct.
Okay. And we also heard testimony there was loss of consciousness. Is that also due to what you described earlier from that it could be one of the effects of strangulation due to lack of airflow or lack of oxygenated blood traveling to the brain or buildup of deoxygenated blood? Correct. Okay. And we also heard testimony about memory loss. Is that also the relationship between strangulation and memory loss? Is that also caused by what you described earlier?
Yes, our memory is laid down in a small little area of our brain called the hippocampus. And the hippocampus is right in the center of the brain. When there is lack of oxygen to the brain, the hippocampus shuts down. So we can't put down memory for a situation that's happening when we have a lack of oxygen because of that situation. So it's very, very common for strangulation victims to have altered memory or sometimes even no memory of the event itself.
Okay. And what about weakness or numbness? We heard from Ms. Rivas that Fatima also indicated she had weakness and numbness. What is the causal relationship between strangulation and that?
Again, the lack of oxygen to the motor center of the brain will cause the weakness and the loss of motor control.
Okay. We also heard there was vision changes for Fatima. The causal relationship between strangulation and vision changes, is it the causal relationship? Is it based on what you testified to earlier?
Yes, the lack of oxygen and the buildup of the pressure will affect the vision center of the brain, which is the back of the brain.
Okay. And what about ringing in ears? We heard that she also she also felt ringing in her ears. What is the causal relationship between strangulation and that?
Again, this is another brainstem function. Our hearing is directly related to the brainstem cells. So when there's damage to those brainstem cells from the occlusion of the artery, the vein, and the trachea, ringing in the ears is a very common symptom.
Okay. And what about sore throat? What is the relationship between strangulation and sore throat?
So the trachea is the big windpipe right in front of the esophagus, which is our swallowing tube to our stomach. And right in that area is our vocal cords. And we actually have sensation in our mouth and the top part of our throat. And then we don't have the same kind of sensory nerves once we get past the airway. Sore throat comes from, again, the pressure of the strangulation. And in the part of the throat where we have sensation is where we experience that sore throat symptom. We have a hoarse voice or a crackly voice, difficulty swallowing, and sore throat symptoms are very common after strangulation.
Okay.
And Dr. Gilbert was using her hands as she was describing that portion of her neck and throat.
Thank you, Your Honor. And we also heard there was difficulty or pain with swallowing. And what is the causal relationship between external pressure to the neck and pain or swallowing?
And again, where our mouth goes into the throat region and we're swallowing saliva or food, there is still sensation there. So that pressure causes that discomfort. Swelling can also occur, causing discomfort for swallowing.
Okay. And when you're talking about the pressure that can cause the discomfort, are you referring to pressure to the trachea or pressure to the jugular veins or carotid arteries?
The position of the pressure is on the trachea, but it's giving pressure to the esophagus and the throat, which is right behind the trachea.
Okay.
Yes.
And then what about hyperventilation? What is hyperventilation?
Hyper means increase, ventilation means breathing. So it's an increased rate of breathing.
Okay. And we heard that Fatima during the strangulation exam also indicated she had hyperventilation. What is the causal relationship between strangulation and hyperventilation?
So when you're strangled, when your airway is occluded, your immediate response is to try to breathe. It's a very primal instinct to stay alive and try to breathe. Fatima did this and she described to us that she felt that it was hard to breathe and she couldn't catch her breath during this episode before she became unconscious. Once she woke up, the brain is on overdrive, telling her to continue to breathe and continue to breathe. And the hyperventilation comes from the strangulation episode, as well as from the anxiety that goes along with having your airway occluded. So even by the time she got to the hospital, she was still working hard at breathing. She was still afraid that it was not going to work well for her because of that strangulation effect. Gradually, over the time in the emergency room, her hyperventilation symptoms diminished. By the time she got to the pediatric floor, she no longer had that sensation or those symptoms.
Okay. And we also heard testimony that there were, well, let me ask you this question. Can strangulation cause abrasions on the human body?
Yes.
And what are abrasions?
Abrasions are breakage in the skin, the superficial skin, causing redness or marks or scratches or even sometimes true lacerations. So any force applied to the skin can cause an abrasion.
Okay. And how can strangulation cause abrasion?
The amount of force in the episode of strangulation around the neck, sometimes on the face or the chest, all depending on where the pressure is being applied during that episode, will cause damage to the superficial skin.
Okay. And based on your training experience with strangulation, can the individual that is, in essence, being strangled, can they also cause the abrasion to occur?
Yes, in the process of trying to breathe during strangulation, sometimes the victim themselves will put their hands up by their neck or will move in a way that causes or increases the amount of abrasions seen.
Okay. Your Honor, I think this may be a good stopping point for the morning break.
You still have a ways to go with this witness?
Yes, Your Honor.
All right. So members of the jury, we're going to go ahead and take our morning recess at this time. Thank you very much, of course, for your
Court is
time.
dismissed.
Okay. Yes. Yes. It's true. I don't know how to make this go away. He passed away after doing his farewell show. Let me see if I can find a different one. Here's the sun. Rock legend dead, Ozzy Osbourne dead, Black Sabbath singer dies at age 76. We chat for touching his final show. I don't want to get dinged. Oh, comes just weeks after the Black Sabbath star took stage one final time with his bandmates at Villa Park in Birmingham. The rocker vowed, however, it would be his final performance due to his deteriorating health and having opened up about his battle with Parkinson's in 2020. Oh. Guys, that's just horrible. Yes, Reginald, we saw that yesterday. Wow. Okay, guys, wow. Oh, Hector's going to be so upset. Hector's going to be so upset. Okay. I'm going to make me a little smaller picture here so I'm not so in her way. Oh, I don't like that one. I don't like that circle thing. Okay. Put me down here. I'm going to play this. I'm going to hit play on this, and I will be right back. I'm going to go to the kitchen. The other one, I'm just kind of letting it roll in the background. And yeah, that way we can fast forward through some of the breaks and everything. Yeah, because that's court TV is just doing some change up. But I am determined to finish this trial because I'm invested and I'm interested. I feel like we're missing some of the testimony. But y'all, I'm really upset about Ozzy. I'm telling y'all. Yeah, we bought the concert and watched it and everything, and I got dinged on YouTube for downloading it. But anyways, we won't go there. I'm going to hit play on this, and I'm going to go make Hector's eggs.
Hey there, true crime friends. Listen, are you obsessed with the case that I am obsessed with? I am positively obsessed with the case of the state of Western Idaho to Iowa.
And we have to just let Kathy do her thing because she is the bomb at this. And the way she explains things is so off the rails, hilarious. I love her. So here we go. Let's roll, Kathy. And I'm going to go finish cooking for Hector, and I'll be right back.
Versus Ali and Ali, the so-called honor killing that, so that you know, so that we're clear for the record, there is no honor and unfortunately unaliving anybody. That is not a thing. But look, because I need to talk about this case, you know how we do, to phone a friend so we could come and have detailed conversations to understand the cultural context and sort of anything else about this case. So please, please, please welcome to Gossip Rumor and Inuit. I cannot say the name of my channel today. I'm so excited. Please help me welcome Ravi. Hi, welcome.
Hello, true crime friends.
I'm so glad you're here.
I'm so glad to be here. I love this channel, and I love the chats
Oh.
in the comment sections. And it's just like, it's great. I'm so glad I found this place.
Thank you, thank you, thank you. It always blows my mind that like when I'm sitting, in my living room at 4 a.m. shouting into my iPhone that other people are actually going to see it. It never feels real.
Yeah.
And you're all the way over in California. So look, maybe not everybody is following this case. So I'm just going to give everybody the quick and dirty, right? So Fatima Ali, who was at the time of this crime, she was she was a senior in high school, 17 years old. She comes from a very conservative family. I don't know if they're religious or not. I do know that they are, they cover their heads, they cover their bodies. They seem to be very conservative, the women. And so sort of like a very sort of buttoned down family of 5 kids. Fatima is the second oldest daughter from what we can tell from sort of the family structure. And she goes off to school. She meets this boy, Isaiah. They become friends. And she has all these sort of like American, regular friends there in Washington State. And something tells me the parents are not exactly thrilled about all these friends who are sort of, wild and out here and doing whatever. She has a boyfriend, and it's pretty clear her parents think she should not have a boyfriend. There was some altercation between the boyfriend and the mom where the police get called, and the parents of the boy, Isaiah, who is a young Black boy who's a year younger than Fatima, Isaiah's parents are like, no, what you're not going to do. Like, So the parents go down and get a restraining order to keep to keep Fatima's mom, Zahara, away from Isaiah. I believe that the mom choked, did something like physical violence to this teenage boy, which is crazy.
Yeah.
And so the parents are like, okay, great. We have this restraining order. Everything is going to go terrific now. Meanwhile, the Ali family is like, we're going to take our daughter out of school. They take her out of school, and they decide that they are going to take her back to Iraq or Iran? Iraq. They're going to take her back to Iraq. They're going to marry her off in like an arranged marriage to some older gentleman. And they didn't give her all the details, but she's like, arranged marriage time. This is a problem. So she runs away from home. She goes to the school. The school's like, okay, we'll set you up at like a shelter or whatever. Hey, Fatima, everything is all set. You have everything you need. Just go on out there to the bus stop. And so she goes to the bus stop. She's at the bus stop with her boyfriend. Her dad shows up and says he wants to talk to her, goes to grab her. And Isaiah's like, hey, back up off my girlfriend. The dad gets pissed, punches Isaiah in the face, jumps on Fatima, puts her in the chokehold, and chokes her until she is unconscious. All the kids at the bus stop come running up, beating on the dad. The bus finally comes. The bus driver gets off the bus, bypassers, sort of everybody piles in, gets the dad off of Fatima. Fatima runs away a little bit. Her mom is there. Her mother then tries to choke her, which is crazy to me. Finally, Fatima and Isaiah run off into the school where they are safe. The dad gets arrested and carted off to jail, and then he gets released. I was not aware of this until yesterday. The dad gets released. The police continue to do some investigation, and then they arrest the mom for her close proximity to Isaiah. Also, for DV against her child. At some point, the mother went to Canada before she was released. And I'm not sure if that was considered her fleeing. She was visiting relatives. I don't know what the story was, but I know the mom left and went to Canada. The parents were both brought back to jail there in Washington State. And both parents are now awaiting trial on the attempted unaliving of their daughter, Fatima, the battery on Isaiah. And the media is calling this an attempted honor killing. I don't know whether or not this is an honor killing. This might just be run-of-the-mill domestic violence, and that's a little bit of what we're here to talk about. But for anybody watching this, please know we will not at all be showing the video of the father attacking the daughter. I do have some body cam video of the aftermath, the family having conversations so that we can discuss the dynamics in this family. So did I cover everything? I think that was the quick and dirty of it all.
Yeah, absolutely. Absolutely. I think it's such a complex situation. It's been going on for a while and sort of like gathering steam. Yeah, I think that's a good summary. And the trial started last week. The trial started
last week. I'm obsessed with it. I watch it every single day. I can't turn away. And then there's all these little bits and pieces that keep coming out in the media that have me shook. Number one, when on the police body cam, when the dad gets arrested, you see him shouting something in Arabic. Well, I don't speak Arabic. I didn't know what he was saying. They had somebody translate it. And apparently I thought he was saying, in English, he's saying, tell my wife to come here. I want to talk to my wife. And then I was like, okay, he just got arrested. He wants to talk to his wife. But the thing he's saying in Arabic reportedly is, get my car. I don't want my car left over here. He's not worried about his child. He's not worried about being arrested. His concern is that these people might steal his car.
Yeah.
With no care or concern for his child.
Yeah. Either of his children, because I think one of his other daughters is there. The mom is hysterical, right?
Yes.
And so it's not like, darling, I love you. I'll be okay. Calm down. It's going to be okay. It's not, one daughter, take care of your mother. Like, it's none of that. It's make sure my car doesn't get stolen.
Right.
With high school riffraff.
But just punch me out in the face and stop me from committing a crime.
And the thing is that, like, I think part of I think just going to the two kids, it is such I think I texted you this, listening to Isaiah, he's such a nice young man.
Right? A sweet boy who's trying to protect his little girlfriend. They're not like gonna live happily ever after. It's high school sweethearts. But for me, I'm like, listen, I was undateable in high school, but I have kids in that age range and they have these little girlfriends, and it amounts to like, the girl painted my son's fingernails some crazy color. And I was like,
that's a high school promise ring now. It's happened to nieces of mine too. Yeah. That's what they do. That's what they do.
I'm like, I don't love this, but I was like, what is happening? And he's very close mouth, like nothing. I was like, is this what all the kids are doing now? Like, what's happening?
Apparently.
But from a cultural perspective, right?
Yeah.
I think it's so important that we talk about how culture plays a part in this. I come from a conservative Christian household. I personally was the rebel. I'm the one who would have been getting choked out on the sidewalk in my family, honestly. Honest to God. I was saying, I think it was in a members only last night, how when I was like a teenager, I refused to be baptized. I didn't want to go to church. I would rather work on Sundays instead of, I would arrange my work schedule. And my mother was furious. But if you were sick, if you were dead, if you were dying, you go lay on that back pew and you get the word. You're going to get the word. So help me understand how this relates in this Iraqi culture. Like, what does that look like?
Sure. So I think let's maybe start with the funeral potato scheme. Like, let's locate ourselves in your very sociologically very valid and revolutionary scale of religious craziness. Okay.
So that means we have to start by explaining what the funeral potato scale is.
Sure. You do that, and then I'll do my adaptation.
Okay, great. So when we did a phone a friend LDS edition, and we talked about the funeral potato scale, which I legit just created off the top of my head one morning while making a video. So for our LDS/Mormon friends, there are levels of Mormonism. Those who are just like, they believe the Mormon-y things, but they're not taking it too seriously. Like take some, leave some, whatever. Those are the diet Mormons. They're not super duper Mormon at all. Then you have the regular go to church every Sunday. They have family home evening. They believe all the things. They've been to the temple. Those are your regular average friends and neighbors. We like the funeral potato Mormons. If somebody dies, they will bring you the casserole that is famous among our Mormon friends, funeral potatoes. We call them the funeral potato Mormons. Think Nate Eaton, right?
Right.
Think any Mormon person that 90% of Mormons that are going to be funeral potato Mormons.
Yeah.
The step above funeral potato Mormons are better than you Mormons. There's a better than you group there's a better than you Cub Scout mom. There's a better than you HOA member. There's always a better than you group. They do all the Mormon-y things. They do all the extra everything. They're just better at it than you. And they're going to tell you all about it. And no matter what kind of Mormon you are, they think they are a better Mormon than you, or a better Cub Scout mom than you, or a better whatever. And sometimes, periodically and from time to time, if they study too much and if they fall too deep down the rabbit hole, our better than you Mormon friends become zombie Mormons. Lori Vallow Daybell is a zombie Mormon. She thought Jesus told her it was okay that she could unfortunately unalive people and it didn't count because those people who were not doing the right things, they were zombies.
Right.
And so she, according to her, could take them off this mortal coil because they were zombies anyway. She dehumanized them. So it didn't matter. So if we think in terms of the funeral potato scale, talk to me about where this family would fall culturally.
Sure. Well, and I'll just put my cards on the table in terms of background, right? So I would say a lot of my family, my grandparents, my dad, my mom, we're sort of diet Muslims, right? And well, I call us lushes, honestly. So there's this very famous story. I don't know if it's true, but who cares? Mm-hmm. So the British are wandering around India, and eventually in the 18th and 19th centuries, and eventually they decide to we're just going to conquer the place and loot it for all it's worth, right? That was how they
do with everybody. Like they do with everybody.
Exactly. So they conquer the Mughal Empire, the remnants of the Mughal Empire, and they're interviewing members of the emperor's court and deciding to what they're going to do with them. And so one of the court poets gets interviewed, and they're like, "Are you a Hindu? Are you a Sikh? Are you a Muslim?" And he's like, "I'm half a Muslim." And the British guy's like, "Oh God, what? What does that mean?" And he's like, "I don't eat pork, but I love wine." Right. And so there is a whole segment of somewhere between diet Muslims and funeral potato Muslims. There's a Venn diagram that encompasses a little bit of both groups. That's about the booze. We're luscious. We love wine. And when I've been thinking about when I explain where I come from in the Muslim world, I often use that of this is one of the big. Right. And so you've got, and it even extends farther because there's this idea of being drunk on love. It's a very common theme in Muslim poetry. So when I talk about the Muslim world in my head, I'm thinking from Morocco to Indonesia, right? These are all, and down into sub-Saharan Africa and up into Turkey and the Central Asian, Islam, India is one of the biggest Muslim countries on the planet, right? There are large Muslim minorities in a lot of countries, and then there are lots of countries with Muslim majorities of various stripes. And so this idea of being drunk on God, right? The whirling dervishes, they don't drink liquor, but they're drunk on God, ecstatic experience. Then there's in our poetry, the idea of being drunk on God or drunk on love. Right. And the love of God and the love of romantic love and ishq, right? This is a big theme in our poetry and our culture. Bollywood movies, right? Think Bollywood movies, this is all, and this is going back centuries. We've been this for this is a thing.
Right.
And instead of funeral potatoes, what we have are kebabs. So again, from Morocco to Indonesia, we put on a really good spread, my friends. And we have grilled meats of various kinds. We all have different grilled meats.
Love grilled meat.
Exactly. And most of us have a rice pudding of some sort.
Oh,
We're very into, yeah, this is another thing we all seem to have in common. None of us we're not vegetarians. Like Muslims are just not vegetarians. The closest we get is like fish, like we eat fish, right? Like South Indian Muslims, Bengali, Bangladesh, they'll eat fish, right?
yeah. Yeah.
And so that's like a big chunk of us, right? Like that's one of the big things. And then I would say like the better than yous for a variety of like sociological, historical reasons. I think the better than you thing is bigger, right? Like the sort of socially conservative, very serious is bigger than it is among Christians even, right? Like it's
Interesting.
And I would say I was like thinking through my cousins, because my family's pretty progressive and has been for a long time, but my cousins are not, right? So like my father's sisters became much more conservative than we are, right? And so and on both sides of the Muslim side of the family. And so when I think of my cousins, their stories, people I grew up with, people I've known, one of the big things that you kind of don't know what flavor of better than you. Like arranged marriage is one of those things and this is again like pretty uniform across most Muslim communities. I'm generalizing, but it's pretty uniform where around the time like 16, 17, you start figuring out what kind of flavor your parents are. Because it becomes a thing of like, are they the kind of better than you that's like, I want you to meet, my friend has this nephew, he's going to the same college, right? Like you go to college and they're constantly pushing you to meet the nephews and sons of various friends. Are they the kind of better than you that will take an ad out in the paper saying we are looking, Indians do this is a very Indian thing, Hindus, Muslims, we all do it, where you'll take an ad out of being like, we want this skin color. So this ethnic community, this language, this profession, and this skin color.
Oh my God.
Indians are very racist. We can be very racist, my friend. We have a lot of color issues. It's a whole thing. And so like, are they
Indian matchmaking?
He
wants a light-skinned girl. He wants a light-skinned girl. Yeah.
Exactly.
Wow.
And so, and so are they that kind of better than you? Or are they the better than you that is going to be like, here are 5 guys, pick one?
Interesting.
And if you decide not to pick one of these 5 guys, are they the kind of better than you? Like, and now we're shifting towards like zombification, right? Are they the kind where you're going to get smacked around if you don't pick one? Are they the kind of family that might ship you back to the old country and marry you off? And that's where we get, and if you get home and you're being super rebellious and a couple of good beatings don't sort you out, are they going to like kill you and throw you in a river? And I'm not joking. Like I'm not being facetious.
Yes.
I'm reading news reports.
I saw this. There was a report about an Iraqi girl who that happened to her. She had, moved to Turkey or someplace and she was living with her fiance and her parents lured her home. And the next thing you know, she's gone. And then the father goes to the police station and turns himself in and says, hey, listen, it was my daughter. You have to understand she was doing these things. And he was like, I surrender myself to the judicial process. And he got 6 months in prison or jail or whatever.
For killing his child.
On because the laws are not strong. One of the videos that you sent me was about how there was she was a documentary filmmaker where she was saying this was not an honor killing or an attempted because it was done in public. And normally if something like that was going to happen, it would happen like in the privacy of your own home. So the fact that the father attacked the daughter in public made this just like run-of-the-mill domestic violence. And I was like, which is also not good, which is still not good.
And it suggests, I think we should add the link to that interview on Court TV in the notes, because it's really helpful. It's the kind of thing where like, if they had gotten her to Iraq and she continued to be rebellious, she could have ended up dead. Right.
But and she's got to know this, right? She's got to know this.
This is very enlightening. It's very enlightening because, they're spitting facts here, and I'm enjoying this conversation. I didn't mean to let it talk for so long without any interruptions. Sorry about that, Kathy, if you watch this. But yeah, it's very enlightening. Very enlightening. I enjoyed listening. So sorry. And yeah, we're doing this so then that way, because of Court TV's change of the way they're doing this trial, we're going to watch this for a little bit. I may pause, and we'll come back to it, but I'm going to let it, the Court TV play in the background for a minute, and that way we can fast forward through the breaks, because I feel like we're missing a lot of testimony with the Court TV breaks. That's just my opinion. So
ran away, right? That's the thing.
Right.
That's why she ran away, is that she knew that was happening and she knew what that was. And, I thought it was, and I think, like, let's talk about shame and honor, right? Like you were saying, like,
next thing, like what, let's define honor in this context. Because to me, taking somebody off the playing field is not honorable. How's that honor? How's that honor?
And I think this is where this line between better than you and zombie, you don't quite know until it comes to this crisis. So one of the things about a lot of communities, this is true of my family back home, this is true. And again, this is something that I think is true far beyond the Muslim world, right? This is something you see in Hindu communities. This is something you see in all kinds of, in Nigeria. You see this in a lot of different places.
You see this in very, very conservative Christian communities.
Mormons, all of this stuff, right? Like think about the FLDS, where they take their rebellious daughters and ship them up. Yeah.
Tylee Ryan was rebellious. Yes. And so her mother decided she was a Mormon. And now she's saying, I know my daughter is fine. I know she's in heaven. I've sent her on to this better place. She visits me, the whole thing. If we're going to talk about like honor, Lori Vallow thinks that she committed, honor unalive. I'm not sure like what YouTube is going to ding me for here.
Right.
But Lori Vallow thinks what she did was honorable. And we look at that and we go, this lady's...
this idea of saving them by killing them.
Yes.
Right?
Yes.
That I think is something that you see in a lot of different societies. I think there's something about and you see this in a lot of DV cases, like broadly speaking, where there comes a point where you cross over from wanting the best for your kid to pushing them really hard, to maybe pushing them around, to maybe smacking them up, right? Like the progression of domestic violence with your kids. And at some point, some parents get to a place where they don't see their kids as people that they love, and they see them as property or rebellious, or because I think, and this is something Ruby Frankie is perfect example, where if her kids had not escaped and been saved, they would be dead. They would have been dead, because she has gone down this trajectory. And I think when we look at all the building blocks in this family, in this Ali family story of the mom is going after the boyfriend and she's got a restraining order, and there's another one where she can't go to the school, she's not allowed on school property anymore, and this is a progression of zombification, as it were. And my sense is very strong. This is true in a lot of Arab cultures. It's true in a lot of Hindu and Muslim Indian cultures, where the question of shame, right? If you think of guilt as you did something bad, shame is you are bad, deep into you completely. And when we talk about shame in this context of very patriarchal communities, your ability as a man is predicated on preserving the interests of the larger family, and controlling women is just something that is part of that, right? Is really built into that patriarchal setup. And so his inability to control this means he's not paying. He might, this is the thing. That older guy there's a whole continuum of stuff that happens with these arranged marriages. It may have started out as, my daughter's kind of rebellious. I love her. I want her to be safe. And so marrying her to this older guy in his head might have started out as a loving thing, or in other cases might start out as a loving thing. But at the other end of the spectrum, maybe that guy that she's, maybe the family owes this guy some money. Maybe this guy did a favor for them.
Wow.
And this is essentially payment for that, more or less.
Right. I never considered that.
Oh,
I never considered that.
Because think about the
interesting.
context of Iraq, and I think this is probably also part.
That's an interesting aspect. Okay, keep going, honey. Hey, K-Swan, how are you, hon? We'll play this for probably about just till we get to where they go through the video, and then we'll switch back to court, and then we'll come back to them.
Part of what's going on with this family, just, I'm speculating, but like looking at their emotional affect, Iraq has been in a state of horrific war for at least 25 years now, right? It was a very troubled society before the American invasion, and it has been a horrific situation since then. And so you're talking about, for the mom and dad, they grew up and have lived in a war zone for a long time. I don't know how long they've been in the States, but they and their family have been in that. And people get really screwed up. They get really controlling. They get more conservative often. The coming here, it was really interesting to me to hear Fatima speak with an American accent. And
yes, Fatima has an American accent, but, oh, bless you, K-Swan. You're having a hard day, but it's okay. All right, bud. It's okay, babe. That's okay. We all have bad days, hard days. We all have hard days. Let me rephrase that. Yeah, I thought that was too, because Fatima's been here since she was 8 years old. So with knowing that, and she's now 18, so they've been here about 10 years. So they've been in the States for 10 years, and her American accent is so Americanized. I would have never guessed by hearing her voice. So I totally get that.
Sister speaks with an American accent. They don't sound like they're from Iraq.
No, not at all.
And so they sound like Americans, which means they've been here for a while, at least.
Fatima said she came when she was 8.
Oh, yeah. So she's an American. And so some of it is probably the parents, their emotional affect strikes me as like, right, to drop an F-bomb, like they strike me as like really wild. The moms, like, I think, when I listening to the body cam of the mom shrieking and wailing, I had to like turn it off and sit down for a minute, because like it was so triggering of like, that's what it is. When something and their sense of self, the violation of the enmeshed family, like Fatima pulling away is such an existential threat. These are probably people who carry some trauma. These are probably people who find America frightening in a variety of ways. But it's also been like 8 or 10 years, and they should like chill out a little bit. But seeing their emotional affect, the sister, the level of anxiety that the sister betrays when they're reading the restraining order with their mom, when she's dealing with the cops after the attack, that is a level of frantic anxiety that is just deeply troubling to watch, and also very familiar to me. Very, very familiar.
I have that video. Hang on 1 second. Let me see if I can share it. Share screen. This is the one. Share. I'm only going to play a little bit of this, but this is after the attack. The police have shown up. Fatima and Isaiah have run into the school. The young lady in the middle of the screen here, sort of like the purplish indigo blouse, is Haneen, Fatima's older sister. She's just a couple of years older, but from all reports, she's sort of the enforcer in the family. She's the one who keeps the rules. She's the one who keeps her little sister in line. This is her explaining to the police what has happened.
You can cross-reference my runaway call to suspect aggressive.
Like really aggressive. So they're in there.
This isn't something you see every day. Two parents accused of attacking their own daughter in broad daylight.
Okay, I'm gonna make this clear, right? So,
I didn't talk with him.
I'll have her give you a call.
Yeah.
Mom is hysterical. I think I cut off the beginning of the video where Hanif is explaining to the police, they attacked my dad and then they ran away. They're over in the school. And this is mom sitting just on the sidewalk on the school grounds where she's not permitted to be. She's beside herself and she just keeps saying, I need to talk to my daughter. I'm just going to play a little bit more of her. Primarily what you're hearing is the officer's voice because it is his body cam.
Okay. So, hey, so do you remember we talked about that you cannot be on Thurston Timberline property? Okay.
The daughter, hang on, let me remove this nice lady. The daughter,
Okay, we're going to pause it there. And we'll go back to the trial and watch a little bit of the trial because we are about 30 minutes in. So that'll give us a 30-minute little window to play with. So, excuse me. So, yeah, the case one, there's a total of 6 kids. So, if you're not going to conform to our culture, I mean, if we were to go there, would we be asked to conform to theirs? I don't know. I don't know how that works. I'm not. Yeah, I don't have facts on that, so I'm not even going to discuss that. I don't want to say something that's not true. So, okay, we're going to switch back over here, and.
You were one of the treating physicians for Fatima when she was admitted to the pediatric floor at St. Peter's Hospital. As part of your as part of being one of the treating physicians for Fatima, did you also review the CT angiogram scans that were done in her case?
Yes, I did.
And then did the CT angiogram scans result in a diagnosis of pneumomediastinum and subcutaneous emphysema for Fatima?
Yes.
Okay. And was there, as part of the, and based on the observations of the scans, were you aware that were you also aware that an otolaryngologist by the name of Dr. Kim was also consulted on this case?
Yes.
And being one of her treating physicians, were you also made aware that there was the concern of a tear in her aerodigestive tract?
Yes.
Okay. Permission to approach the witness, Your Honor.
You may.
Dr. Gilbert, I've handed you what's been marked as State's Exhibit 105. Do you recognize what I have handed you?
Yes, I do.
Okay. And do you know what is contained on the thumb drive that is labeled State's Exhibit 105?
Yes, I do.
And how do you know what is contained on that thumb drive?
These are images taken from the CT angiogram that I gave to you to use in this trial.
Okay. And did you also have a chance to review the images on Exhibit 105 prior to your testimony?
Yes.
Okay. And do they accurately depict the some of the CT angiogram scans that were done in Fatima's case?
Yes.
And do they depict the free-flowing air that was located in Fatima?
It does depict the pneumomediastinum and the air in the neck. Yes.
Okay. Your Honor, at this time, the state offers for admission into Evidence Exhibit 105.
Any objection, Mr. Keating?
No, Your Honor.
Mr. Larry?
Sure.
105 shall be admitted
Permission to publish.
You may.
And Dr. Gilbert, does Exhibit 105 contain 3 separate scans?
No, it contains 3 separate images from a scan.
Okay, I apologize, but it is 3 images.
Correct.
Now, publishing the first image that is labeled SER0000. And that, zoom in. Permission to approach the witness, Your Honor.
You may.
So if you use this clicker and you point it at the TV, it gives you a red dot to point.
The red dot's like super big. Sorry. Do you have an arrow?
I cannot not from that.
Okay. I'll try to make it work.
Technology fails every time for me. Dr. Gilbert, I'm showing you what's labeled scan SER000, not scan, image from the scan SER0000. Can you tell the jury what they're looking at in this image?
Yes. A CT angiogram is a movie, and it's made up of many pictures, and with the angiogram means that there's dye placed in the veins. So when we are looking at this, we're looking at, in this picture, us cut horizontally through the lung tissue here. I'm going to use my dot. Okay. Maybe I'm going to use my dot. This is lung tissue right here. This is lung tissue right here.
And I apologize. And for the record, you're using the dot to point to sort of the bottom half of the image?
Correct. Okay. And then the white things around are ribs. Up front, the round circular thing is the trachea. And the little round black areas is air outside of the trachea. That's going to be called subcutaneous emphysema, or air outside of a area where it should be.
And Dr. Gilbert was then highlighting almost the center of the image, maybe just below the center, when she described the black circle and then the small black areas around it.
Thank you, Your Honor. Now I'm going to publish the image that is
Hitting the pause button on this testimony so we can bring in our guest analyst standing by. National Trial Attorney Michael Jaffer is with us. Michael Jaffer, good to see you. This is not the, they say, tried to choke her to death. Both parents facing the same attempted second-degree murder charge. Police say she ran away from home over fears that her parents were going to take her on a trip that she wasn't initially aware about to Iraq. Let's pick up things where we left off with a pediatrician who was reviewing images of the victim's medical exams after this alleged attack.
Now I'm going to publish the image that is labeled SER0001. Dr. Gilbert, can you tell the jury what they're looking at in this image?
Yes, this is a still image from the same CT angiogram. And in this image, you're looking longitudinally through the body this way. We'll start at the top. This is the head and the skull. You'll see the spinal cord coming down like this. It's going to be harder with this big round dot, but this area is part of the swallowing esophagus. And this area next to the spinal cord is part of the trachea going into the lungs. Up front here, those areas are part of the pneumomediastinum. That's air outside of the lungs and outside of the trachea in the tissues near there. And mediastinum means front of the chest. So this is air in the front of the chest up to the level of the thyroid gland in the neck.
Okay.
That air should not be there. That's air in tissues where it should not be.
And for the record, Dr. Gilbert, when you're describing this image, you are using the giant red dot. You started from the top of the image, and as you were describing the spinal cord, you were moving downward on the image. Is that right?
Correct.
I'm going to publish image that is labeled SER0002. You tell the jury what they're looking at in this image.
Yes, this is again a still picture from the CT angiogram. The angle is a little bit different than we saw before. This is the top of the head, part of the spinal cord here, and you'll see down at the bottom of the image, lung tissue here and lung tissue here. That round circular thing right there is again the trachea. The air outside of the trachea is on my screen to the right, and there is air pockets outside of the trachea. Again, pneumomediastinum air that should not be there.
Okay. And again, for the record, you are, when you're describing this image, you were moving from an upward, from the upper portion of the image and moving downward. Is that right?
That's correct.
And Dr. Gilbert, based on your training experience with strangulation, have you yourself examined a patient or patients that has strangulation happen to them that resulted in pneumomediastinum?
Yes.
Okay.
Okay, that's on their end. And they went.
All right, we've got a bit of an issue with our technical. They're trying to choke the daughter to death. Other teenagers detained, treated the victim.
Your Honor, permission to approach the witness.
You may.
Dr. Gilbert, I'm handing you what's been admitted already as State's Exhibits 67 to 81. If you could look through those and let me know when you're done looking through them.
Okay.
And do you recognize exhibits 67 to 81?
Yes, I do.
And what are exhibits 67 to 81?
These were photographs taken in the emergency department of Fatima Ali when she presented after the strangulation. And my understanding was that these were taken by Synovia, the F&E who was doing her exam.
Okay. Permission to publish exhibits 67 to 81?
You may.
Dr. Gilbert, I am showing you what's already been admitted as State's Exhibit 70. Can you tell the jury what is being depicted in this photograph?
This is the left side of Fatima's head and neck, shoulder, basically from her ear and the side of her chin down to her left shoulder.
Okay. And we see some discoloration that is here, that is on the lower middle-ish of the photograph. What is the discoloration here?
That appears to be an abrasion on the posterior or the back aspect of the left shoulder.
Okay. And Dr. Gilbert, you testified earlier that you had a chance to review the video that was taken by the student. During the course of your treatment of Fatima, did you also have a chance to either speak to law enforcement officers or review their reports that documented sort of what had occurred that resulted in Fatima ending up on the ground?
Yes, I reviewed the reports. I did not speak to law enforcement in person.
Okay. And the discoloration that we see on the shoulder here, on the lower back and shoulder area, could that, based on your training experience, be caused by sort of impacting with the ground?
Yes, Fatima actually told me when I talked to her on Saturday that.
Did you say objection?
Yes, Your Honor.
Objection was just the one evidentiary basis?
Hearsay.
Right. I will allow you to ask some further foundational questions as it relates to, if you wish her to continue, as it relates to any conversations and the purpose of those. I'll sustain the objection right now.
Okay. And Dr. Gilbert, as being a treating physician with Fatima, did you have a chance to speak to her while she was in essence, admitted to the pediatric floor at St. Peter's Hospital?
Yes.
And in speaking with Fatima, did you also ask her about what had transpired or occurred at the bus stop?
My questioning of Fatima that morning was about any injuries that she had sustained so that I could provide medical care to her.
Okay. And did she actually share with you any injuries that she believed had occurred or that she sustained?
Yes.
Okay. And did those, her statements to you, assist you in providing medical care for her?
Yes.
Okay. And in this case, did Fatima indicate to you how she went from being upright to ending up on the ground?
Yes.
Okay. And what did she say?
She said that she thought she had fallen on her left side because her left shoulder hurt and her left hip hurt.
Okay. And based on your
button on this testimony, let's bring in National Trial Attorney Michael Jaffer. Michael, we are listening to so much evidence that involves the father. I'd say 95% to 5% about the mother. And when our camera pans to this defense table where we've got two parents.
He grabbed her shoulder.
I
tried to push them away from each other.
Of shoulder area consistent. And based on your training experience as being a pediatrician with a specialty.
And then think, Lois, they got to cross her yet. Could you imagine? Oh my God. I'm trying to even imagine what this cross is going to be like with this lady. She going to be looking at these lawyers like they lost their marbles. I mean, they're going to be on the ground playing with their marbles because she's going to wipe the floor with them. I hope she makes them look stupid.
And child abuse is the discoloration we hear on her lower back, left shoulder area, consistent with her impacting with the ground.
Yes.
Exhibit 71, can you tell the jury what is depicted in this image?
Yes, this is a photograph taken from the right side of Fatima's face. It includes her lips, her nose, her right eye, and her forehead.
Okay. Exhibit 72, can you tell the jury what is being depicted in this photograph?
This is again the right side of her face with a more close-up view of the upper eyelid, the lower eyelid, and the right cheek. This picture does not include the nose or the mouth.
Okay, and you testified earlier about petechia, and when you examined Fatima, or when you looked at the photographs that were taken by Ms. Rivas, did you observe petechia on any part of Fatima's body?
Yes.
And do we see any petechia in this image?
Yes, there are multiple petechial lesions in this image.
Okay, and I believe you still have the clicker. And if you could use that to point to the jury where on this image that you're referring to regarding petechia.
Can I just say again, this circle's way too big.
Oh,
it's a pointer. Oh, now I get a pointer. Thank you. Sorry. Oh, it's hard to control where I'm going. Is there a way to drive this?
Your Honor, permission of you may.
It's very sorry.
I'm going to use my finger instead to point Dr. Gilbert. On this image, with regards to, I'm pointing sort of to the middle section of the image. What is the jury looking at here with regards to the red dots?
So each of those red dots is a petechial lesion, a broken blood vessel in the surface of the skin. And again, there are multiple petechial lesions. Your finger was going over a few of them.
Okay. And with regards to the petechia, if there is an episode of strangulation, is the petechia due to the jugular vein compression or the carotid artery compression?
It's secondary to the jugular vein occlusion or pressure and the backup of blood into the head.
Okay. Exhibit 73. Can you tell the jury what they're looking at in this photograph?
This is a front view of Fatima's chin with her neck extended and goes down to her top of her chest area. So it's including the entire neck down to the clavicles and then up to the chin.
Okay. And you testified earlier about sort of airway occlusion and the location of the trachea. What using my finger, this area right here in the middle of the image, is this the area where the trachea would in essence be located?
Yes, in Fatima, she, in this view, it's very easy to see the outline of her trachea. You can tell where the edge is on either side of the center there. So that large kind of tube appearing structure is her trachea.
Okay, and the edge that you're referring to, are you referring to this edge that I'm using to trace my finger along the center of the image?
Yes.
Okay. In Exhibit 74, can you tell the jury what is being depicted in this photograph?
I would need you to tell me what it says on the back because there's not enough information as to whether this is right or left.
Okay. And is there information depicted at the top of the photograph that indicates what is being depicted?
Again, I'm not seeing that it tells me if it's right or left. I believe this is left, but I would want that confirmed.
Okay. And just a few questions regarding the image, not knowing whether it's the right or the left of, when you say the right or the left, which body part are you referring to?
This is a picture of the neck. But because of the angle of it's a close-up picture of the neck, and because of the angle, it's difficult for me to ascertain if this is right or left.
Okay. And not knowing, understanding that you don't know if it's the right or the left, the discoloration that we see that is being depicted in the middle of the photograph, what is that?
That's bruising and abrasion of the neck.
Okay. And based on your training experience, can a strangulation episode cause bruising?
Yes.
And how does it cause bruising?
The pressure applied to the skin breaks the blood vessels underneath the skin, and it requires moderate to severe force of pressure to break blood vessels. And then when the blood seeps out of those broken blood vessels, it extravasates, which means it leaks up through the layers of the skin to become visible as a bruise.
Okay. Exhibit 75. Can you tell the jury what is being depicted in this photograph?
Yes, this is a photograph of the right side of Fatima's neck, and it includes her chin and her neck and the top of her chest.
Okay. And the discoloration we see here that I'm using my finger to trace, that is again in the middle-ish of the photograph. What is that discoloration?
Again, that is bruising of her anterior, the right side of her anterior neck.
Okay. And Dr. Gilbert, you testified earlier about the location of the jugular veins and the carotid artery. Are the well, let me ask you this question. When you're looking at a person's neck, can you see a person's jugular veins and carotid artery?
No, you can't.
Okay. And based on your medical experience with regards to the location of the jugular vein and the carotid artery on a person's right side of the neck, is that being depicted in this photograph? The
yes.
Location.
The location is correct in this photograph.
And where in this photograph would the jugular vein and the carotid artery be?
They would be right under the bruised area. Again, since we're on the right side of the neck, it would be the right carotid artery right next to the trachea, and then the right jugular vein right next to that.
Okay. And you indicated it would be underneath the bruised area. Would it be in this area that I'm pointing to with my finger?
No, because you're pointing to the clavicle area, which is more part of the chest. It would be up higher. The jugular vein and carotid artery are coming up that right where your finger is, again, right next to the trachea. The carotid artery is closer to the trachea, and the jugular vein is essentially where your finger was.
Okay, and for the record, my finger was in essence pointing to the middle of the image. Exhibit 77. Can you tell the jury what is being depicted in this photograph?
Yes, this is an image of the left side of Fatima's neck with her chin elevated. It includes her left ear, and it goes down into her the top part of her left chest.
Okay. Exhibit 78. Can you tell the jury what is being depicted in this photograph?
This is again the left side of Fatima's neck. This picture is not so close up. It's easy to ascertain that we're looking at the left side of her neck. We don't see the chin in this view, and the bottom of this view is actually at the bottom of her neck, not including her chest.
Okay.
We are following breaking news.
Okay. All right, back to TV. Oh.
A semicircular shape of red marks that is going down her left neck that is being depicted in the middle bottom portion of the photograph. What are those red marks?
Those are scratches slash abrasions, breakage of the skin.
Okay. And we also see some discoloration that is sort of going in a horizontal manner across the bottom half of the image, but also going across sort of where the abrasions are. What is that discoloration?
And that's a bruise.
Okay. And is the carotid artery and the jugular veins on the left side of the neck being depicted in this photograph as well?
Yes, they are.
And where would they be depicted?
Basically where the scratch and the bruise are. The jugular vein would be closer to the scratches, and the carotid artery would be closer to the trachea.
Okay. Exhibit 81. Can you tell the jury what is being depicted in this photograph?
Yes, this is, again, the left side of Fatima's neck, a little bit more posteriorly than the last one. You don't see the ear, and you see the side of the neck going down towards the shoulder.
Okay, and you said posteriorly compared to the last one. What does posterior mean?
Posterior means more in the back.
Okay, and do we also see the jugular vein and also the carotid artery in this photograph?
Yes.
And where would they be located?
They would be on the left side of this photograph where the bruising is.
Okay, and the bruising that you're referring to, is it the discoloration that we see in the middle of the photograph?
And including the discoloration a little bit further up. There's additional bruising in this photograph in there, yes.
And are you referring to this portion, which is on the upper, very right-hand portion of the photograph?
Yes.
Okay. And Dr. Gilbert, while Fatima was admitted to St. Peter's Hospital, and during her stay at St. Peter's Hospital, besides the photos that we just saw a moment ago that were taken by Ms. Rivas in the emergency department, do you know if additional photos were taken of Fatima subsequent to her time at the emergency department on October 18th?
Yes.
Okay. And what is the purpose of taking photos subsequent to her time at the emergency department?
When we admit a pediatric patient with any sort of visible injuries, we tend to follow the progression of those injuries with daily photographs. So with Fatima, when I came on service on Saturday, roughly about midday, we photographed the areas that we had seen injuries. We also asked Fatima if there were any other injuries that she was aware of on her body. Every child gets a full head to toe physical exam every day that they're in the hospital. So I was able to look at Fatima's body and make sure that no other injuries had shown up that we had not photographed on admission to the emergency room. We re-photographed the areas where we found positive findings: scratches, bruises, abrasions, and petechiae. So we took photographs of those areas again on Saturday when I was on service.
Okay. And Your Honor, permission to approach the witness.
You may.
Thank you.
And Dr. Gilbert, I've handed you what's been marked as State's Exhibits 99 to 102. If you could look through those exhibits and let me know when you're done looking through them.
Okay.
And do you recognize exhibits 99 to 102?
Yes.
And what are being depicted in exhibits 99 to 102?
These are photographs of Fatima's neck on Saturday, October 19th. These were taken by the resident, Jessica, and supervised by me. In other words, I asked Jessica to take pictures of these parts of her neck.
Okay. And and exhibits 99 to 102, those photographs, do they accurately depict the injuries that you observed on Fatima on October 19th?
Yes, they do.
Your Honor, at this time, the state offers for admission to evidence exhibits 99 to 102.
Mr. Kading, any objection?
No objection.
Mr. Larry?
No, Your Honor.
99 through 102 shall be admitted.
Permission to publish.
You may.
Dr. Gilbert, I'm showing you what's been admitted as State's Exhibit 99. Can you tell the jury what is being depicted in this photograph?
Yes, this is a front view of Fatima's neck. It includes her chin. Both ears are visible, and it goes down to the base of the neck as it attaches to the chest.
Okay, and the discoloration that we see that my finger is using to trace, that is in the upper middle portion of the image. What is that discoloration?
That's bruising that is on over the trachea and to the left, covering the areas where the carotid artery and the jugular vein would be.
Okay. In Exhibit 100, can you tell the jury what is being depicted in this photograph?
Yes, this is a photograph from the left side of Fatima's neck. It includes her chin, the bottom of her ear, and it goes down to her attachment of her neck to her chest.
Okay, and the discoloration that we see that I'm using to trace with my finger, that is in the bottom middle portion of the photograph. What is that?
That's all bruising on basically the bottom half of her neck on the left side as it connects to the shoulder and the chest.
And
all right, let's pause testimony there and bring in criminal defense.
Okay, so let's switch over here. We're going to go back to GRI. Lola be cutting up in my background over here, so I need to go correct my baby. So we're going to watch Kathy for a few minutes.
Haneen is in her, I think her late teens, early 20s.
Yeah.
And she sort of translates for the family, and she's sort of like the voice and everything for the family. But as she sort of, the mom understands enough English to get by. I don't think she works. There's no indication that she works.
Right.
but the mother is literally beside herself. I think part of her is upset because her daughter has now run away and now can't go to Iraq.
Yeah.
But also, my husband's being arrested. Oh my God. And she's not like, I don't know if she's saying, is my daughter okay? Or if she's upset because these people have foiled our plan. We have this brilliant plan to go to Iraq with our kid. So now what, you know?
And I would honestly, I would propose a third thing that's probably going on. She's mourning like her daughter is dead. Because that's what's going to happen, in the sense of like, if they don't get her daughter back, she will essentially be shunned. And that's yeah. And so, you know, I think there are a lot of things going on probably, and we don't know most of them, but I do think there's an aspect. So again, it's like, if you've ever been in a heavily enmeshed relationship, right? Where there are no boundaries between you and the other person. I often joke, like, my mom is an amazing mother, right? She's phenomenal. I love my mother. She's also like, in my 30s, she was upset because I wouldn't let her pay my rent so I could be in an apartment building in New York with a doorman. She was like upset about this for like 6 months.
Okay, she could have paid my rents.
I had a studio on the Upper West Side. It was a perfectly acceptable apartment.
You're fine. You were
fine. But that's what I mean. Like, it is a loving embrace that, for a very American, that could, if it goes bad, or just as like annoying, right? All parents are annoying to their children. And this kind of a parent, but like, so it's a psychic wound that she's feeling. Her daughter's rebellion is a psychic wound of like, my boundaries, my sense of safety, my world is being destroyed by my daughter leaving, by my daughter not being the person I want her to be. There may be actual literal danger, right? Like,
from who? Aside from the dad, who's bringing danger to the
table?
There
could be danger back home if she doesn't show up and marry this guy. There could be serious danger back home.
I didn't even think of that.
Yeah, and depending on their circumstances, I mean, one of the things that happens in refugee communities, so there's human trafficking, right? Like, how do you get out of your country that you have to pay back? There's you know, how did you get your visa? How did you get the financing for the business? Because for a lot of people, if they're able to show that they're financially independent, they can get a visa, right? And so because they're going to own their own business, they're not taking a job away from anybody, especially like 10 years ago, that was a thing. So somebody maybe loaned them $1 million so that they could get legal visas and come here and start a business and start a life. And maybe they owe that money. You know, when we pulled out of Afghanistan and the Taliban took over again, families had to do this, where if they were affiliated with the American regime, one of their daughters had to be given to essentially marry a Taliban soldier. And this is something that happens in wartime. This is something that happened in Iraq in the wars. Yeah, and the wars in Iraq and Syria and all of that.
Right.
And so the idea being that like the family, like you're an asset in the family, especially one of the big hinge points. And this is where you start figuring out, are they better than yous who are going to be pushy and annoying? Or are they like zombies who are going to whack you around? Because is as girls get older, at what point in cultures and communities where they wear headscarves, at what point do they wear that? Because that essentially signals that you are not a girl, but you're a woman. And so like young girls, it's really only in the most conservative, almost certainly zombies, that those cultures where you see girls younger than 12 or 13 wearing a headscarf. It's usually something traditionally. And this is part of the you know, the last half of the 20th century was really hard on the Muslim world. And like the zombification, you know, in zombie movies, I love zombie movies. That's why I keep talking about this, right? I think it's a great metaphor for advanced capitalism, for Islamic fundamentalism. Like zombies is a great metaphor. So, you know, like in some of these zombie movies, you've got like the initial infection and then it like spreads.
Right.
You can see a map and it spreads. The zombies are everywhere, right?
Yes.
And I think of like Saudi oil money as the spread of zombification. And so like in Pakistan, so my parents grew up in Pakistan. My dad's from India originally. But in Pakistan, the world that my mother grew up in is completely different than Pakistan now. Pakistan now is like borderline zombies all over the place. My grandmother, so my mom's mom came from a Christian family. So she wasn't a Muslim. She came from a Christian family.
Okay.
And met a Muslim boy at college, fell in love. He went to college with her younger brother. That's how they met. They fell in love. There are fake stories of them running away to the Taj Mahal so he could propose. Her climbing the wall at her medical school to get out and got on his motorcycle and they went off to the Taj so he could propose to her by the light of the moon.
Sounds like a Bollywood movie.
Yeah, yeah. I don't know if this is real. Who cares? It's a great story. But like, so my grandmother is a non-Muslim living in Pakistan, a widow with 2 daughters, living as a doctor. She worked for the Pakistani government railroads. And so she was a doctor who ran the medical center in what are now Taliban territory, where she could not go to college, right? If she was there now.
Wow.
And you know, my mom has these childhood memories of these Pashtuns, so like the core of the Taliban's constituency, coming over the mountains from Afghanistan to find my grandma and be like, my wife's having trouble giving birth, we need a doctor. And my grandma, who was, again, not a Muslim and a super highly educated woman, would like get on a motorcycle and go over the mountains to Afghanistan and help deliver these babies. And so she was in Baluchistan. She was in Peshawar, which is the heart of, you know, like the Pakistani government barely controls these territories. The Taliban controls these territories. This is where Osama bin Laden was hiding. And so you go from in the 50s and 60s, girls walking around with like a very loose thing over their head, but no big deal. Nobody's wearing a headscarf. Nobody's wearing something covering their face. There are professional women. Women are going to college and becoming doctors. And now women can't leave the house. Right. And so what you actually have is like reverse modernization. You have zombification of a lot of these cultures. And so there's a lot more violence. There's a lot more violence against women. People are genuinely scared. Like, nobody wants to live among the Taliban. They're terrifying. Right. And so you hold your children really close. And growing up in a war zone like Iraq, they probably, especially their girls who are very vulnerable in their eyes, they hold them close. And 95% of people who come here, refugees, especially because they get a lot of extra services from like the people who resettle them. But in general, they're like, oh, this is amazing. My daughters can go to school and nobody will harass them. My daughters can follow their dreams. My sons can follow their dreams. This country is amazing. Right?
Wait, if you're Zahraa Ali, right?
Yeah.
You're raised in whatever level of like conservative that she was raised in. She's come to this country. She has these children. Clearly she has the ideology of like, keep the girls at home. You get them educated enough or whatever. Now her daughter has run off. So it sort of makes sense from that context that she's like, oh God, we thought we were going to keep our babies safe at home. We're just going to let her tip out to school, but not be infected by all of this like Westernism, which somehow Haneen, the older sister, sort of sticks to the old ways. But Fatima is like, I got this. There's a cute boy down at the school. And I read or heard someplace.
We might hold hands. Oh my gosh, I'm such a rebel.
The fact that when Fatima was talking to her father, Isaiah was rubbing her back. And what I think the documentarian that of the video that you sent me, we'll link it. It's like it's like it's the most obscene thing that this boy could be doing is touching his daughter, where poor Isaiah is like, I'm just gonna rub her back and make sure she's comfortable and make sure she's okay.
And she
the
knows she's
dad
not
is like,
alone.
he's defiling my daughter publicly, therefore I must try and get her honor back publicly, whatever. He's sort
I
of
like
trying to
how
bring
Kathy
her
makes
back
it
into
make
the fold.
sense
And
with her
the
conversation, the way
sort
she
of the
does things.
dichotomy of this one daughter who has stuck so closely, which I think tends to be oldest daughters, right? Because you're like, you're the second mom, you're helping raise those babies, you're very close. And then like the kids are over there. I have 4 sons. We have the older sons and the little sons, and they're not that far apart in it. I mean, from the oldest to the youngest, there's a big gap. But for like the middle boys, they're not that far apart in age. But my 27-year-old has always seen himself as the father of my 20-year-old. And I'm like, you were in 2nd grade when he was born, right? It's not like there's a 15-year age difference. You couldn't even write your name good. You didn't know long division.
Right.
But I remember him being like, so how are we going to, what are we going to do about my little brother? Because, he wrote on the wall, we need to have a conversation. Do you want me to talk to him or should you guys talk to him? And I'm like, calm down. He's got parents, not you,
Go be a kid.
Right. Go ride your bike, go out, boil you a hot dog and, you can have lunch, whatever. But I could see it's pretty clear in this family that they were afraid of Fatima. They didn't want her staying home. They didn't want her running wild. When the mom was going to go back to Iraq to get these passports or do whatever she was going to do for the younger children, Fatima had to go with the mom because the defense team for the father, Ihsan Ali, is saying like, listen, this girl's out here running wild. We couldn't leave her home alone. She's only 17 years old. And look, she's holding boys' hands. But Haneen, the sister, was going to be allowed to go to school and work and do whatever. So I get the sense that as long as you follow every single one of the rules that the parents have laid out
to
for
the
you.
family. You have to be loyal to the family. And this is as true. This is true in any overly enmeshed bad zombie family, right? Like
I'm thinking Sister Wives, right?
Absolutely.
Like, I don't know, like Cody Brown. It's like, you weren't loyal to me. Why weren't you loyal to me? And he's mad. He took on a new wife. And yes, he's out wilding out in these streets and doing whatever he wants to do. But he's furious that these wives weren't loyal to him. And loyal meant letting him do whatever the heck he wanted to do. The thing that I wonder is if Fatima was a boy and fell in love with an American girl, would it be as big a problem?
I don't know that there would be. It depends on the age. My guess is, so here's my guess from observation is that they probably, because this has happened in my family, where even an eldest son, who is a very important figure in the family, if he transgresses those boundaries, he will get kicked out.
Like the Adelsons. Like in the
it is
Adelson
literally
family.
the same thing. It's the same thing. And they won't get killed, they'll just get kicked out and everybody will pretend they're dead. Right? Because they're not loyal, they're not participating in the crazy enmeshment and the wildness. It's an incredibly tragic situation. And it's so funny. This is one of the reasons why it's so important to have stuff for immigrant families out, not just in English, because what ends up happening is if the kids go to school, they start getting some culture. They can start learning how to make their own decisions about what to keep and what to let go of in their parents' culture. But if the parents are stuck in their own language, they can't do the same process, right? And so I'm one of those people who's like, my mom used to do this. She would go and teach English to Pakistani and Bangladeshi and Arab immigrants, women. Because even if they've got too many kids, or there's a store and they're minding the store and the kids are in the back, whatever, so they don't necessarily work outside the home exactly, but they need to be able to watch TV in English. They need to be able to read the the newspaper. They need to be able to converse with people outside the family in order to help their kids and in order for them to get a feel for what's safe and what's not for their kids and all of that. Otherwise, you get these ethnic ghettos where and that's what's happened in a lot of communities, like in the United Kingdom. There are a lot of communities where these honor killings have happened. And part of it is that the parents, when they come over, are stuck in their own language and they're not forced to get out of it. And I think it's one of the great dynamic, wonderful things about New York City is like, you learn other languages by just leaving the house, right? Like you can learn English, you can pick it up really quick. And you see almost immediately, like any ethnic neighborhood is only like 4 blocks from another community, right? Like you take the 7 train through Jackson Heights and it's like Indians at one block, Korean, but it's like Indians on one side of the subway and Koreans on the other side at one stop. And then you go another spot and it's like Salvadorians and Peruvians, right? Like whatever. And so my guess is that, again, this is a family unit that chose to be very closed in. And the fact that she's like going back to Iraq to get passports for the kids to have dual citizenship.
That were born here in America.
What the fuck is that? What the fuck is that?
Yeah.
Why would you do that?
She's keeping them strongly tied to their roots. It's so interesting because I have a dear friend who was a regular New York City girl. Well, I mean, she was born in Florida, right? Raised in Miami. And her parents, as she got, like, she's a Jewish girl, but they were sort of like lightly, diet Jewish. They did their high holy days and nothing major. And then as she got older, her parents got more religious. And she was like, okay, good for them. That's so cute. And she moved to New York City and it's the short skirts and it's all the things. And they were like, right, we would really like you to be more observant. And she was like, okay, mom and dad, whatever. And
good luck with that.
Right. The parents went and, they have a home they have a home in Israel and all these other things. And she's like, okay, cool. So when I go to Israel, like I have a cool place to stay at my parents' place, but what does that have to do with me? And I'm dating we're in our 20s. She's dating every loser in the tri-state area as we all were.
As we all do.
Right. She turned 30 and she got her trust fund. And I remember the year she turned 30, I was 29. I was so jealous. Oh my God. Because she went from we all worked crappy jobs. We all lived in crappy apartments. It was fine, whatever. And all of a sudden she quit her job. She didn't have a work. She had, just like mailbox money is what we called it. That certain amount of money showed up every month. And she bought this beautiful apartment on the Upper West Side in a doorman building, lovely everything. And then she went to Israel for a month. And I remember calling her. It was $6 a minute to talk to her. So I got this phone card at the bodega.
Phone cards,
yes. And I'm timing it. And so in our conversation, she didn't sound that different. But when she came back from this month in Israel, she was wearing a skirt to her ankles. And I was like, oh, well, that's maxi skirts are not really that in, but okay. I didn't notice it at first. She was covering her hair more and with the long sleeves. And at the time I was a single mother. I had become a single mother. My first baby had been born. So we went from a tribe of all these girls who were we were very Sex in the City and hanging out and doing whatever. And she had a beautiful apartment in long skirts and in the summer. And she could shop at Gristides. It was a big deal that she could shop at Gristides, and she would go to D'Agostino. She had the bag, where a bag this big of groceries cost you $100. And so we would hang out together because I couldn't go out because I had this kid and she wasn't going out and I couldn't make it make sense, but she had a gorgeous apartment. And she said, well, it's the trust fund, because we would just sit and talk.
Yeah.
So she's suddenly keeping Shabbos. And I'm like, well, so I became her Shabbat goy, and I would turn the lights on and off and make the coffee and do all the things. And so we would just talk. And I said, so what gives? Why are you suddenly so different? I had a kid, I get it. And I'm poor as a church mouse. I'm living in a bad part of Harlem.
Yeah.
And she said, well, with my trust fund, there's certain things I have to be. She's like, my parents allowed me to use the trust money to buy this beautiful apartment. And I have to be observant and I have to do, there were all these rules. She basically, they couldn't get her to be more Jewish or more observant, I guess, by asking her and leading by example. So they tied the strings of her trust fund to, you can have all this money and this beautiful cush lifestyle in New York City if you do certain things. And so she had to be more modest. She had to keep Shabbos. She had to be mindful of who her friends were. And I remember one Shabbos, we're at her apartment. Shabbos had just ended. And so her parents called her on the phone to, say, how was your Shabbos or whatever. And she's like, it was lovely. I had a nice time. I was sitting here with Kathy. And then she said, I have to have a business meeting. And she goes in the next room and she closes the door. Well, I mean, it's a New York City apartment. I can still hear every word she's saying because I'm sitting in the living room. She's sitting in the bedroom. And so she says, the light bill is this now and the cable is this. Yeah, no. And she's explaining all her bills. And I'm so poor that I'm at her house eating like the leftover food from Shabbos because it's free, right? Like I can't afford beans and rice on my own. I'm eating her beans and rice and chicken. And she comes out of the room and she says, I'm going to have to get rid of cable. And I said, why? Why are you getting rid of cable? And she said, because my cable, or I have to downgrade my cable package because my cable package includes, it was like Showtime or HBO or something. And they had like nudie movies after a certain hour at night. And my parents think it's inappropriate. And I remember so clearly being like, oh, wow. And going back to my crappy apartment with my baby in the bad part of town, worried about like the dude on the corner. And I thought, I have more freedom as like a broke single mother than this girl living in this gilded cage kept she had to ask her. If I got HBO, that was between me and Cablevision. My parents didn't have a say. And she kept flying back and forth to Israel on private jets because her parents were trying to set her up with an appropriate partner. If she wanted to keep access to all these beautiful, lovely things, then, and I remember thinking,
she had to do this.
Work. It's New York City when was Jordan born? 1998, right? It's New York City. It's 1998. Everything seems so expensive and so crazy. And I'm working and trying to make ends meet. And I'm giving my baby whole milk instead of formula because I really can't afford formula. And my breast milk didn't come in and blah, blah, blah. But I felt so much freer. She would buy me formula because she's like her gift to me.
Exactly.
But, she's like, but I have to make sure, like I have to put it this way on the budget so that my parents don't notice, blah, blah, blah. And then I said, well, when do you get your own, like, when do you get to run your own life? And she said, when I get married. But she had to marry an appropriate partner.
Yep.
I married a guy who my mother was like, him? She likes him now. But she was like, girl, you sure? I don't, But I was like, I had this baby that everybody thought was a terrible idea. I didn't move back home. I raised my children in a non-religious household. It's a scandal in my family, but nobody's going to come and unfortunately unalive me because of that. But there are areas in my family where I am technically shunned. I've had cousins say to me, well, I normally wouldn't deal with somebody like you because I'm too wild, I'm too heathen, I'm too whatever. And I'm like, okay, well, that is their loss. But I can see in the context of this girl in her family, where for me, the price is alienation from my family. For her, the price is death.
Yeah. Yeah. And it is a terrifying thing to see that in the corner. Like I've been thinking a lot about like why we all got transfixed by the Lori Vallow stuff, right? Remember that moment there in Hawaii and Nate Eaton shoved? That was the first time I really, engaged with all of that. And, the whole country came to a stop when Gabby Petito, like the whole Gabby Petito stuff. There have been, and similarly with the Jodi and Ruby stuff, there is something so profoundly tragic and horrifying and a desire to see justice in these places. Your family, you should be safe in your family.
For sure.
Even if you make decisions that your family doesn't like.
Okay, we're going to pause it there. We're going to go back to the trial and watch a little bit of trial. And she's right. You should feel safe in your family, even if you do not make decisions that your family doesn't like. Been there, done that. I've lost all mine. I've moved on. I'm a happier human being because of it. as I have profoundly stated before. So, yeah, things happen like that. And sometimes we have to walk away. Okay, we're going to go back to this trial for a few minutes and see what's going on.
So her testimony yesterday that with regards to Fatima, that she did not have a broken hyoid bone in this case. Is that correct?
That's correct.
Okay. And based on your training experience during a strangulation episode, even if a patient does not have their hyoid bone broken, can there still be damage to the trachea?
Yes.
And why is that?
The trachea is a very thick organ with cartilage. The hyoid bone is just one part of that organ, and the hyoid bone sits up at the top part of the trachea. So depending on where the pressure is applied for strangulation depends on where the injury or damage is done to the trachea. If the pressure is applied up high, basically kind of under the chin or the top of the neck, it's possible to break that hyoid bone. But if the pressure is applied a little bit lower, there's cartilage there, but not bone. So the pressure does impact the cartilage and can compress the trachea so air is not getting in or out, but not actually fracture anything.
Okay. And we also heard testimony yesterday that Fatima's CT angiogram scan did not show any vascular injuries. Is that correct?
That's correct.
And what are vascular injuries?
We can see on a CT angiogram if there's been a tear or injury to the carotid arteries. The importance of that is that if there is damage to that thick-walled muscular artery, then there can be long-term complications that could include stroke or dissection of that tear. So it is important when we have a strangulation victim to do the CT angiogram to be sure that there's no injury that could cause further damage later on. In Fatima's case, her CT angiogram did not show any damage to either of the carotid arteries.
Okay. And you testified that there were no damage to the carotid arteries. Based on your training experience, can carotid artery occlusion still occur without the patient having vascular injuries?
Correct. Yes.
Okay. And the amount of pressure that is needed for carotid artery occlusion, in order for there to be vascular injuries, do you need more pressure applied to the carotid artery for vascular injuries, or less pressure, or does pressure play into the, or does pressure, the amount of pressure, does that determine whether there's vascular injuries?
Again, in the science of strangulation, it's not so much even the amount of pressure or the length of time. It simply does happen. Sometimes that carotid artery tears internally, and many times it does not. But it's really important to diagnose when there's a tear inside the carotid artery, because the complications from that are great.
Okay. Thank you, Dr. Gilbert. No further questions at this time.
Mr. Kading, cross-examination.
Finally. Oh my gosh. We're at cross. We're at cross. I got excited. Sorry, guys. I got excited. We're at cross. I never thought they would get to cross with this woman.
Morning, doctor.
Morning.
Couple of things. You said you had talked to Fatima about the abrasions on her left shoulder and the pain in her left hip.
Yes.
Okay. And those occurred in an unknown way, but she thinks when she hit the ground, right?
Correct. That's what she told me. Correct.
Is it possible that those injuries occurred when she hit some other hard object, say, for example, a tree trunk?
It's certainly possible. I didn't get a history that she had hit a tree trunk, but
it's consistent with that as well.
It's a possibility.
Okay. And if you hit something with your head hard, Is it possible that the cerebral edema will come into play?
That's a possible side effect of a external injury to the head. Yes.
Okay. And so you indicated that the cerebral edema was some sort of brain swelling.
That's what the definition of cerebral edema is.
Okay. And you could get that if you hit your head hard on something.
It's possible.
Okay. And if you get that, you said that every aspect of the brain would be impacted. Like we're talking about everything that you said, breathing, right? Vision.
Are we still talking about, though, an external?
You can't ask questions.
No, I'm talking about just cerebral edema in general.
Cerebral edema in general generally affects the entire brain.
The entire brain. Okay.
Yes.
And does that include your ability to make decisions?
It can.
Okay. And it could affect your breathing?
Yes.
Your heart rate?
Yes.
Can it knock you unconscious, or can you become unconscious because of it?
You can become unconscious because of cerebral edema.
Okay. And so cerebral edema is something that can cause the symptoms of children that you talked about, right? Strangulation, sorry.
Cerebral edema occurs with strangulation. Cerebral edema also occurs with head trauma.
Mm-hmm. Okay. But when you get cerebral edema, it can be from head trauma without any strangulation, right?
Yes.
Okay. And you can get it from hitting your head on something.
Hard.
Right.
Yes.
Can you get it from getting kicked in the head?
Yes, if it was a hard enough kick.
Somebody stomped on your head, you could get it?
Yes.
Or punched in the head or something like that?
Typically, we don't see it just with a punch in the head, but maybe with multiple punches.
Okay.
It needs to be significant trauma, external trauma.
External trauma, significant. And is it related to concussions?
Yes.
Okay. And so if you have a concussion, then you get the cerebral edema. Sometimes.
Sometimes, exactly.
Okay.
Still with us, criminal defense attorney Jessica Lettingham. Jessica, the thing that stands out to me is the witness in her demeanor. She is not hostile. She's not combative with cross-examination. And
the body's an amazing thing.
All these breaks. This is horrible. Oh my gosh, a commercial?
Welcome back to Court TV Live. I'm Ashley Will. Killing trial. We're on October 18th. Ran away from parents. Ihsan and Zahraa allegedly tried to choke Fatima's marriage. However, the court has ruled that the term arranged marriage cannot be used at trial. Right now, the jury is hearing from Dr. Joyce Gilbert, a pediatrician who treated Fatima. This is cross-examination by the attorney for the father. Let's go back in for more.
And when that happens, let's say that you get hit in the head and you get knocked out. Is that cerebral edema? Does that start right away?
You get knocked out with a significant force of head trauma, and the cerebral edema builds fairly quickly, but over time. It isn't an immediate response to an external force.
Okay, but it could occur within a minute or so?
Minutes, yes.
All right. Now, I think you said the brain the body's an amazing thing.
It is.
Right? Okay. One of the things about lack of oxygen to the brain is that the brain actually can function for 3 minutes or so without oxygen due to what it has stored. Is that right?
It has limited function. The function is diminishing over those 3 minutes.
Okay.
Yes.
But there is, if you get your blood your blood flow cut off to your brain, it may cause you to pass out, but your brain still could be functioning in a kind of a protect mode for 3 minutes or so.
Up to the time of death, yes.
Right, okay.
Yes.
And then if somebody is being strangled and the force that's being exerted on their neck, carotid arteries, jugular veins, those sort of things, is released, blood starts flowing, and recovery can be very quick, right? In terms of regaining consciousness, right?
Correct.
Your ability to move.
Yes.
Right? All of that can happen very quickly.
Yes.
Okay. And I think you established that there can be long-term effects, but not always.
Correct.
And the shorter the amount of time that you're deprived of blood and oxygen to your brain, the more likely your chance of not having long-term effects, right?
I would love to think that there's a direct correlation, but even people who have been strangled just to the point of unconsciousness and then woke up potentially could have long-term complications.
Okay. Potentially, but not usual.
Not guaranteed.
All right. Now, let's talk about hitting your head on something. Let's say that, in fact, you did hit your head on something hard. Would that affect your ability at that point to remember what was going on?
It could.
Okay. And that's why. Why does it affect that?
Again, significant blow to the head may impact the hippocampus where memory is laid down. It may impact many other aspects of the brain also.
Okay. All right, and so impact the brain negatively, obviously.
Yes.
Right? Does it affect your ability to reason?
It can, yes.
And what happens when you go unconscious?
Your brain is not awake, alert, making decisions. Your body is able to function as long as there is still oxygen and blood flow happening.
So your body is functioning, but you're not necessarily controlling what you're doing.
Well, you're not awake and alert, correct.
All right. I have no further questions. Thank you.
Mr. Leary, cross-examination.
Hey, girl. Good morning, Dr. Gilbert.
Morning.
Thank you for being here for 2 days. So on the pictures that you talked about, the bruising on the back of Fatima's neck, did they correctly place it as towards the back?
Those were side pictures.
Okay.
So it was more lateral is the medical term we use, not posterior, not in the back.
Okay, and just so the record's clear, when you said lateral, you held your hand up to your ear and kind of went down from your ear?
Correct.
And in those pictures, Fatima's hair was pulled up, is that correct?
Yes.
Okay, so kind of signs of strangulation, the physical signs, would you agree, are somewhat subtle?
Can be.
And in this case, were subtle, correct?
I actually wouldn't say these were subtle.
Okay, well, to the non-professional.
Okay. It's hard for me to be non-professional.
And not to say to be unprofessional, but somebody who doesn't have the same training, correct? So petechiae, you explained very clearly to the jury what petechiae is, correct?
Yes.
And somebody who saw a picture of petechiae, if I walked up at lunch and said, what is this? Somebody may say freckles, correct?
Correct.
And that's a fair description, right?
Yes.
But based on your training, you know that there's a medical explanation, particularly when you see that it didn't last longer than October 21st, that was not a freckle, that was a petechiae, correct?
That's why we continue to photograph every day. Correct.
Right. And so you would agree with me that that's kind of outside the common knowledge of the average person, correct?
Yes.
And that's kind of why you're here, to explain your expertise, right?
Correct.
Okay. And so the bruising and abrasions were more visible on Fatima the next day. Would you agree?
Yes.
Okay. So, and in terms of the petechiae, was it more visible or about the same from the 18th to the 19th? Do you recall?
We didn't demonstrate those photographs, but my recollection was they were still very visible on the 19th. Yes.
They were still there. Okay. And then the scrape on the shoulder and the hip, she attributed to something other than strangulation, correct?
She did not have a scrape on her hip. She had pain,
pain
of her hip and no visible injury there. And the scrape on her left shoulder would not have been directly from the strangulation.
Okay. So if we're summarizing kind of the visual cues, it would be the petechiae on her face, correct?
Correct.
And abrasions below her ear, correct?
Correct.
Which may or may not be visible based on the location of her hair.
Correct.
Okay. So somebody who walks up on the scene and sees her, they're probably gonna notice kind of rapid breathing, correct?
Yes.
Like you're talking about the physical response to a post-strangulation event, correct? So rapid breathing, correct?
Correct.
Almost kind of panic.
Correct. That would be common.
Okay. And so somebody who didn't see what happened before that wouldn't necessarily automatically conclude that what I am observing is a post-strangulation person. Fair?
That's possible.
Okay. Because now let's say that this was a gunshot wound, right? And the gunshot wound is visible, depending on the location and the amount of blood. An average person may be able to say, okay, there's a significant wound there because of the blood and it is circular and quite possibly could be a gunshot wound. Agree?
Yes.
And same with like a knife cut, correct?
Correct.
And so, whereas strangulation, you have to do a much more you have to get information from the person, correct?
Yes.
If they're able to provide it, correct?
Yes.
And then you're doing a full body examination, correct?
Yes.
And then x-rays and pictures, correct?
If that person is in medical care, yes.
And so, getting information from Fatima was important to you understanding and making a diagnosis. Fair?
Always true.
Okay. Okay. So somebody who comes up afterward isn't going to necessarily know outwardly signs that, this is a person who has just been strangled, correct? And you're hesitating. So, I'm
hesitating because I can't ask you a question.
Okay. Well, let me, okay. We operate in these. So somebody who, let's start from here. So Fatima regains consciousness. Okay.
Yes.
From that point forward. And, Mr. Dean from the principal from the school comes over and sees her on the ground and observes rapid breathing, big eyes, startled, we'll say petechiae. Would you expect a non-medical professional to say that person, I can conclusively say that person was just strangled?
Not necessarily.
Okay.
Before we head to a break, we have a quick programming note. Court TV will be live in Idaho for the Brian Kohberger sentencing hearing on Wednesday, July 23rd. That is tomorrow. Crime and Justice correspondent Matt.
Seriously, people. They need to. This is going to be rough these next couple of days. I'm telling you. We're going to go here and watch another 15, 30 minutes, 20 minutes of gossip, rumor, and innuendo. Ooh, my words are not working. This trial, these last couple of days are going to be rough for us.
You should know that you're safe and loved. And if they can't love you, and if they can't keep, they should be able to let you go.
Yeah.
If that's all they can do, they should be able to let you go.
But I was raised to believe that I belonged to my parents. I don't know if everybody thinks that, but I belonged to my parents.
A lot of people are like that. They really think that. And so if you rebel, and in these very shame honor cultures, where the honor comes in is that he is not just his daughter acting out and being her own person is not just a shame in front of, it's God, it's every family member, it's a failure of him as a man. Like, it is an incredible burden that patriarchy puts on men. And if they're not able to perform to that standard, it makes them demented. Like, it makes them crazy, right? And that intense family dynamic of, I think that's where a lot of, like, again, abuse happens, right? Like, wanting to control, wanting to own. You see it, you see that child as property, right? And if you're lucky, you come out of that situation with some neuroses, right? And some funny stories about crazy parents, right? Like, I moved to California. I moved to California at 40, and my dad was so mad I didn't move in with him and got my own place.
You're like, Dad, calm down, sir.
Calm down, sir. And it's a funny story that I tell my friends because they know my dad, and they're like, because my dad's super modern and super progressive, but he has these like Indian things, right? And they're hilarious to all of us. But Fatima is in a really tough situation. She's in a really tough situation. And it is, she's going to come out of it, obviously, like the physical damage, but she's going to have a lot to deal with emotionally, rebuilding her sense of community, who she can rely on, her sense of self, right? Practical things like, where's she going to live? How's she going to go to college, right? One thing that I do think, there are, like, I don't know Washington State and where she is specifically, but in New York, in Detroit, in a lot of places, a lot of Muslim communities and communities that have these issues have a whole infrastructure of women, because so many of us have been here for so long that there are going to be communities of people from her culture, people from her background, to embrace her and stuff like that. And that's what I hope, is that she finds those people and they find her through the publicity of this case. Because
and that they create a web, a network, a family for other women like her. Because Fatima Ali is getting a ton of press right now, but she's guaranteed not the only one. And also because she's Muslim and because of this whole cultural thing. But listen, when I decided to not stay home and not, when I left my family of origin, because I grew up in a family, like, my wider family is like funeral potato Christians. My immediate family, the people that I grew up in the household with, were better than you Christians, right? And so at 14, when it was a requirement that I get baptized, and I was like, oh, no, thank you.
That's not how it works.
That's scandal. And my whole thing was, it's supposed to be my choice. I thought it was supposed to be my choice. And then I just refused to talk about it. And I was like, I'm contemplating. It was the toughest 4 years of my life, because from 14.
Okay, stop. Oh my God. I just, you know what, Kathy will never see this, but I can totally relate in a sense. That was crazy. And will they disown her now? Or will she disown them? That's a good question, K-Swan. Because, I wouldn't want no part of my parents after that. And I don't know how that works in their culture of disowning family members. I don't know. I don't know.
At 18, I just was waiting to get out. If I could just get out. If I could just get out. And I was depressed and anxious and whatever. And then I got out and I was like, oh Lord, what am I going to do with myself? And because I was so outside of what was expected of me as like being raised in this good Christian family. And I didn't think the way, I'm from Indiana, right? So I left one part of the Midwest to another part of the Midwest. I went to the thriving metropolis of Terre Haute, Indiana, where there was like, 12 people. Hey, Terre Haute, I see y'all. But I was like, everybody, all the girls were like, I'm a virgin. I'm taking birth control pills to control my cycle. I'm like, girl, I saw you hugged up with your boyfriend. Like, I was not willing to lie about all the things that people lied about, right? I was not willing to lie about sexuality. I was not willing to pretend to be religious. I was too much. I failed shut up class. I am a long time shut up school dropout. And so I was like, how will I find my people? And for me, I found home and comfort and joy and being parented in the gay community with a bunch of theater kids. And I'm still strongly enmeshed in the LGBTQIA community, the LGBTQIA community. Those are my people. I see gay people and I'm like, girl, mama. That feels like home to me.
That
feels like home to me because it was people who were largely outcast from their families. Their families didn't understand them. And we came together and formed family of choice.
Right.
It was like, okay, the person who had whoever had the most money paid for dinner, and whoever had the most common sense would be like, no, stop. Nope. Don't date that boy. Don't do this. Do that. Don't, your skirt's too short. And then when I left Indiana and moved east, I was, my whole life was falling apart because I was a full wreck. I found myself, I was also a drug addict and alcoholic. I found myself in rehab and in 12-step communities. And I remember a therapist saying to me, let the rooms of AA be the good mother. Maybe you're for what you needed. We're not blaming them. We're not shaming them. Let these rooms be the good mother. And so when I was in college, though my gay family was the good mother. And then 12-step rooms became the good mother. And as a grown-up now, I work very hard to be the good mother to not only my own children, but to other random outcasts wherever they find them. The number of kids I have that I didn't give birth to is crazy.
I was that kind of mom too. I was so that kind of mom too. Cindy says, I'm not convinced that Fatima will be safe even if her parents go to prison. There may be others willing to finish the deed. You might be right. It's a scary thought. It's a scary thought being that they were going to marry her off. They didn't want her with the young man she was with. I mean, it's just all so sad. Okay, we're going to go back to court. Back to court. And I'm going to take a stretch break while we're in court. I'm going to turn my camera off and stand up and stretch.
Correct. And that something has caused this person to be upset.
Correct.
Okay. And it is a common side effect of not being able to communicate after a strangling event, right? Difficulty speaking, that's a symptom, correct?
Correct.
And when somebody is regaining consciousness, correct me if I'm wrong, but it's not like a light switch. Is that fair?
That is fair.
And I just snapped my finger and you shook your head yes.
Yes.
Fair? Okay, so it's not like I'm unconscious at 0-1 and then at 0-2, I'm fully functional and awake, correct?
Correct.
And so there's kind of this process of coming back to understanding what's going on.
Yes.
And you described confusion.
Yes.
And memory loss.
Correct.
And it's fair to think that the person, while they're unconscious, doesn't necessarily fully appreciate how they got to where they are when they're waking up, right?
Right.
This is not what they expected, correct?
Yes.
And if you ask somebody, well, how long were you unconscious for? That's not a question that you would expect them to be able to answer.
That's correct.
And may not be able to communicate to the person that they wake up with kind of what's going on.
True.
All right. I appreciate your time. Thank you.
Yes.
Ms. Zoe, redirect.
Dr. Gilbert, if a patient is hit hard enough on their head to cause cerebral edema, would you typically expect to see some sort of external injuries to the head?
Yes, you would.
Okay, and those external injuries, could they include bruising?
Yes.
Could it also include bumps to the head or knots?
Generally, a big bump on the head with a hard blow. Yes.
Okay.
I'm sorry, could you repeat that?
Sorry. Yes, generally there'd be a big bump on the head with a blow like that.
Okay. And you testify that as being Fatima's treating physician, that you would also do a head to toe examination. During your examination, did you observe any bruising to her head?
I did not.
Okay. What about bumps or knots?
I did not. And I
Okay.
felt under her hair and her whole head during my exam.
And when you felt under her hair and over her whole entire head, did you feel any bumps or knots?
No.
Okay.
And she did not describe any pain with my palpation.
Okay. And you indicated that she does not describe any pain with your palpation. How is pain with palpation associated with bumps or knots on the head?
Well, if she had hit her head hard someplace, then even if there isn't a big bump for a bruise, there's still tenderness at that point of impact. And so if she had complained about pain, then I would have been more concerned about a bump on her head. But she did not complain about any pain with palpation, nor did I feel any bumps.
Okay. And when oxygen is being cut off to the brain, is the brain function in essence impaired?
It is.
Okay. And Mr. Leary, he's the defense attorney that just asked you some questions. He sort of asked you questions about signs and symptoms of strangulation that may be obvious to a professional like yourself, but maybe subtle and not all that obvious to a non-medical person. Would you say bruising, would that be considered something subtle or obvious to a non-professional?
It depends on the time that you're looking for the bruising and the area that you're looking. He made a point of saying if her hair was down, it may have been difficult to see the bruising, and bruising does progress over time. So the first pictures that we took may not have showed all the bruising, and the second day pictures showed more bruising still from the same incident. So sometimes bruising it's not at its highest peak, nor is it always visible immediately after an injury.
Okay. You testified that the photos of the bruising from the second day was more obvious than the bruising from the first day. The photos that were taken of the first day, did it still show obvious bruising on her neck?
Yes, it did.
Did it show obvious bruising on the front of her neck?
Yes, it did.
Did it show obvious bruising on the left side of her neck where the left side of her carotid artery and jugular vein was located?
Yes, it did.
Did it also show obvious bruising on her right side of her neck where the right side of her jugular vein and carotid artery is located?
Yes.
Okay. And if Mr. Leary was also asking you questions about subtle signs and obvious signs, if an individual sees somebody that is being placed in a headlock position and does not look like they have their eyes open and appear to be passed out or they've lost consciousness, would that be concern for strangulation?
Yes.
Okay, no further questions.
Mr. Kading, recross?
No, thank you.
Mr. Leary?
Just to clarify, Your Honor. Just so we're clear, I mean, I absolutely agree. If you see somebody in a headlock and being choked, I mean, you would think strangulation, right?
Correct.
You're shaking your head right.
Yes.
So my question is more, if you don't see what's going on and you come upon the scene afterward, you can surmise that there's been a struggle and that there's been something that's happened, but you don't necessarily can conclusively say strangulation just on your initial reaction. Is that fair?
I think that's very fair, especially if it's a layperson.
Okay, thank you.
May this witness be excused?
Yes, Your Honor.
Any objection, Mr. Kading? Mr. Leary?
Oh,
You are excused.
finally
You may sit down and you're
done
free to go.
with
Thank
her?
you.
Dr. Joyce Gilbert, pediatrician, her testimony is over right now. Let's breathe. But I have.
Well, okay. Oh, y'all, this is horrible. This is like awful. All this back and forth stuff is horrible. Okay, we're going to go back to Kathy. Thank goodness for Kathy today, because, yeah.
mama to a whole, but I'm like, girl, no,
Yeah.
you're not
No.
dating him. And whatever,
Well,
whatever it is.
and I was just going to say, like, it sounds like Fatima has at least some of that in her school, because it wasn't just Isaiah, her boyfriend. It was also their friend group was at the stop with them.
Yes.
Right?
Yes.
And they all helped. And I will say that, like, watching the first couple of days of the trial, I was like, I love America, because it was like the Arab girl with the black boyfriend and the Hispanic bus driver, and I don't know where, like, one of the detectives is from like Cambodia, and the DA is East Asian, and the judge is a white lady, and I'm just like, this is America, right?
Yeah.
And so I feel like the school seems to have at least helped her find emergency stuff, and like. Again, I think the high profile nature of this case and these conversations, right, I think helps to raise awareness that there are people from abroad that have these issues, right? Like so many of us need more than just our family of origin, right?
For sure.
And we're more than just like the worst thing that happened to us or the most traumatic thing that ever happened to us. And my hope would be, exactly. Like, she's got teachers who are looking out for her. She's almost 18. Washington
She's now
State,
18. She just turned 18 in May. Mm-hmm.
And so, like, that gives her a lot, and she's got a lot to work through, because, like, she still seems to have some stuff with her mom that she hasn't quite, because her mom is probably also a victim of physical violence.
Oh, 100%. Allegedly, reportedly. But there's no way her mother is not a victim of physical violence, in my opinion.
And so, like, I am sure that she has really complicated feelings towards her mom and towards her older sister. She probably loves them a great deal, but they're also really bad for her. So she's got a lot, but I think there's so much more awareness around trauma and family of like choosing your family and how to think through these kinds of issues. There's so much more thought about that than there was 20 years ago,
For sure.
Which I think is really lovely. And I'm sure people are reaching out to her, crazy people on the internet, unfortunately, but also like sensible people, right? To be able to be like, hey, we as a community are not the stupidest zombieist people, like just like Mormons are not defined by the crazy zombies in their community. Like, I think for a lot of Muslims, they're like, this is like zombie crazy. Cause like, any parent who hurts their child is fucked in the head. Pardon my language, but like there's something, there's something broken in you if you want to hurt a child. Like there's something wrong
what's funny though? And part of me feels like maybe there's a cultural element to it, because when Fatima talked about her family back in Iraq, they said, how did you feel about going to Iraq? And she said, there are things about it that were good and things about it that were bad. And I think the testimony was not going to be allowed in, but from her deposition, she said that like, it was nice to see like the cousins or whatever, but that in the household of her aunt, she was being abused. She was being hit. She was being, there was like an older boy cousin who was doing things to her. I don't know if that's like intimate violence. I don't know if that's physical violence, but she said she felt unsafe in that environment. And the judge struck part of it from the record because it was like more prejudicial than probative. She was only allowed to say that she felt unsafe. And clearly her parents were not protecting her from that. But growing up, I remember very, very, very clearly at a young age thinking, because of how I was raised and where I was raised, thinking like, oh, I'm definitely going to need a strong husband to keep me in line. Like that was a topic of conversation among my female friends, because I was like, oh yeah, I am wild. I know I'm wild. I am absolutely going to need a husband with a strong hand to keep me in line. And having that conversation with my girlfriends, like, and they were like, oh yeah, girl, me too. Cause I just might do anything. And it was like, yeah, that's just the way it was. And I think about that now and I'm horrified at the idea of it. But that was when I still lived in Indianapolis. I left Indianapolis when I was 14. So I was maybe 10 or 12 having these, like, like, oh, what boy do you want to date? He had to have a strong personality because I have a strong personality and I'm going to need somebody to keep me in line.
Good night, Maria. You have a wonderful rest of your day, and I will see you tomorrow. We'll be here. Um, we will be doing Koberger first tomorrow. So I think if I stream this after Koberger, that'll give us more opportunity to run through all the breaks and stuff that's going on. So, yeah, I think that's what we're going to do is I'm going to set it up for us to do a Koberger stream first. I have to go to the hospital in the morning and do something. And so I have to be there 8:45. I should be home 11 o'clock my time ish. Yeah. So I should be in here in time for Koberger. If not, we might be a few minutes late getting on Koberger, but I'm going to set up that stream just so y'all know. Just being a little informative ahead of time. And then I'll pick this up after Koberger, and that way that'll give us opportunity to zip zap through the breaks. Zip zap. All right, new word, Sheila.
That's insane.
Crazy.
Insane.
But it's how I was raised. It's all I knew. It's what I knew. And I felt like that was the best way for me to have a good life, is to choose a partner who would keep me in line. Ultimately, I chose a partner who is very comfortable letting me just be me. Bless him, because I am a lot. I am a whole lot. And he is delighted by it.
Yeah. Well, and I think that's part of the it's so cool to hear your story, because I think, especially this is a situation, I'm understanding why you're so obsessed with this story, right? Because it mirrors and mimics a lot of your story. And I think, again, I would hope for Fatma, if she has the strength to insist on the things that she's insisted on already, that she probably has the strength and wider vision of the world to be able to find the things that you have, those families of choice, and to explore and to find people who really value her for who she is. That sense of the family owning you is really bad, man. Yeah.
You are, Denise? You're going to be at the courthouse 8:30 tonight? What are you going to camp out? Are you going to camp out overnight? Woman, you are crazy. You think it'll take all day? I know it's set for 11 Central. So is all the feeds that I've seen is 11 Central. So I should be home by 11. So I'm gonna set up the stream for about 11:15. Or actually, I'm gonna set it up for 11. I haven't heard from Katya. So if she's out there in the streets listening, I know she wanted to do Koberger with me, but I haven't heard from her. So you're excited. Oh my God. I can't believe you're going to go camp out. Girl, reminds me back in the old Friday. What was that? The Friday sales after Thanksgiving, Black Friday sales, everybody camping out the night before. We do that with trials now too. Oh my goodness. You'll post pictures. Okay. All right. I will be looking for them. That's going to be crazy, Denise. You go, girl. It'll be busy, beginner. I'm telling you, it's going to be a crowd to get in there. You know, I can only imagine. That's just totally going to be crazy.
Triggers the worst in us. And at best, you come out with a bit of trauma and a bit of neurosis, but it can go bad real easy. And then you think that's normal, right? That it's okay for people to be like that. And that's just, it's so sad. It is.
And I get it that as a parent, right? You want to keep your kids safe. You only want the best for your children.
Right.
I only want the best for my children. Listen, our oldest son is married. And when he would bring girls in here and I would be like, There was a couple of them. I was like, dear Black Jesus, don't let him marry this girl. But I was like, let me keep my mouth shut, because we were a blended family. I had a kid, my husband had a kid, and then we had two kids together. So this is technically my stepson, but that's my baby still, right? And so when he finally brought his wife home, I was thinking to myself, oh, that's not who I would have picked, right? Because she was divorced, she had 2 little kids, and I was like, now I had never been married and had a kid, and I got married, and I was like, well, I was minding my business, but this is not what I wanted for my children. And so he brings this girl in and he's like, I love her and we're going to live with her parents. And she believes in the family home. We can all live together. And maybe at some point, my son says to me, maybe you and dad and my brothers can come down and we can all live in one big house together.
Girl.
That sounds like hell.
I was like, get thee behind me, Satan. And what we're not going to do today is that.
He's a cult. No. It's a family. That sounds like a family compound.
And so I was like, baby, wow, you sure this is the girl for you? I feel like she's not the girl for you. And next thing you know, she's pregnant. I was like, well, I'll be damned.
I'll be damned. I hear you.
I know he did not. And they've been married for 10 years now. They have 4 children.
Oh.
They live in a family compound. It is my son, his wife, their 4 children. She had 2, and then they had 2 together, mirroring what his father and I did. And then her parents live in the same house with them. They've all gotten together and bought a big house where they all live together. And God bless. It is not I would have wanted.
That happens. Look, now that I think about it, a lot of my mom.
Okay, that's funny. That is really funny. Okay, look, they are now, we're going to go back to court for a few minutes. They are at lunch. Okay, so let me explain this. Ashley Wilcox said they're at lunch and they're discussing something about a witness and testimony outside the jury presence. So let's listen into that real quick and see what's going on with that.
Let's go ahead and get started with the issue.
He sent officers
to
Bellingham, Whatcom County, to pick up my client after she was denied entry in Kingdom. He has no
on attempted murder.
I gotta get it back to spot.
And it's true that every state.
Hold up.
I think that she
I got button happy.
And we've talked about different charges. Yeah, absolutely. It's not yet returned from their lunch break. And so we want to bring you the attorney speaking with the judge over an upcoming witness and hearsay concerns, again, outside the jury's presence.
Let's go ahead and get started with the issues related to the testimony of witnesses who are scheduled for this afternoon. I don't know who wants to outline that issue. Maybe Mr. Leary?
All right, so I previously had talked about, I had flagged Howard, Knight, and Robinson. I did have a chance to speak with them. So about Officer Howard, she did indicate that it was her intent to simply say, Officer Howard, who did you speak to? I spoke to Isaiah. And that's it. And then say, did you receive anything from Isaiah? Yes, I received a video from Isaiah that I entered into evidence. So I don't have an issue with that testimony. So I think we're good on Howard. And if there's something comes up, then I will obviously object. The next is Officer Knight, and that is where I think we're going to spend a little bit of time talking. So there's a series of things about kind of the background hearsay that Ms. Stone indicated that she's not getting into, and I think that the crux of the disagreement pertains to my client traveled, she has family up in Vancouver. And was traveling up to Vancouver, I believe, around 21st or the 22nd.
Can you clarify Vancouver, BC versus Vancouver, Washington?
Vancouver, BC.
Okay.
And that her boys were up there with grandparents. And she went to the border and apparently was turned away at the border and then detained either on probable cause or on a warrant for this case, and then brought to the Whatcom County Jail, where she was then picked up from the jail, transferred here, and has been in custody ever since. So, it's my understanding the state wishes to elicit from Officer Knight that my client was turned away at the border, was detained in Whatcom County, and then transported from Whatcom County down here. Rocha talks about hearsay for a that it's not offered for the truth of the matter asserted. I don't even think we're there. I mean, this is evidence that is being offered hearsay for the truth of the matter asserted. The state is attempting to establish that my client attempted to travel to Canada, was turned away at the border, was arrested and detained in Whatcom County. And so, reading the rule, 801C says hearsay is a statement other than one made by the declarant while testifying at the trial or hearing offered in evidence to prove the truth of the matter asserted. Officer Knight has no personal knowledge as to what happened at the border. He was told by repeated, I think in his statement, he says, I heard from repeated people or multiple people that so he says in his report, on October 22nd, 2024, shortly after 1900 hours, I was contacted by multiple entities and advised, he misspells Zahraa, but I believe he's referring to my client, was denied entry into Canada and was currently in CBP custody at the Blaine, Washington Port of Entry. So all of his information comes from other law enforcement officials, statements that he has received, and the state now wants to have him testify as to that he sent officers to Bellingham, Whatcom County to pick up my client after she was denied entry in Canada. He has no basis of knowledge. The fact that he directed officers up there, he doesn't know where
All right, again, these are arguments outside of the jury's presence. We have learned that the jury is now entering the courtroom. They have a 2-hour lunch. They've just gotten back. So perfect time to take a break. When we come back, we'll get you back inside that courtroom live. Stay tuned.
No, Ashley. No, you can't take a break.
Parents face a jury. Police arrived. We want to go back into court. Now, as I mentioned, they are back from their lunch break. However, the jury has not yet entered the courtroom because the judge is discussing hearsay concerns with those attorneys outside of the jury's presence. Let's go back in.
I told the jury 145, they are all here. Any issues to address before the next witness is called?
Sure. They have. Good afternoon. With respect to Ms. Robinson, I think I understand what she's going to potentially say. I would have an objection to questioning along the lines that the school had safety concerns for Fatima. I don't see how that is relevant. Wasn't communicated to my client. And so obviously the statements about hooking her up with social services, finding a place to stay, those things that were provided to Fatima that day, I think are admissible, but like generalized concerns for her, we would object to.
All right. Ms. O, is this your witness?
Yes, Your Honor.
All right. Respond.
Your Honor, with regards to Ms. Robinson specifically, I think the fact that that line of questioning is appropriate along with her answers for multiple reasons. One, I do believe it is relevant. Throughout the course of this trial, not necessarily from Mr. Leary, but from Mr. Kading, and the state is trying both Mr. Ali and Mrs. Ali simultaneously. And we also have to address any potential arguments that Mr. Kading has made through the course of this trial. During cross-examination of Fatima, Mr. Kading asked her on multiple occasions about this idea that Fatima testified that she feels safe at school and she enjoys school. And Mr. Kading on cross-examination asked her in multiple ways about how clearly that is not accurate, because she also indicated that she had skipped some classes. Mr. Kading had also asked her on multiple occasions during cross-examination, basically in essence calling her a liar In fact, he specifically asked her, isn't it true that you lie when you want to make somebody, when you're afraid of making somebody mad or unhappy, along those lines. And he also, at one point, when I believe she was confused by the form of question, and her answer to Mr. Kading was a little bit different than what her answer was to Ms. Stone on direct examination, Mr. Kading again stated, you said something that was different earlier on direct, so are you lying now? So on multiple occasions, he used the word lying to, in essence, describe Fatima. Fatima also testified that she felt safe at school and that she had resources at school. And I anticipate that Ms. Robinson is going to testify that, well, Ms. Robinson is a mental health specialist, and as part of her role as a mental health specialist, she in fact had many contact with Fatima while Fatima was enrolled at Timberline High School. And during the course of those conversations, Fatima talked to her about her own family and the dynamics within the family. I'm not going to ask Ms. Robinson about specifically what Fatima said. I'm simply going to ask her that whether after talking to Fatima during the course of those conversations, if she's ever had any concerns for Fatima's safety. I do believe it is important because on the day of this incident, Ms. Robinson was in fact the school official that Fatima went to see that morning. And she spent the most time with Fatima on that day, and she was the one that came up with a safety plan for Fatima. And all that is relevant because, again, Mr. Kading, on behalf of Mr. Ali, is in essence trying to paint this picture through the course of his questioning of law enforcement officers when it comes to how the school would deal with runaway situations, and with Fatima herself on cross-examination, trying to paint this picture that she basically, for lack of a better way of saying it, is a bratty 17-year-old teenager who just didn't want to go on a family vacation, and therefore she ran away from home. And that is not the situation in this case, and the state has a right to rebut that claim. And I anticipate that Ms. Robinson is going to testify that she could not report to Mr. and Mrs. Ali that Fatima was with her because she could not break privilege due to the fact that she is a mental health specialist, and Fatima never gave her permission to have her tell her parents that she was at the school. And Ms. Robinson will also testify that she didn't report to law enforcement because at that specific moment, there was no imminent risk to Fatima's safety since she was at the school. And her concerns was something that will happen, that could happen in the future. But despite all that, she still developed a safety plan with Fatima. And she, in fact, also connected Fatima with the national runaway hotline. And then also she connected Fatima with Ms. Goddard, who is a student navigator, and together they eventually came up with basically setting Fatima up to go to a local youth shelter. And so based on the totality, I do believe that Ms. Robinson's testimony about her concerns about Fatima's safety is relevant, and that there is no prejudice to this because we've already heard testimony from Fatima herself that she had concerns for her safety. And again, as I indicated, Mr. Kading has spent a lot of time on cross-examination of various witnesses trying to paint this picture that basically Fatima just didn't like she didn't like this trip that she was going to take, and so therefore she ran away, which is not the situation here. Thank you.
Thank you. Mr. Larry?
I do think the state can testify that the reason for not telling the parents is because there was a privileged conversation with her student. And so I think that puts things into context in terms of the fact that they concluded that there was no imminent risk, so therefore mandatory reporting or other law enforcement triggering events did not compel her to report to law enforcement. I think that is admissible. My concern is the generalized concern for Fatima's safety is based on hearsay conversations with Fatima. It touches on 404B that the state said that they weren't going to elicit. In terms of, they're not saying that, yes, the state chose to try these cases together. I have to represent my client's interest I will note that Mr. Katie's questions about whether or not she felt safe at school or enjoyed school, the state in their initial direct elicited testimony that she had skipped class but had stayed in a bathroom or stayed in school. I believe Mr. Katie then followed up and said, well, that's not 100% complete because there are also times where you skip school and went to a Safeway. And she said yes. In terms of the, talking to her about not telling the truth, the state elicited on their opening direct that there was a hearing which she admitted under oath that she testified under oath and admitted that she didn't tell the truth to the court. They elicited that information and Mr. Katie followed up on that. So I don't think that the questions asked by Mr. Katie opened the door, certainly didn't open the door to my client. And I think having the school testify ambiguously about
Thank you so much to Natasha Scruggs for joining us today. Coming up next, of course, our Michael Ayala joining me for more of the attempted murder trial for Ihsan and Zahraa Ali. Stay with us, Court TV, your front row seat to justice.
No. Y'all need to show the trial. Y'all hear my squeak toy? Squeak toy activated back here in the background. These dogs. Squeak, 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 squeak. You have signs for no soliciting, but they only see beware of dogs. They want to ring the doorbell. I have signs out front too, and people don't care. They're gonna ring that doorbell. They're gonna knock on that door. They don't care. I have my little doorbell camera. I just push the little button on my doorbell camera, and I'd say, "Not interested. You can leave now." And then I let go of the doorbell. And I ignore them. I'm so rude like that. I'm not a social person when it comes to that.
Mom's friends are like that here, where they'll have their parents living with them, like in the same house, not in like a house out back, in the same house.
Yeah, in the same
and
house.
I'm just like,
you're sharing a kitchen. You're sharing a bathroom. I bet you I'm not. But my daughter-in-law is like, Mama. And for a long time, I was like, why does this have her calling me Mama? But I love her now. She's really wonderful. Yeah. But look, she had to grow on me. I had to grow on my mother-in-law.
It's an adjustment.
My husband had, yes, it's an adjustment. But I wanted something. There was another girl he dated that I really, really liked, but she wasn't feeling him like that. And I was like, well, can you just go make that happen? And now I have 3 more sons that I can have opinions about.
Quietly on the internet. You can have them quietly to yourself on the internet with your true crime friends.
Nobody needs to know. It's our secret.
I'm gonna be like, y'all, you ought to see this heifer. You know what I mean? There was one girl.
Decisions everywhere.
One girl came to my house causing all kinds of trouble. I made my police body cam debut. I talked about it in a members only video. Whoa. It was very traumatic. It was traumatic for my child. The police had to get involved. It was a situation. That heifer's gone. We did not, unfortunately, unalive her and bury her in the backyard. I promise. She's still alive. I have not seen her in over a year, thank goodness. But because I was raised thinking I was a possession to be possessed, I have been intentional about raising my children to be independent. And when they constantly come to me with, what should I do? What should I do? What should I do? And I say, what do you think? How do you feel? Over and over and over, because I never knew what I thought. I never knew how I felt. And it was important for me to give that to my sons. If they were going to go out into the world and be something and be somebody and not be empty vessels to be filled up by someone else. I feel like Fatima's mom specifically was probably raised to be an empty vessel to be filled up by this man who is violent and wanted his own best interest.
Right.
And she attempted to raise daughters who were similarly situated. And she probably doesn't know what to do with Fatima. She's like, I did what I was supposed to do. What are you over here doing?
Yeah. And that's that mourning, right? Like that hysterical mourning where I have to get to my daughter. Right.
Yes.
And it's so tragic. It's so tragic. And, again, it's that like, how do you recover from abuse? How do you do better yourself, it's such a long journey. But I'll tell
Yeah.
you, you know, just speaking of moms and sons, various girlfriends my brother brought home, there were times when my mom and I looked at each other and were like, she's not fully committed and there's something going on. And this is a girl who'd gone to Yale Law School, worked for the ACLU, and we're like, I think her family's promised her to somebody back home.
Really? We had a nanny
Yeah.
for my youngest son, and I remember her saying to me, she was debating whether or not to get engaged, and I said,
Yeah.
"Oh, who's the boy?" And she said, my parents have seen his bio data," and I was like, "What does that
What?
mean?" And she was
Yeah.
like,
Yeah.
like it was like a fax or something. It was like
Yeah.
her
Yeah.
resume.
Yeah.
Because she was working for us. She was getting her master's degree. And the fact that she was finishing her degree made her more valuable. And so she was like, you know, her parents were ready to get her married off. And she's like, I'm waiting. Oh, Miss Kathy, another proposal came in. First of all, I was like,
Yeah.
this me for my childcare situation. Because she was going to school at night. She was watching my baby during the day.
Yeah.
And ultimately, she chose a boy. And she said to me, do you and your husband have a love marriage or arranged marriage? And
there you go.
she said, because she saw how we were with each other, that we loved each other, she assumed that it was an arranged marriages, because she said, everyone knows love marriage doesn't work. Girl, this is North Jersey. It's all love marriages, mostly love marriages. And she's like, oh no, love marriage is very bad. I was like, oh, okay.
Well, and that's because, again, like that, it's this thing. Remember what I was saying earlier is like, you don't really know whether your parents are better than yous or zombies until you get into this process. So like,
right.
You know, my friends and I used to joke at college of like, because we were all born here, right? And our parents were like, oh no, what's going to happen? Our parents were all having nervous breakdowns when we went to college. And we were joking that like, okay, so right now our parents are starting to want us to get married after college. And it's like, oh, we want a nice Indian boy, a nice Pakistani boy, nice. And then they're like, after a while, they'll probably start a Muslim boy from somewhere, Muslim boy. Muslim boy. And then after that, they'll be like, okay, just a man of any variety.
Anybody.
And we figured by like 30, 32, they'll be like, just give me grandchildren. Just give me grandchildren. I don't care how turkey baster. Don't care. Just want grandchildren.
Yeah.
But I think for a lot, like they go to the left, right? Like in that continuum of like what the life I want for my daughter, some of them just like go all the way to the left, right? And they just fall off and they start doing crazy shit. But you know, the nanny you spoke about, that is a very common thing in India, right?
Yeah.
Like that's where the ads come from. Like if you've ever seen these ads, it's that bio data. That's what they call it. It's we want, because like, so for instance, in India, what used to happen is you would marry within your community and maybe two villages over, right? Like my dad's was like, there was a set of like 7 villages that had all come to that part of the country. They were all farmers, same class, same religion, same group, same ethnic group, language group, everything. And they all sort of married within these villages, right? And so it kept your daughters relatively close.
Yeah.
You know, your daughter might marry that boy and his sister would marry your son, you know, those kinds of things. So it kept all of that close. And as people moved away from their villages, now they do ads. So again, it's like, you need to be part of this caste, this language. You should come from this part of the country. You know, your family should originally be Kashmiri or whatever, Tamil. You should be this skin color, this profession. And the idea is, and this comes back to the like, parents want the best. And if you think that the best is for your child to have a marriage where it's all very clear, it's a contract, right? It's not a like love marriage, right? It's a like, we're going to get married. We both have professions, same profession often. So like a boy and a girl who both went to medical school, they'll get married and they'll start a medical practice. And the boy, you know, the guy.
Makes good business sense. It's excellent
exactly
business sense.
Right. Or like somebody who understands your traditions, because traditions are often very specific to communities, right? And to specific micro communities within the larger group. And so the same kind of food, like you want your son to have his home cooked meals. So it has to be a girl who knows our kind of cooking, and that you can then train to cook your son's favorites. And that cultural connection and that clarity about what the marriage is for, that's good.
Right.
That's good.
I mean, it's so interesting because in America, right? Because people move around so much more. There's a lot of cross-cultural marriages, even within the same race or similar backgrounds. Like I am married to a Black man, but we are 100% in a cross-cultural marriage. He's from the South Bronx. I'm from Indiana. You know, his parents like were regular working class people. My mother was an executive. So there's just like all these ways in which, like a corporate executive for a very, very long time. So there are ways in which we're very different. We like different kinds of music. We have different life experiences, all these things. And we come together and we make it work, not because of we want to. I mean, because we want to, not because we have to. But I could see where parents are looking at it and think, well, it would be so much easier if you partnered with somebody who was very similar to you. And whether that's an economic similarity or a religious similarity. And I'm mindful of the fact that most of you and I mean, I've lived on the East Coast for 35 years at this point, right? You're born in New York and you're living in California. The audience for this conversation, and probably most everything, is the middle of the country, where it may be like if you move from Kentucky to Indiana, there's not that much cultural difference, right? You want somebody, if you like, I was listening to an audiobook this morning, and it was about this guy was picking a jury, and he said, I wanted jury members that were from South Carolina because it was a South Carolina case, and people, some folks in South Carolina don't trust those outsiders. And so it's like, you want somebody who knows all the things, who's familiar, who says, Roll Tide or whatever sports ball thing or whatever it is. Right.
Yeah.
And so I think that we as Americans look at this like, oh, those ridiculous people, those Muslims, or those this or those that. But we have our way of doing the same thing. People from Chicago are really proud they're from Chicago. People from Boston are like Boston strong, whatever. And I don't think there's anything wrong with that. But I think it's also important for us to realize that whether we're talking about the Ali family or, the family up the block, like, so many of us are so much more similar than we are different. It has a different face.
Exactly.
The Christian families, the Christian family who doesn't want to talk to their gay son, the Adelsons down in Florida who don't talk to Rob Adelson because he wanted to marry this Indian girl, the gay people, the straight family who threw out their gay kid, or like, I'm throwing my trans kid away, or whatever it looks like. Whatever face it takes. It can take any kind of face. But
absolutely.
I wanted to end on I said I was going to do an hour. We're an hour and 20 minutes in. I'm a chatty Cathy. You failed shut up class. Child, we are a mess when we get together.
Absolutely.
But I feel like that, hopefully this is a pre-record and not it's not a live stream, so that we could I didn't have to focus on this side thing with all these other people going. But this has been such a rich conversation.
Wonderful.
I love this so much. Any last thoughts, final words?
No, just that, like, I love this community, right? Because like, it's really hard stuff. And I think this is probably, I feel like some of your live streams are a little bit more like straightforward, like that kind of conversation, which I've really loved. And a lot of your daily videos are super funny because you kind of have to laugh or you're going to cry.
Yeah,
right?
for sure.
And I think it's been really interesting how, like, a lot of the true crime stuff is like watching a car wreck, like Sarah Boone. But a lot of the time it's like trying to understand our fellow human beings, right? And we see somebody in extremity, right?
Yeah.
Like this guy who's just wigged all the fuck out, right? Like the dad, right? Like, or any abusive DV situation. And you think it can reflect back of like, okay, so what kind of expectations do I have for my kids? What would it take for me to get that bad? How anxious am I, right? That like flailing, anxious fear that the mom has. how would I deal with it with like my kid if they did something really dumb, if they had some high school romance that I really didn't like? How would I handle it? And I think there's a lot to be learned from looking at these extreme situations.
For sure.
Because we're all human, man. We all have these things in us that we've got to work on, that we've got to be self-aware about.
Yeah. I think all of these cases put me more in touch with my own humanity. I try to feel like everybody is my teacher. Sarah Boone is my teacher. Alex Murdoch is my teacher. The good ones and the bad ones. Like they can show me who I want to be, who I don't want to be. And honestly, sometimes I'm like, oh, thank goodness I didn't do that thing that she did or he did or whatever. I don't think like this or like that. There's a way in which it could be an ego boost, but it also, if I really look at myself and think about like, oh gosh, if I kept drinking, could I have been Sarah Boone? If I had become, because I do everything to extreme, right? I don't have like one YouTube channel. I have two, and I do all the things and I work a regular job. You know what I mean? And there's a part of me that really wants Fatima Ali to become Malala Yousafzai. Like I want her to go out and be a global speaker and save the world. When really the fair thing from my point of view is that I just want her to have a really lovely life that she gets to choose for herself. And shouldn't we all have that? Shouldn't we all have that?
Exactly. Absolutely. What a wonderful, I feel like sending her a greeting card or something now and being like, hey.
Right?
Like,
listen, I think she's in high school still. I think she redid her senior year or whatever. I hope she's able to go off to college and find her people. You know, I hope that the community comes together and is the good mother for her and for all the girls like her whose name and boys whose names we will never know. If they are straight, if they are gay, if they are, regardless of their religion, their background, their income level, their skin color, any of the things.
We all deserve good families. Yeah, we all should find our people and that healing that keeps us from going down these roads. No zombies, man. Like, turn away from
no zombies. And in the meantime, we can just get together on YouTube and like check.
Okay. That was a good interview. That was a great interview. And I'm glad Kathy gave me the permission to play that during all this long break. So, let's go back over here. There's still, wait, I lost connection. Hold up. I have to drop it. Stop screen. I have to redo it. Hold up. All right. Oh my goodness. Court TV went to a big screen view for a moment there. That was cool, but we know that won't last. So, all right, let's hit play.
404B provides an undue risk of prejudice as far as the jury's not going to know. The jury did hear testimony from Fatima that she had concerns about her safety going to Iraq. So that's not what they were going to talk about, concerns for her safety with her family and generalized concerns, but not go into it. I think it is misleading to the jury and will lead them to speculate improperly as to what's going on. And so I think that they can say, we didn't talk to the parents, and here's why. We didn't talk to law enforcement, here's why. Here's what we did. We provided her with a safe place to go, and we lined her up with that. And I think that is appropriate testimony for their record.
So first of all, I'm not going to indicate what questions specifically can and cannot be asked. And I know that that's not what Mr. Larry meant, but he was saying, well, I think it's okay to ask this question, this question, this question. I'm not going to be that detailed. In the direct of Ms. Robinson, whether or not she had a generalized concern for Fatima's safety, may be relevant to explain all of the things that she did with Fatima on that day. The general concerns of the school, absolutely not. No one can testify as to the school's concerns. I don't know, maybe the principal could, but I don't even know that he can. I think that this witness can only talk about her contact with Fatima, how she knows Fatima, and then what she did on October 18th. And I would prohibit specific any specifics being testified by this witness as it relates to things that Fatima told her, which gave rise to her concerns. Ms. O said she wouldn't offer that. Mr. Leary has argued that he's concerned about the potential of 404B, which the court certainly understands. There is nothing specific that will be testified to other than her generalized, if that's what she says, that she was concerned for Fatima's safety on that date, or concerned for Fatima. I don't know what she's going to say, something along those lines. And it is relevant to explain her contact with Fatima and apparently things that happened while Fatima was at the school. It is consistent with information that Fatima testified to as it relates to feeling safe at school. She testified that's why she went there on October 18th. I don't think she used the words, "I had nowhere else to go." But she did indicate that that was her safe place. And absolutely, through cross-examination, the inference is that Fatima is an almost adult who did not like the rules of her home and had a relationship she was not supposed to be in, and she ran away and wasn't following her parents' directive. This, and that there was no basis, that was just kind of like teenage angst. I don't know if that's the right, but rebellion, teenage rebellion is really what the argument is. And that's defense theory, and the defense absolutely gets to develop that and argue that, and that's what they have been doing, at least as to Mr. Kading on Mr. Ali's behalf. But the state has the ability then to present rebuttal to that, really, that it was not just a rebellious teenager who was acting out against rules just because she was 17 and didn't want to be told what to do. And that's where the relevance lies as well. So I think I'm sustaining and overruling the objection. It is somewhat limited, but Ms. Robinson can testify as to her generalized concerns based upon her interactions with Fatima without going into any specifics. Bring the jury in, please. You can go ahead and have the witness come.
Right. So here, Judge, what they're dancing around is this idea of what we talked about earlier from the beginning of the trial, that they can't talk about the honor killing, et cetera, but you also have to be careful not to just let this jury think that this was just some kid involved in teenage rebellion. There was more there. So just how much do you let this woman testify to? That's what this was all about.
Absolutely. And I like the way the judge broke it down, was very specific about the different items and that she felt safe at school and some of the things she's allowed and not allowed to say. We understand that witness, this is Elizabeth Robinson, is now on the stand. Let's get back in.
Fatima was a student of Timberline High School.
No, she wasn't.
Okay, and do you know where she was attending school?
She was attending school at Summit Virtual Academy.
Okay, and is Summit Virtual Academy still part of the North Thurston School District?
Yes, it is.
Okay. And after Fatima started classes with Summit Virtual Academy, were you able to have any contact with her?
No.
Okay. And prior to Fatima starting with Summit Virtual Academy, do you know if she was a student at Timberline High School?
Yes, she was.
Okay. And while she was a student at Timberline High School, did you have any contact with her at that time?
Yes.
Okay. And was it in your capacity as a mental health specialist?
Yes.
Okay. And do you remember how many times Fatima went to seek your services?
I don't recall.
Okay. Do you recall if it was once or more than once?
More than once.
Okay. And Ms. Robinson, in general, if you as a mental health specialist have a student that comes to you and you have a concern about their safety and and they indicated that they have run away from home, what actions can you take as a mental health specialist?
It depends on the situation.
Okay. What are some of the actions that you could take?
Some of the possible actions that I could take is providing resources for them for a youth shelter, calling law enforcement, or calling DSHS.
Okay. And with regards to calling law enforcement, does it require there to be a imminent risk for student safety at that moment while they're with you?
Yes, it does.
Okay. And with regards to some of the outside resources that you mentioned, such as a youth shelter, do you know whether, well, let me ask you this question. Do you have any experience in dealing with those outside agencies?
Yes.
And do you know whether those outside agencies have any requirements to do notifications to parents or law enforcement if they receive a student that is potentially a runaway?
Objection, calls for hearsay.
Overruled. And do you know whether those outside agencies have any requirements requiring them to do notifications?
Yes, they do.
Okay, and is it required by law?
It is required by law. They have 72 hours to notify parents, and usually they do so within 24.
Okay. And do you know a student by the name of Isaiah?
He's a student at Timberline High School.
Okay. And you already testified that you know Fatima Ali. The times that you also testified that Fatima, while she was attending Timberline High School, went to speak with you on more than one occasion. Without going into the specifics of what Fatima discussed with you, did she, when she sought out your services, did she speak to you about her family?
Yes.
And does she also speak to you about the dynamics within her family?
Yes.
Okay. And based on your interactions with Fatima, did you yourself develop any concerns for her safety?
Yes.
And October 18th of 2024, I want to ask you a few questions about that day. Did you have contact with Fatima on that day?
Yes, I did.
Okay. And do you remember approximately when you first had contact with her?
She came in around 9:30 a.m.
Okay. And where did you first see her that morning?
All right, we need to step aside for just a moment. On the other
Why?
side of the break, we will
Why
have
do
more
you have to step
testimony in the
aside?
attempted honor killing trial.
Why do you have to step aside?
School starts each morning.
It starts at 7
in high school.
Outside of my office.
Okay. And Ms. Robinson, do you know what time school starts each morning?
It starts at 7:30 a.m.
Okay. And when you saw Fatima sitting outside your office, did you speak with her?
I did.
Okay. And where did you speak with her?
In the counseling center.
Okay. And where is the counseling center located?
It is right next to our front office in the front of the school.
Okay. And did you at some point also speak with Fatima inside your office?
Yes, I did.
And where is your office in relationship to the front office?
It is also in the counseling center.
Okay. And without telling the jury what she specifically stated to you, well, let me ask you this question instead. Were you made aware by Fatima that she had left home that morning?
Yes.
And were you also made aware that her intention was not to return home?
Yes.
Okay. And without going into the specifics, did she talk to you about her concerns about a trip that was coming up?
Yes, she did.
Okay. And while Fatima was inside your office, did you connect her with any outside agencies?
Yes.
Okay. And which outside agency did you connect her with?
I gave her the phone number for the 1-800 runaway hotline.
Okay. And did you in fact call the national runaway hotline number for her?
We called together.
Okay. And was there a conversation with that hotline?
Yes.
Okay.
Watch your steps.
And the concerns that you have, Fatima, did you share that information with the hotline?
Yes.
Okay. And at some point after Fatima being in your office for a while, did you also connect her with another school official?
Yes, I did.
And who did you connect her with?
Our Timberline student navigator.
Okay. And what's a student navigator?
A student navigator is one of our staff members that helps students that are struggling with housing instability or have run away.
Okay.
You know what?
And after Fatima,
I have to say one thing. I am older. We did not have that kind of stuff back in the day when I was in school. I've never heard of this at a school. I mean, honestly, I've never heard of anything like this. This is amazing that this is available in schools. I'm intrigued. I'm totally intrigued.
You indicated that you connected her with a student navigator. How long was Fatima in your office approximately before you connected her with the student navigator?
It was approximately 2 to 2.5 hours.
Okay. And while Fatima was in your office, did you also work on a safety plan with her?
Yes, we created an extensive safety plan.
Okay. And after Fatima was connected with the student navigator, did she come back to see you in your office?
Yes.
And during the course of your contact with her that day, did you and other school employees provide her with any items?
Yes.
And what kind of items did you provide for her?
We provided her a blanket, a sweatshirt, a hat, and a Chromebook to take to the youth shelter.
Okay. And you indicated that those items were provided for her to take to a youth shelter. Do
They
you know
gave
whether
her a Chromebook to
a
use
setup
too?
Let me rephrase my question. Do you know if there was a placement for her at a youth shelter for that evening?
Yes, our student navigator was able to get a bed scheduled for Fatima for that evening.
Okay. And then at some point, did Fatima leave your office?
Yes.
And did you walk her out of your office?
Yes, I did.
Okay. And prior to her leaving the school building, did she connect with any of the students there?
Yes, she did.
And who does she connect? And after Fatima and Isaiah went to the bus stop, did you go back to the front office?
I did.
Okay. And when you went back to the office,
All right, I want to bring in our guest joining us this hour is criminal defense attorney and former head prosecutor Bob Bianchi. Bob, always a pleasure to have you on the show. Great to see you today. And I just want to say, I think this is extremely important testimony. This particular witness is an uninterested third party, a professional looking at the situation. And I thought the prosecutor really navigated some of the minefield here very, very well. She got across what she wanted to get across, the idea that the victim in this case, Fatima, was afraid, and she had talked about issues in her family before, and whatever she was afraid of led this woman to make the decision to send her to a shelter. I think that's where we wanted to go, given the idea that they can't talk about these honor killings, arranged marriage, etc.
Michael, you just said it. I sometimes this is such a nuanced tactical error. There's so much
We'll listen to them for
beautiful and
just a
robust
second.
law about hearsay and 404 and what can be testified to and limiting instructions. So the judge is essentially allowing this witness to do what we call res gestae. In other words, why did you do what you did? Now, I'm telling you as a former prosecutor who's been exactly in this situation, sometimes not letting the information out because the defense doesn't want it out even works better for me. The way this prosecutor is doing it is so clear to the jury that whatever she's not, the prosecutor, allowed to say must be really, really bad. That's what I think this jury is speculating. And to your point, it was so bad that it caused her not to call her parents for
You might be right,
reconciliation or
Lois.
social services, but
I mean, they're, I mean,
you're leaving in the jury's
you know,
mind this huge speculation.
I mean, I never thought I'd be here anyways. I enjoy you hate court TV. I used to watch court TV back in the day, and I kind of got away from it when I learned about watching trials through local news stations. I got away from watching the court TV trials because honestly, and this is just my opinion, everybody's entitled to their own. A lot of times I watch with court TV, they get biased and they always lean towards prosecution side. Always, it seems, even in some where the defense is there's reasons we have a defense, and I it's just a lot. It's a lot. It's a new way of society. It is. It is. It's a new way of society interacting.
Is the end of that language. If there's no danger posed, of course, if the child's at imminent risk, then they can intervene.
Lola's over here cutting up.
No, I don't think law enforcement can do.
I don't know what she's doing. All right, let's put a spotlight on Lola for just a second.
At least, is it 3 decades already? I've been practicing.
Here we go. Here's Lola.
We've gone to a place
Say
where
hello, Lola.
law enforcement rarely question corporal punishment and
talk.
parental decisions, and parents were
get all up in the camera. Yeah, say hello.
Because they're
say hello.
The parents.
Watching mommy stream because you're a good baby.
In the schools. Now we're getting to a point where
See
that question is so precious.
He's a baby.
The pendulum swung to such a place right now where if there's no abuse to
I agree. Too many commercials and self-promotion. It's a lot. It's a lot. Let me hit on to live, see if we see they're on their little break. And on their little break thingy, which is quite interesting. I gotta turn that light down a little bit. She is. Thank you guys. She is. She's been a little blessing. She's been a little blessing considering that, Hector showed me her picture and it's like, don't you want to be a mom again? And I'm like, and it was Mother's Day. So of course I had to say yes. Eventually it came down to me saying yes. But anyways, what I was saying was over here, people are leaving comments. Court TV, you need to do better. We've had to deal with so many breaks and long lunches just when it's getting going. Another glitch with minors' names being used. So your idea is to bombard us with repetitive, long. I mean, people are not happy with this new court TV setup. People are getting off work. I didn't really read the rules yet. I probably should. Judge was not happy with court TV yesterday. Maybe she blocked the live stream. I mean, reading some of these comments is like, yeah, court TV is they're having issues. So, I mean, it is what it is. People are not liking this new little setup thing they got going on, but this is, and you know what, I have looked and this is the only stream for this trial. Court TV is the only pool camera in this court. So it's court TV or nothing. So we have to just suffer through their, Lola, stop digging. So we have to suffer through all their breaks and everything.
Death by strangulation happens in a time frame very quickly. 3 to 4 minutes of occlusion can cause death. It doesn't take very long
right
to occlude those.
They would have 2 to 3 breaks in the beginning, give themselves time to edit stuff. There are too many breaks and little editing. I mean, it's
of day 6 of testimony in the attempted honor killing trial of Ihsan
You know,
and Zahraa Ali.
I preferred how they were doing it before.
The pediatrician spent most of the day on the stand testifying about strangulation and Fatima Ali's injuries from an alleged chokehold by her father.
All right, let's head back to court now, where the mental health specialist at
All right, they're going
Timberline
back
High
to the
School
stand. So
is wrapping up
we're
her
here we go.
Goodness. I spoke to Tracy Arnold.
Okay. And what, if anything, happened while you were speaking to Tracy at the front office?
I was talking to Tracy Arnold, and Fatima came in through the door of the front office and said he tried to kill me.
I can ask some additional questions.
All right, I'll sustain at this point.
Okay. And Ms. Robinson, when Fatima first came in through the front office, what would, based on your observations of her, did she appear calm to you?
No.
Okay. And what was her demeanor like?
She was staggering, and her demeanor was scared or anxious.
Okay. And what did you observe that made you think that she was scared and anxious?
She, it was the way she was walking.
Okay. And then with regards to when she made that comment, what did her voice sound like?
She sounded really upset.
Okay. And what comment did she make when she staggered into the front office?
He tried to kill me.
Okay. You indicated that the way she was walking, you described it as staggering. Can you sort of expand on that a little bit? How was she walking?
It almost looked like she had a limp or something, because she wasn't walking like she would normally walk. She was having like trouble getting into the office.
Okay. And prior to you walking her, well, let me ask you this question. Prior to her leaving the school building with Isaiah, during your contact with her on October 18th, did you see the way that she was walking?
Yes, I did.
And the way that she was walking prior to leaving the school building with Isaiah, the way she walked into the front office after they got to the bus stop, was there a difference?
It was completely different.
Okay. And after Fatima indicated he tried to kill me, where did you end up taking her to?
Tracy Arnold said get her to a locked room.
Okay. And did you, in fact, take Fatima to a locked room?
Yes.
And whose room or office did you take her to?
My office.
Okay. And when she first staggered into the front office, was Isaiah?
He was.
Okay. And when you took Fatima into your office, did Isaiah take him into your office?
Yes.
Okay. And after you took Fatima and Isaiah's, what did you do with the door?
I locked the door and shut the shade so that the window wasn't visible.
Okay. And do you know whether at some point the school was placed on lockdown?
Yes, it was.
Okay. And what is a lockdown?
A lockdown is when all of the doors are locked and no one can come in and no one can leave.
Okay. And while Fatima was inside your office, did she also, without specifically stating what she said, did she also tell you what if anything, her dad had did to her earlier?
Yes, he did. Or she did. I'm sorry.
And without stating specifically what she said, did she also tell you what, if anything, her mom did to her earlier?
She did.
Okay. And when she was telling you what her dad and her mom did to her earlier, what was her demeanor like?
She was really upset and was questioning a lot of things.
Okay. And what, did she appear calm to you?
No.
Okay. And what about her voice? What did that sound like?
She was having trouble talking and said it hurts to talk.
Okay. And what did she say while she was upset? What did she say that her dad did to her?
She said that he tried to choke her.
Okay. And while she was upset, what did she say her mom did to her?
That she came around in back of her and choked her too.
Okay. And did you Do you know whether law enforcement was called that day?
Yes, they were.
Okay. And prior to law enforcement arriving, well, let me ask you this question. Do you know whether medics was called as well?
EMS and law enforcement were called.
Okay. And prior to the arrival of law enforcement and the EMS, did you have Fatima and Isaiah, any school medical professionals?
Yes, I did. Our school nurse.
Okay. And then did you yourself, after Fatima staggered into the front office and during your contact with her, did you observe any injuries on her body?
Yes, I did.
And what did you observe?
She had marks on her neck.
Okay. And then what about Isaiah? Injuries on his body?
Yes.
And what did you observe?
His hand was swollen and he had a mark on his head.
Okay. No further questions at this time. Thank you.
Thank you. Cross-examination, Mr. Katie?
All right, we need to hit the pause button. When we come back, the witness does testify on cross-examination. Let's see how the defense tackles her. We'll be right back on the other side.
Why do you have to? Why?
Two parents face a jury
over the attempted murder.
Okay. Probably that guy. That the guy is a jerk. I think so, Lewis. I can only imagine, you know, they're sorry, I got squirrel. See, squirrel. I got sidetracked because it still played in my background. Y'all see this way? Squirrel. Sorry. I was watching over here. I forgot I took it down. It's nothing that I don't know what okay, it is what it is. I'm gonna take a quick comfort break. Let's put it as that. I'm gonna put on a song real quick. I'm gonna put on our break song, and I am going to go do my thing real quick, and we'll pick right up where we left off. So give me just a second.
Breathe deep, the air is wide. Stretch your arms, let the world collide. Step outside where the grass is free. Feel the earth beneath your feet. Watch the clouds as they roll and glide. Let the sun kiss your weary side. Take a moment, let it all unwind. Find the peace that's yours to find. Walk the path where the flowers lead. Hear the whispers of a world serene. Feel the warmth of a gentle breeze. Let your troubles drift with ease. Watch the clouds as they roll and glide. Let the sun kiss your weary side. Take a moment, let it all unwind. Find the peace that's yours to find. Walk the path where the flowers lead. Hear the whispers of a world serene. Feel the warmth of a gentle breeze. Let your troubles drift with ease. Watch the clouds as they roll and glide. Let the sun kiss your weary side. Take a moment, let it all unwind. Find the peace that's yours to find. Guitar hums in a mellow tune under the glow of the afternoon. Every chord a soothing embrace, guiding you to a tranquil place. Watch the clouds as they roll and glide. Let the sun kiss your weary side. Take a moment, let it all unwind. Find the peace that's yours to find.
Okay, they're still on break. Lola, you just want to be involved in everything. She's got to be involved in everything. She's got to be all up in my business. Where's your good baby go? Where's your good baby go? She's annoying as hell sometimes. She's a good baby. She's a good baby. Yeah. She's spoiled. She's so spoiled. You know, I was watching their chat, and in their chat they were talking about how it reminds them of like the Lori Vallow stuff, and that, you know, it's very similar to the way things were handled. Stop, girl, stop, get down. You're causing a ruckus.
Is that accurate?
Yes, it is.
Okay. And so when a student comes and says that they have left home and run away, I assume that over the 9 years, this was not the first time that it happened. Is that fair?
That's true.
Okay. And so your role is to support that student in the moment, correct?
Correct.
And moving forward, right?
Yes.
And so you're not kind of taking an investigatory role in terms of trying to get to the bottom of it. Is that fair?
That's true.
And so kind of trying to triage what's going to happen when that 2 o'clock bell rings. Where's this student headed? Correct?
Correct.
And it's fair to say that you don't want the kid to not have a place to go, right?
Absolutely.
And so one of the goals is the student navigator. So if a student navigator isn't available, do you sometimes assume that role?
I can assume that role.
Okay. And the student navigator is kind of the last piece in terms of figuring out housing, with a shelter being one of the options, correct?
It depends on the situation.
Okay. And so in this situation, the housing option that was presented to Fatima was a youth shelter, correct?
That's correct.
Okay. And absent the student saying, I'm okay with you telling mom and dad what's going on, or dad or mom or whoever they're living with, you're not going to provide that information, correct?
Correct.
And you talked about 3 different options in terms of your notification. Let's see if I can find my notes. So one is kind of connecting and identifying resources for the student, which you did, and then also the navigator, correct?
Correct.
And then if there's an imminent risk for student safety, you would then call 911?
Yes.
Or
dispatch or our SRO.
And that would be the school resource officer?
Yes.
And as a school resource officer, typically always at school, or do they float around to different schools?
It depends on the day. Sometimes they're called to other schools.
Okay. And then the third is to contact DSHS. Is that correct?
Correct.
Okay. And in this case, law enforcement wasn't contacted prior to the end of the school day, correct?
Correct.
And neither was DSHS.
Correct.
Okay. All right. I appreciate it. Thank you.
Ms. Zoe, any redirect? Just one follow-up question. Ms. Robinson, the school resource officer for Timberline High School, was she on duty that day?
She was not.
No further questions.
Thank you. Mr. Keating, any cross-examination?
No, thank you.
Mr. Leary, anything further?
No, thank you.
May this witness be excused?
Subject to recall, but yes.
All right. You may step down and you may step outside the courtroom. Thank you. Call your next witness, please.
Let's bring back criminal
No,
defense attorney,
let us
former
see
head
them.
prosecutor Bob Bianchi to discuss. Listen, I thought the best part of the
No,
testimony
let us see them calling in the next witness, walking in like it was. This is why I prefer trials that are on just local TV stations. We're going to listen to him for a minute
point for the defense.
while we're waiting on the next
Yeah, I mean,
witness.
I don't know the laws of that state, but in most states, I know certainly in New Jersey, you have an affirmative obligation to report immediately to law enforcement. So if that is the same kind of rule or procedure there, you can be assured the defense is going to bring it out. But I will say this, I got to give the prosecutor props. I love the way this prosecutor asks questions, tight, to the point, and she does a thing called looping, where she's using these great words like staggered. I started counting at 3. I think it may have been like 6 times she used that word, staggered in the room, and choked so many times that she mentioned that. With each question, she was placing that word in there, drawing a very vivid picture. She did a really tremendous job.
He is right.
But
He is
Judge,
absolutely
to
right.
your point, in the end of the day, why didn't they do something like that if it was so bad?
Yeah.
Yeah, I agree. Let's check in on a comment from one of our viewers on our YouTube feed. This is Karen Hall. She says, I still think without the honor killing aspect, the prosecution has an uphill battle. And on some level, I definitely agree with that. But I think the way that this, actually the examination, the direct examination, and even the cross went of this particular witness, I feel like they went a long way towards getting over that hump. Bob?
Yeah, I don't know. I don't disagree with the viewer that's putting that in there. And I do believe that started to drive the scenario in this case. But these are just words. These are concepts. It doesn't necessarily mean that was what the intention was. Again, keeping in mind that some of these crimes require a purposeful mental state, which means that was their actual intention to commit that crime. Not that they said certain words. I mean, words can be used, but not in this particular instance.
You know, GSD, sorry, it was beginner. Look, I'm reading and not even paying attention to what I'm reading. It was beginner crafter. Does Court TV have monopoly on the broadcasting trial proceedings? The court should have a look at what they're doing because they're not giving the public the access. Well, I know that there are certain, you know, I know that Court TV was the one that was accepted for the video pool for feed for this trial. I mean, it varies, you know, on broadcasting the trial. You know, like our local news station here in Houston will broadcast trials on their local channel. I haven't caught any lately, but that might be something we'll look into more. But, you know, a lot of like the Florida channels and stuff that we watch trials on, or that, you know, I have access to, you know, will be on their local channel, and we'll have the full live stream on their local channel. And we're able to stream that and not have to deal with the talking heads. Actually, I'm a talking head, I guess, so I shouldn't say that. Ugh, never thought about that. That light bulb goes off in the middle of conversation. Like, well, I guess I'm a talking head in my own way, right? Y'all just see me as a head sitting here talking. But I know there's it's called live. Something live something, and then there's Law and Crime Network also goes in and does a lot of the trials with I'm better than a talking head. Thank you, Lois. I try to provide a little entertainment to these talking heads, you know. We you know, we gotta laugh a little. We might cry a little. Y'all, we never know. We never know what's gonna happen in here. But I don't, you know, I want to just be able to view the trial, and, you know, we can skip through the breaks, you know, like we had been doing. It just made more sense to me. This makes it a lot more difficult. I will complete this trial. But if Court TV is going to continue to do this, we may not be watching trials that are on Court TV very often, because this really makes it difficult on my end. So I will have to pick and choose.
Enough evidence has been presented right now to even convict him because there could be all these sympathy factors that we're talking about here right now.
Oh, he's talking about only being a
And in
sympathy
the end,
factor.
as a lawyer, we give our advice, but the client's going to make the call there. But we also know sometimes, I've always said this to you guys, we love the prosecutors say, we love to convict out of the mouth of the defendant. That's what's most persuasive to a jury. So it is wrought with peril for him to get up there.
And then you wonder, Michael, if he would open the door to
I
things
hope
like honor
so.
killing and that being admissible. You and I talked
Yeah,
about
well,
that.
I'm not sure
I
about the
hope
judge's
so,
ruling if it was
Case One.
absolute, or in fact, could he open the door?
Yeah, it's
I
a
think it's
risk.
because
Maybe.
of all
We
the
just
trouble
don't
they
know
got
for sure.
into.
All right, thank you, Bob Bianchi, as always, for joining us.
Folks, stick around and head in our next hour and get you back inside the courtroom for more testimony
Yeah.
in an honor-killing trial of Ihsan and Zahraa Ali.
Link you?
Plus,
Which
this.
you can come talk to us, Denise?
Guilty.
I'm gonna give you a link. I'll
Count
get you a
2,
link.
murder in the first degree as it relates to the murder of Madison Mogan. How do you plead guilty or not guilty?
Let me mute this dude and talking head in the background. Pop on up here, Denise. We're waiting. Do 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 do. I'll sing for y'all. Here she goes. You ready to come up?
Yep.
Pop you up. All right. There we go. Hey, girl.
Can you hear
Hey.
me?
We can hear you.
Hey. Okay, I'm driving, so you're gonna look at the ceiling.
Okay. We don't mind ceiling.
So, yes, the reason that we're watching it this way is because Court TV got called out yesterday. The judge got mad. So Court TV
I figured that's what
has now
happened.
pulled the pool feed. So all those other channels that were streaming it from the pool feed don't have access to it anymore. So Court TV has the exclusive access and are only showing what they want to show to ensure they don't get in trouble any further by this judge.
That's
So
kind of what I figured.
Yep. That is exactly what is going on and why it's being done like that. This is why I stopped watching Court TV, because you don't get the whole thing. They interrupt constantly with all their little talking heads and their attorneys and their opinions, and it's crap. I applaud you for wanting to continue with this.
Yeah, I mean, I'm already this far in and I want to see it through. You know, I want to see it through.
Absolutely. We should see it through.
And I feel like we're actually missing out on testimony doing it this way. You know what I'm saying? I feel like we're missing out on maybe something that we might catch that Court TV is just going to skip over and, you know?
Right. So we're not necessarily missing out on testimony, but we're behind whatever is actually live, because they take those breaks and insert their own opinions and other people's opinions. We are behind, so that way their producers can block out minors' names and stuff like that. So when we see it skip, that's what's skipping. That's what's being cut out of their live feed. That's behind. Instead of them just saying, okay, we're going to take it upon ourselves to start the pool feed 10 or 15 minutes late so that we can do this.
That's kind of what I thought, that they would start, you know, like give it a 15-minute delay or whatever so they can go out and bleep in, you know, they could do that on their end. So it was like, I didn't understand why they couldn't do something like that.
Nope. And I hope you don't get a copyright strike for including their talking heads, even though you're trying not to. You're trying to fast forward through it.
Right.
But if you were to get a copyright strike, you better fight it.
Oh, I
Tooth
do.
and nail.
I do. I've gotten one before, and I take care of them. Yeah, I don't.
Okay, good.
Yeah. No, I transform my videos. We have other things on the screen. We have breaks. We have talking over them. You know, so I don't feel, you know, that I would have any problems because, you know, we do.
Right.
We do talk.
Right.
And I pause and I switch back and forth between things. So it all is transformative. So YouTube shouldn't have a problem with it, I'm hoping.
Yeah.
But yeah.
And so I just left the house. I was working from home today. My second ex-husband passed away this morning.
I'm so sorry.
I need to tell my grandson, but he's not answering my calls or responding to my text messages. So it may be a day or two before I tell him, because I don't want to tell him over the phone.
Right.
I'm okay. I was sad this morning, but I'm more sad for my son, who was his only child. I have other children. So my son has a brother and two sisters, but he was the only child of his father.
Right.
So I'm sad for him, but that's as far as my sadness goes. He was not a stellar husband. And he let his new wife make all the rules and estranged him from his entire family for years. And then when he had a stroke, she realized she couldn't do it on her own. And she started talking to people in his family.
Oh, wow.
Yeah, so whole lots of drama there. I'm over it. But now I am on my way to Boise. Where
going to get in that line.
Well, I'm going to my friend Sarah's. She's the one that I just did this camp with over the weekend.
Mm-hmm.
She has made dinner. So I'm going to go to her house, hang out for a couple hours, have dinner, and then probably right around dusk, I will head over to the courthouse, because it is currently 86 degrees, but it's hot. It is a hot 86.
Goodness.
So I'm going to let the sun start to go down a little bit, because it sets on the back side of the courthouse.
Uh-huh.
So once I have shade out in the front of the courthouse, I'll be good. But I will take pictures.
I know you're driving. I know you're driving,
Huh?
so I know you're driving and you can't see chat, but I wanted to tell you, you know, I don't even look at your phone, keep driving, but listen, they're saying sorry for your loss. And then over here, Lois wants to know what you're wearing so we can look for you.
I will send a picture right now. I'm in jeans and a t-shirt, because
No,
that's
tomorrow.
Yeah, I will send a picture in our chat.
Okay.
For this channel.
Okay.
I will send a picture, and feel free to show it to everybody.
Okay.
It's the same courtroom that Valo and Daybell were both in. So sit as the general public, you may not even get to see me.
Okay. Well, we'll look for you, though.
It just depends on if they have us enter and go to the right, I won't ever be on camera.
Okay.
If they let us go in and to the left, I will try and sit somewhere where I can have I know where the cameras are.
Yeah, it's a bigger courtroom. It's a bigger courtroom. Did you? I don't know if you know. I don't know if you've seen, but Nate Eaton has another new channel that he started, and he
Yes.
did a interview with Kaylee's sister. Did you see that
Yes.
one? That was
Oh, yeah.
such a good interview. It was such a good interview. It kind of gave me a little more insight onto her behind the scenes stuff too. So her and her dad will be there.
Yeah, so I'm super excited. Nate will likely be there, so I'll be excited to see him again. I'm excited to see Anjanette Levy from News Nation. She's going to be there. I'm not sure which talking head from Court TV will be there. Probably Matt. He's a jerk. I look forward to seeing.
I'll get that channel in just a second, Lois. I think Denise cut out. She's driving out in the country. Denise. I think she lost connection. Okay, she's driving. I'm going to drop her, but we're back in court. So let's go back to court. I'm sorry, Denise, if you hear me.
Okay, and was October 18th a Friday?
Yes.
Okay, and what is your typical
day? And Fridays, Saturdays, Sundays are my days off.
Okay. And after you indicated that you work Monday through Thursdays, did you go back to work on October 21st, which would have been a Monday?
Yes.
Okay. And after you went back to work on October 21st, did you become aware of a situation that had occurred at the intercity transit bus stop in front of the high school on October 18th?
Yes.
Okay. And then after you were made aware of the situation, or you learned about the situation, did you conduct follow-up investigation in this case?
Yes.
Okay. And on October 21st, did you speak to any students or their family members on this case?
Yes.
And who did you speak with?
One of the involved students.
Okay. And Isaiah Williams High School.
Yes.
Okay. And you testified earlier that 4 years at Timberline High School that you are familiar with the students there. As a result of that, were you also aware who Isaiah? And after speaking with Isaiah, did you at some point make contact with Fatima?
Yes.
Okay, and where did you make contact with Fatima?
At St. Peter Hospital.
Okay. And without telling the jury what she specifically told you, did she sort of give you a recollection of what she remembers happening at the bus stop?
Yes.
Okay. And without telling what she specifically told you, did she discuss with you about just her dad's actions, or both her mom and her dad's actions at the bus stop?
Objection, calls for hearsay.
Sustained. Okay. And after speaking with Fatima, did you at some point make contact with Isaiah?
Yes.
Okay. And without going into details about what Isaiah share with you what had occurred at the bus stop and afterwards?
Yes.
Okay. And Officer Howard, given your location at Timberline High School, do you know whether Timberline High School have any surveillance cameras?
Yes.
Okay. And how do you know that Timberline High School have surveillance cameras?
Well, at the time in October 2024, that would have been 7 years as a school resource officer, and we often use the school cameras.
Okay. And prior to October 18th, have you ever used the surveillance camera at Timberline High School to review footage of anything that was of interest to you as a school resource officer that may have occurred on campus?
Yes.
Okay. Have you only used the surveillance camera to review footage once or more than once?
More than once.
Okay. And do you know where the cameras are located?
Yes, generally speaking.
Okay. And where are some of the locations of the cameras?
In the school, coming into the entrance, the school parking lot, gymnasium, the back of the school, the property.
Okay. And after speaking with Fatima and I had occurred at the bus stop, did you try to locate the surveillance footage of the incident at the school through the surveillance cameras?
Yes.
Okay. And was there a time frame that you were specifically looking at in the surveillance cameras?
Yes.
And what was that time frame?
October 18, 2024, around 2 p.m.
Okay. And when reviewing the camera footage, did you at any point see Isaiah on the camera?
Yes.
Okay. And what about Zahraa Ali? Did you ever see her being captured on the cameras?
Yes.
Okay. And when you observed Mrs. Ali captured on the cameras, do you remember what she was wearing?
Yes.
And what was she wearing?
A greenish colored headdress, a long sleeve black top, and it appeared to be like a long black skirt.
Okay. And then what about Isaiah? What the camera captured him wearing?
Yes.
And what was that?
A long sleeve, it looked like black or dark colored top and light colored pants.
Okay. And what about Fatima? Did the cameras also capture Fatima?
Yes.
And what was she wearing?
A long sleeve dark colored top and dark colored bottoms.
Okay. And prior to October 18th, had you had contact with Zahraa Ali at the school?
Yes.
And was that contact in September of 2024?
Yes.
And what day in September of 2024?
September 17th of 2024.
Okay. Permission to approach the witness, Your Honor.
You may.
Officer Howard, I've handed you what's been marked as State's Exhibit 113. Do you recognize that exhibit?
Yes.
And what is that exhibit of?
It's the trespass letter.
Okay. And is that an accurate copy of the trespass letter that you served on Mrs. Ali on September 17th of 2024?
Yes.
Okay. And when you served the trespass letter, where did that occur?
At the Timberline High School.
Okay. Did it occur out in the hallways, the front office, or someone's office?
That occurred in Vice Principal Celeste Waltermeyer's office.
Okay. And was Miss Waltermeyer also present when you served the Mrs. Ali the trespass letter?
Yes.
Okay. And was your body worn camera on and recording when you served the trespass letter?
No.
Okay. And at the time when you served the trespass letter, well, let me ask you this question. Inside Ms. Walter Meyer's office, was your role simply just providing that letter to Mrs. Ali on behalf of the school?
At the time, yes.
Okay. And when you first served the letter on Mrs. Ali, was she there by herself or did she have any family members with her?
She was initially by herself.
Okay. And when she was by herself, did you speak with her?
Yes.
And was that communication in English or a different language?
In English.
Okay. And based on did she appear to have any confusion on what you were talking to her about?
No.
Okay. And at some point, did you offer her an interpreter service?
Yes, we use a language line.
And did you offer her a language line?
Yes.
And what is a language line?
A language line is the number that we can call when we're dealing with folks if they have difficulty with English. So they provide a lot of different languages on the language line.
Okay. And to your knowledge, is Arabic one of the languages that is offered as a service on the language line?
I believe so.
Okay. And when you offered Mrs. Ali the assistance of the language line, did she accept your offer?
No.
And did she herself have any specific requests on who she wanted to be there to assist her with translation?
Yes.
And who does she want there herself?
It was her oldest daughter, Haneen Ali.
Okay. And
All right, we'll step aside here to squeeze in a short break. But before we do, I'd like to welcome our viewers who are joining us today on our YouTube channel. We're going to be
Yeah. Be quiet. Talking head. Be quiet. Yeah, she didn't have the headscarf on. She had on a hoodie, I believe. And they gave her a hat. And she said she had on a mask during her testimony. She said she had on a mask, like a COVID mask. I remember her saying that. So, you know what? Let me see if I can find her testimony. Yeah, I dropped Brian's new the podcast channel in the chat. I found that I think he's only got one video on there so far, but I mean it's well worth the watch. Kaylee's sister, Kaylee Goncalves' sister, had an interview with Brian, and it is a outstanding interview. And I suggest anybody to go watch it on their time because it's well worth the watch. I got a lot of insight watching it. A lot of y'all, there is still a fly in here. The same fly from Saturday. It is about to get on my last nerve. Oh. Okay. What was I doing? Oh, I was going to see if I could find Fatima, her testimony. We'll watch that for a second while they're on break. Get a hand towel, snap it. Oh, did I say Nate Eaton? No, Brian Enton. I totally screwed up on that one. That was Brian Enton's new channel. I said Nate Eaton. No, not Nate's new channel. Brian's new channel. See, y'all, I'm getting names confused. I'm going to go find me a hand towel. Just a second. Oh, wrong button, Sheila. Wrong buttons. See, we're going to watch, I think this is Fatima's testimony. Let's watch this for a few minutes.
1 or 23. Do you remember that?
Yes.
On which page?
Similar names. Yeah.
73. Do you recall that?
Yes.
And you had indicated prior to
I'm gonna
him
get a towel.
showing you that document that you didn't know when you were traveling. Do you remember that?
Yes.
Can I approach, please, Your Honor?
You may.
Now, how do you take that? Miss Ali, will you look at line 24? So one line past where Mr. Kading had you stop reading.
And just for the record, Ms. Stone has provided to the witness exhibit 525.
That's correct. Thank you, Your Honor. And do you see line 24 on there?
Yes.
So when Mr. Kading asked you about lines 5 through 21, and then I believe you clarified to 23, at line 24, did you indicate to Mr. Kading at the time of that interview that you did not know when you were traveling?
Yes.
Okay, thank you. I'll take that back from you. So were you aware of a trip to Iraq versus the trip to Iraq? Is that a fair distinction between those two things?
Yes.
You had talked about, Mr. Kading also spent some time talking to you about your school attendance. Do you remember that?
Yes.
Okay. And have you skipped classes?
Yes.
Okay. Are there any classes that you particularly disliked or skipped more often?
Yes.
What class was that, or classes?
English.
Why English?
It's hard for me to really learn.
I'm sorry, I'm gonna have you adjust the microphone. It's a little hard to hear you. Thank you.
So you skipped classes, other classes besides English?
Yes.
But English is the one that you remember the most?
Yeah.
Okay. And if you skip classes, generally, where would you go? Did you leave campus? Did you go somewhere else? I mean, generally, if you were skipping a class, where were you going?
To the bathroom.
I have to be truthful. I sat here with the camera off because I went and got my fly swatter.
So staying at school?
Yeah.
I believe Mr. Kading asked you about a 504 plan yesterday. Do you recall that?
Yeah.
What is a 504 plan to you? What does that mean to you?
Like extra help, and teachers will help me more with assignments.
So is a program at school where you believed you could get extra assistance?
Yes.
Okay. Was school easy for you?
No.
Okay. Was that just for English or for other classes?
For other classes.
What classes do you like the most? What classes were easier for you or did you like the most?
Math.
Math?
Yeah.
What else?
I like art class.
Okay. And did you ask about a 504 plan with your parents?
Yes.
Okay. Were they supportive of you getting a 504 plan?
No.
If Mr. Kading asked you yesterday or said you didn't tell your parents things, is that correct?
Yes.
Is that a fair statement? Did you not tell your parents things?
Yeah.
Okay. Well, why wouldn't you tell your parents things?
I was afraid.
Okay. Were you comfortable telling them things that you knew they wouldn't like?
No.
Would they like knowing that you were dating at all?
They would not like that.
They would not like that?
Yes.
Was it dating in general? Was it dating Isaiah? Was it dating boys? Like any part of that?
Dating in general.
Dating in general is not okay.
Yes.
Okay. What kind of vehicle does your mom or Haneen drive? How would you describe what those vehicles look like?
My sister Haneen would drive a box looking car, and it's silver and black.
What about your mom?
I think it was brown, and it was just a normal regular car. It wasn't a box shape. It was just slim.
Okay. So you're really soft spoken, and I know it's difficult, but I'm just going to ask you to speak up a little bit, okay?
Yeah.
So if I understood what you said your Haneen drove a box looking car that was like silver and black.
Yes.
And your mom drove a brown car that you said was just like a regular car that was slim. Is that right?
Yeah.
And when you say slim, do you mean like a sedan style car or like a truck like your dad?
Like a sedan, not like a truck.
Okay. Do you know what brand either of them were?
No.
Okay. And when you describe your sister Haneen's car as a box car that's silver and black, where is that silver and black on the vehicle? If you
The
recall?
silver was in like in the front, like where the lights were, like at the front, and the black was in the back, like for like the second door.
Okay. Do you remember yesterday when Mr. Leary asked you about your...
Okay. Back over here. They're coming back. And this is the lady that this is the school resource officer that served the trespass to Mrs. Ali.
Mrs. Ali's request allow her to have Haneen present.
Yes.
Okay, and was at that time was Haneen present when Mrs. Ali requested her assistance?
I don't believe so.
Okay, did you all have to wait for Haneen to get there then?
I believe so.
Okay. And then as part of issuing the trespass letter, did you also explain to Mrs. Ali sort of the places that she's not allowed to go to when it comes to the school?
Yes.
And what did you explain to her or advise her?
That it related specifically to Timberline High School, which would include the building inside the building, outside the building, like the parking lot, as well as like the track field or the baseball fields.
Okay. And Officer Howard, were you also aware that there were videos taken of the incident at the bus stop?
Yes.
And did you at any point, well, let me ask you this question. What, if any, videos were you able to obtain on October 22nd of 2024? That were depicted on the videos?
Yes, I did.
And who did you recognize?
I feel like I lose out on so much testimony with this, but I'm going to see it through.
And besides obtaining the inner city transit bus videos, did you obtain any other videos?
Yes.
And were they videos taken by students or adults, to your knowledge?
Students.
And which two students did you obtain videos from? Obtained the video from Noah Pierpont and what he had observed himself at the bus stop.
Yes.
And Noah Pierpont with Timberline High School.
Yes, he's also one of my students at Timberline.
Okay. And do you you testify that you also obtained a video from?
He's also one of my students at Timberline.
Okay. And when you made contact with Elijah,
they're getting better at muting.
What his observations were of the incident at the bus stop.
Yes.
Okay. And Officer Howard, you when describing the relationship of Noah, you testify that they're your students. Is it fair to say that you sort of view all the students at Timberline High School as your students?
Yes.
Okay. And besides obtaining statements from
Yes, I did.
And do you remember whose statements you obtained?
Yes.
Okay. And who were they?
They actually have the mute on point finally. It took them forever to get to this. But she's saying a lot more and they're not unmuting. Problem. Hello, we can't hear her. Hello, hello.
Thank you. Thank you. Mr. Kading, cross-examination.
More questions? We didn't get to hear the rest.
Thank you. Mr. Larry, cross.
All right, just want to remind you, we cannot allow the names of any of the minors to be said on the air, so that's why we block that out when she's saying those names. All right, we're going to go to break.
Yes, you're going to break again. Again.
Your mom and who she was saying my daughter to. Do you remember that line of questions?
Yes.
And Mr. Leary had you look at against defense exhibit 525 and line 55. Do you remember that?
Yeah.
And he asked you to look at line 23. Do you remember that?
Yeah.
Okay. May I approach, Runner?
You may. You said line 55. Is that page 55?
Page 55, line 23.
All right. You may approach.
Thank you. And again, Miss Ali, I'm going to ask you to look at page 55. Look at lines, read 23, but also read 24 and 25, please. And was that your only answer to Mr. Leary as to initially you thought it was to you?
No.
What else did you tell Mr. Leary during the course of that interview?
I said to me or to someone else, I don't know. I just know that.
Okay, thank you. So is it fair to say that during those interviews, you didn't indicate you knew exactly who it was to? You thought it might be to you, but it could have been to someone else as well. And then you said, I don't know. Is that a fair statement?
Yes.
Okay. And that was indicated in the document as well, correct?
Yes.
When Mr. Leary was talking to you yesterday, do you remember him talking about your mom and how your mom was holding you?
Yes.
Do you remember Mr. Leary gesturing with his arms low and around? Do you remember that?
Yes.
Is that how your mom was holding you?
No.
How was your mom holding you?
Like I said, around the throat, around my neck, and my chest.
Okay. He also asked you if you thought your mom was trying to hurt you at the time, and you said no. Is that correct?
Yes.
Do you want to believe that your mom is trying to hurt you?
I don't want to believe that.
How do your parents normally hold you if they're comforting or hugging you? What does that look like?
I don't know.
And what do you mean by I don't know?
It's really rare for me and my mom or my dad to hug.
So you don't have a good baseline experience for hugging with your parents?
Yes.
Is it fair then to say that they're not big huggers?
Yes.
I have no further questions at this time. Thank you.
Thank you. Mr. Kading, recross.
Okay, a little break in the action there. Joining us, Matthew Mangino. He's in Pittsburgh. He's a criminal defense attorney, but he used to be a district attorney. What's your take on this case? The charge is attempted murder for both mom and dad. Dad, you can kind of get with the bus. Fatima. Now it's time for a recross.
You indicated that when you skipped class and such, you stayed at the school.
Yes.
Is that every time?
Yes.
Okay, on January 25th, 2024, 9:07 in the morning, that's a Tuesday, you were not at school, were you?
I don't remember that.
You were at Safeway? You remember that day?
Yeah.
Okay. So when you skipped school that day, you were at the Safeway?
Yeah.
Okay. So you don't always stay at school when you skip school?
Yeah.
Okay. So when I just asked you, do you always stay at school? And you said yes.
Well, that time I didn't remember, but now I remember.
Okay. But your answer was yes.
Yeah.
Okay. That's not true, right?
Yeah.
Objection, Your Honor. Asked and answered
Sustained.
Thank you.
Mr. Larry Recross.
Good morning. Thank you for coming back. So back to our conversation yesterday about the interview that we talked about. And I just want to be accurate. So when we were talking about you hearing your mom say, my daughter, you initially said you thought that she was saying that to you, correct?
Yeah.
And then I said, to you, question mark? And then you followed up and said, to me or somebody, I don't know.
Yes.
Just that she was saying my daughter more than one time. Is that fair?
Yeah.
Okay, because I want to be accurate, right? So you, initially you said, I thought it was to me, but it could have been to me, it could have been to others, correct?
Yeah.
Okay. And that you described her tone as sad, right?
Right.
Okay. Now, Ms. Stone followed up and said that you don't want to think that your mom wanted to hurt you, correct?
Yes.
And that's fair. You told the police that night at the hospital that you didn't think that your mom was trying to hurt you, correct?
Yeah.
And that you thought that she was trying to protect you from the chaos, correct?
I don't remember that.
Okay. But if an officer came later and testified to that, would you disagree with that?
I don't know.
Okay. Because it was chaotic, right?
Yeah, it was chaotic.
Okay. And that she's holding you from behind, correct?
From my neck and my chest.
Okay. But she's sitting behind you, right?
Yeah.
Okay. Thank you. Nothing further.
Ms. Stone, any further direct examination?
No, Your Honor, thank you.
And may this witness be excused, or is there a potential of recall?
Subject to recall. Thank you, Your Honor.
All right. So at this time, you may step down and step out of the courtroom. Thank you.
The last attorney that we heard. Okay. Watch. Watch Mr. Barnes for a minute. Oh, they're fixing to come back from commercial, I believe. I think they're fixing to come back. Give me just 1 second.
Resource officer. She's now on cross-examination by Zahraa Ali's defense.
Do you normally have body-worn video when you're in the school?
I normally wear a body-worn camera, yes.
Fair enough. Okay, so, and so are you so you're, is that dress blues? Is that your uniform that you wear to school, or do you have more of a duty belt with a vest and other accoutrements?
So this is my Class A uniform, so like special occasions or court. The uniform I normally wear is a jumpsuit, which is black in color, an outer-worn vest, which has my body-worn camera attached.
Okay, and so then how often do you turn on your body-worn camera in an average week?
Well, on an average week, I'd probably say a couple of times during the week.
Okay, and so what are things that would trigger you activating the camera?
Sometimes I do make traffic stops in the parking lot, so you activate it during that time. When there's like a disturbance that actually happens inside the school where kids are fighting or arguing. Sometimes when you do an interview at the school.
And so, and then what causes you to generate a report?
Often normal reports are like in reference to like criminal events or behaviors that are occurring in the school.
And so from the September 17th transmission of the letter to Zahraa Ali, so you didn't activate your body worn camera, correct?
Correct.
And didn't generate a report, correct?
Not specifically with the issuance of the letter, no.
Okay. And so were you a part of generating the letter that was handed to her?
No.
And did you read it to her or was it read to her in that September 17th meeting?
I believe I went over what the letter had stated in reference to specifically related to Timberline High School.
Okay. And so, and you testified on direct, the points that you made is that she wasn't allowed, Mrs. Ali wasn't allowed to be at Timberline High School. And you said the buildings, track and field, the complex.
Yes, and the parking lots too.
Okay. Was she precluded from being anywhere else?
Well, anywhere that was what it stated, the North Thurston School District properties.
Did you say that, or did you just say did you just say Timberline High School?
Well, I believe I read the language that was on the letter, but it related specifically to Timberline because that's where her daughter was attending at the time.
Okay. And do you have a specific recollection of that?
Just in generality in reference to Timberline High School.
Okay. All right. And was it clear to you that English was not her first language?
Well, when I initially spoke with her, it was in English, but out of respect for her request that her daughter respond to help with translation, that's why her daughter was contacted to respond.
Okay. So was it clear to you that English wasn't her first language, though?
I believe she understood what I was saying in English, but because she requested her daughter to help with additional translation, that's why I'd also offered the language line as well too.
I like how she's
I'm not
dancing
gonna
around
assume one way or the
answering
other. But
this.
It was at her request, and that's why I had.
I like how
called
she's
for her daughter
answering
to
it.
respond.
Okay. Nothing further.
Redirect. Officer Howard, with regards to when you served Mrs. Ali with the trespass letter, when you were providing her with a trespass letter, it was not a criminal investigation. Is that fair to say?
That is correct.
Okay, and this may seem like a silly question, but it was not a traffic stop either?
No, it was not.
Okay, and is it fair to say you were simply assisting the school in providing a parent with in this case, a no trespass letter?
Yes.
And when you spoke with Mrs. Ali, you testified earlier about, you also told her about the prohibited places as it relates to Timberline High School. Did you share that information with her orally?
Yes.
Okay, and were you very specific as to Timberline High School?
Yes, because that's where her daughter was attending.
Okay, and her daughter, which daughter are you referring to?
Fatima.
Okay, and when you explained to her you mentioned the track course and then also the parking lot and the gymnasium, when you referred to all those areas, were you specific that it was associated with Timberline High School?
Yes.
Okay, and when you shared that information with her, did it appear to you that she had any difficulty understanding what you had told her?
Objection calls for speculation.
Sustained. Okay. When you shared that information with her, did she say anything along the lines of, I don't understand, I'm confused?
No.
Okay. No further questions.
Mr.
All right, remember, one of the things that Zahraa is charged with is violating that very order. All right, we'll pause it right there for a quick break. Now, when we come back, we'll be...
You and your quick breaks. Your breaks are not quick enough,
a
sir.
witness in the attempted murder trial. All that more is up next, so keep it here.
Okay, what we're gonna do is yeah, in the Karen Reed trial, right? Okay, we're gonna switch tabs. We're gonna watch Mr. Bart. See, look, it lost connection. So We're going to stop screen. Boom, boom, boom. Okay, we're going to watch Mr. Barnes. Here we go, Mr. Barnes. While they are on break, yeah, y'all, we're going to get a refresher on Mr. Barnes here. I love this man. It's great, great stepdad, mentor. I really, really appreciate this man. So we're going to watch him.
Are you aware, had Miss or Mrs. Ali been to your home prior to that? Do you recall if she had been at your residence at any time?
Yes.
Okay. So would she have known where your residence was?
Yes.
Okay. The incident, again, without any details associated, was that associated with the school in any way, Timberline High School?
Can you repeat that?
Sure. Let me rephrase that. The location of the incident that caused concern, where did that incident occur?
Timberline High School.
Okay. Had Mrs. Ali's husband, Ihsan Ali, ever been to your home before?
Yes.
So would he have also been aware of that location?
Yes.
Do you know if Haneen Ali had been to your residence previously?
Not to my knowledge.
Okay. And do you know who was directed to serve a copy of that order on Mrs. Ali?
Lacey Police Department.
May I approach, Your Honor?
You may.
Mr. Barnes, I'm showing you what's been admitted as State's Exhibit 36. I'd ask you to look at that silently to yourself, review those pages, and then look up at me when you're done, please, sir. Mr. Barnes, do you recognize what I've handed you?
Yes.
And what is that?
A temporary protection order.
Is that the temporary protection order about which you've been speaking earlier today?
Yes.
Okay. And does that appear to be a true and accurate copy of that temporary protection order?
Yes.
Do you, as part of that process, receive your own copy of that order?
Yes.
So before today, have you had an opportunity to review your own order that you received from the court system in comparison to this order?
Yes.
Okay. I'm going to take that back from you. Permission to publish, Your Honor.
You may.
Okay, Mr. Barnes, I'm going to ask you some questions. First of all, who is listed up top, I would say top third of the page here in the header block?
That would be myself.
Okay, they got the mute on finally.
Order were you requesting here, listed under the cause number?
Harassment.
Okay. And is it a permanent or listed as a temporary protection order?
Temporary.
And what is the date for the next hearing that has been provided?
October 24th.
Did you attend that hearing?
Yes.
Okay. What was the result of that hearing?
Objection as to relevance as to what happened on the 24th.
Sustained. Did you attend that hearing?
Yes.
Okay. And in terms of the order, what information then is followed on that order? Who is identified, I suppose, down here on the front first page? Personal information for Miss Ali.
Yes.
Okay. And does it indicate, well, let me back up. What is this marking here on the document?
Oh, that's the step from the poorhouse,
Okay.
making it official.
Okay. And what about on looking at page 2 of 11?
Okay, we're gonna pause that. We're back. I'm not sure what's going on outside the jury presence. I'm gonna back it up just a second so we don't miss anything.
The Lacey Police Department.
Okay.
I want to get you back in the court now. This is happening outside the jury's presence. A potential witness is being proffered. The judge is hearing from Sergeant Jeremy Knight with the Lacey Police Department.
Unit for which agency?
City of Lacey.
Okay. And can you tell
Okay,
me
he's being proffered,
a little
so
bit of
it's
your
not-
training and experience?
It's outside
background?
jury presence.
Relatively briefly in this format, please.
You bet. I attended the police academy in 1999, 440 hours. Since then, I've had a myriad of continuing education and training courses to include, but not limited to, basic homicide investigation, investigation of domestic violence, strangulation, fugitive investigations, surveillance, interviewing, interrogation, firearms crime enforcement, shooting scene reconstruction, management of major cases and crisis by the FBI, management of investigative units, and several others. I'm a firearms instructor and a pursuit driving instructor.
Pursue what?
Excuse me, pursuit driving instructor.
Well, thank you. And were you employed by the Lacey Police Department in October of 2024?
I was.
And are you familiar with an event that occurred at Timberline High School on or about October 18th of 2024?
I am.
Were you actually at the scene of that event?
No.
How did you become involved in that event?
The following Monday, I was briefed on the case on October 21st.
And October 21st, who briefed you on that case?
School resource officer Alicia Howard.
Okay. Were detectives involved in that case at that time?
No.
Okay. After being briefed by Detective Howard, did detectives become involved in that case?
Yes.
And who, if anyone, did you assign to become involved in that case?
Detective Julie Mullen.
Okay. And what did you direct Detective Mullen to do?
I requested that she assist School Resource Officer Howard in the continuing investigation of the incident.
Did you yourself become involved in the investigation or coordination with that case?
I did.
And based on your role in that investigation, did you take any initial efforts associated with that case?
I did.
What initial efforts did you make associated with that case?
I reached out to a federal partner with Customs and Border Patrol at the Seattle International Airport.
Okay. And what was the purpose of doing that?
The purpose was to identify whether any of the members of the Ali family had traveled.
Had traveled previously, recently?
All right, I want to pause it there for a moment because I want to get back to that question that I had read earlier, that great question by Roxy Chavez, again, on our YouTube feed. She asked, do the cultural beliefs of the Alis fall under the U.S. Constitution's First Amendment that guarantees religious freedom, like arranged marriages? Let's bring back in our guest still with us.
Oh, I want to hear this.
Prosecutor, former CIA officer.
I want to
Jack
hear
Rice.
this, even
Jack,
though
what do you think about that question?
Yeah,
What
we
do you
don't
make
like listening to them, but I want to hear
Relevance.
this.
Michael, I mean, that's really the question in a case like this. And so it isn't so much about the First Amendment, the idea to speak about this, but it always comes down to this. And this is always sort of a rule in every case at all times. Does it make any sense to allow this in? And sometimes the magic words are more prejudicial than probative. In other words, is it more helpful or does it just so bad that a jury will just discount everything else and go straight at that? And I think that's what the judge did when they decided to exclude the honor killing reference, the arranged marriage reference, out of fear that a jury might say, oh, it's an honor killing, they're guilty.
Yeah, exactly. And I think that's absolutely the case. I also think, that question might have been referring to the idea of,
she does look
can
older.
arranged marriages happen in the United States? And I looked it up, little quick internet research, Jack, and essentially no states actually ban arranged marriages between consenting adults. But There's a difference between
Really?
an arranged marriage and a forced marriage. If you try to force someone into marriage, that can be brought under a number of crimes, including domestic abuse. And as far as child marriages are concerned, I looked that up as well. 16 states ban it outright. 34 states actually allow child marriages, okay, under certain circumstances, including pregnancy, parental consent, and also emancipation of the child at that point. Your thoughts on that?
Why would you allow a
No
child
question
to
about
get
it.
married?
See, this is the interesting aspect when you think
supposed to go to the school. And my question for you is, the fact that she was going to the school was not necessarily to violate the order, right? The idea was she was going after
Oh, you
a
thought
child.
she looked younger?
There was some suggestion by the defense that, again, it wasn't in her language. Maybe she didn't fully understand it. Number one, is that a defense to a violation of that order? And number two, do you think this jury might give her leave with the idea that she was there to try to get her daughter to come home who had just run away that day?
Pregnancy, I mean,
Yes.
but still.
I think they will, meaning to the last piece of this.
I
If
mean,
there's a perception
you know, I can't imagine underage.
her obligations to protect her child, if you get
know,
some ridiculous, and I'll use that term, ridiculous order that says,
I know you can be emancipated, and you can be emancipated and all that, but man, I couldn't imagine marrying my child off at a young age. I'm not gonna lie, my daughter, she got married before she was 18, and it wasn't with my consent. My sister had dual custody of my daughter with me, and my sister signed off on it. It caused big problems. You know, there was a lot of things with my mental health back then, and unfortunately, I let my sister get involved, and yeah, and now my daughter regrets ever getting married that young and everything. And we learn from our mistakes, so she's better herself from it and has learned from it. But okay, we're gonna go back to Mr. Bryant while they are doing their break thing.
And on State's Exhibit 36, who is identified and does it have his age listed on there?
Yes.
Okay. At the time that this interaction occurred, how long, to your knowledge, how long had Isaiah and Fatima been friends and or dating?
About a year or so.
Okay. So this wasn't, at the time of this wasn't like a brand new relationship between these two. Is that fair to say?
Very fair to say.
Okay. Looking at page 4 of 11 of, well, actually, yeah, 4 of 11 of State's Exhibit 36, under paragraph 8, the directives to the restrained person, what is initially listed under A?
No harm.
And what is the directive under A to the restrained person?
The minor is in section 3 above.
So does it clearly essentially link back to your son?
Yes.
Okay. And under subsection D of that, does it indicate where your address is, the address specifically to stay away from?
Yes.
Okay. And is that the address that Ihsan Ali and Zahraa Ali had previously been to?
Yes.
Okay. So it wasn't a different address than what they had previously visited?
Correct.
Okay. Sorry, and one more. Under D, how many feet does it say Miss Ali is to stay away from your son?
1,000.
Okay. Is that 1,000 feet underlined?
Yes.
Okay. And had your son gone to school, if you know, with Fatima Ali? at the time of those events?
Yes.
Okay. So was there any confusion? Well, had there been any change in your son's school since September to October?
No.
Okay. Okay, I don't have any additional questions for you at this time. Thank you.
Mr. Kading, cross-examination.
Okay, that was the direct examination. Victor Barnes. Marie Pereira, what did you think of this witness?
This witness is a multi-purpose witness. The first thing that I thought was, wow.
Okay. So just one preliminary. Have you watched any of the proceedings on this case on TV at all?
No.
Okay. Have you seen any videos on this case?
No.
Okay. So let me ask you this. When you parent your children, you have rules, right?
Yes.
Okay. And they're pretty set. The kids know what to do.
Correct.
Okay. And if they break the rules, you punish them, right?
Depends.
Okay. So if they break the rules, what do you do if you don't punish them?
I ask them why they broke the rule.
Okay. What if they don't have a good reason? Then do you punish them?
Depends on what their answer is.
Okay. Do you have the final call on what happens after you talk to them?
Yes.
Okay.
Me and my wife.
All right. And so you have different boundaries, different punishments, that kind of thing, right?
Yes.
Okay. And if they do something bad, worse punishment, right? Right?
That's fair.
Okay. Okay. And I know kids nowadays, bad punishment sometimes be taking their phone.
That can equate to a bad punishment.
Okay. And that's because they use their phone to talk to their friends, essentially live their life nowadays, right?
Correct.
Okay. So you take it, it's a pretty big deal. Okay.
I just have to have a verbal response.
Oh, yes, correct.
Thank you. That's okay.
So as a parent, you set the rules, you do the punishments. How would you feel if I were to set
Objection, relevance.
Sustained.
Okay. If you didn't get the desired results from your punishment or your discipline or your talking to your kids, what would you do?
I will consult with my wife.
Okay. And you said you went to court for your son to get this protection order, right?
Yes.
Okay. He wasn't there.
No.
Okay. Just you and your wife.
Just me.
Okay.
Yes, me and my wife. Correct.
You and your wife. Okay. And so you went to court on behalf of your son because he was a minor, I assume, to get this order. Okay.
Yes, and we will pause there because court's back. So sorry for all the flip-flopping back and forth, but we're making this shit work. You know what I'm saying? Sheila's powering through. We'll put the rubber Ramada in this and the craziness is coming out in me. I'm sorry, guys. Okay, we're going back over here. Back to court. Back to court.
Okay.
Are we still being proffered?
After you reached out to did you complete that portion of your involvement? Did you do that on?
That was the 22nd of October, that Tuesday.
On that Tuesday?
Correct.
Okay. And after you completed that portion of it, did you take any additional steps involving your portion of the investigation?
I did.
What did you do next?
I had requested actual documentation of travels with Customs and Border Patrol.
Okay. Did you receive documentation?
I did.
Okay. What action did you take after that?
I reviewed those for the information that they contained.
Okay. Did you make any requests let me back up. Previously, you indicated that you had reached out to some federal partners. Based on your role in the investigation at that time, did you make any additional requests of those federal partners?
I did.
What requests were those?
That would have been a request for travel alerts on the Ali family.
And can you tell me what you mean by a travel alert? What is a travel alert?
I can. With Customs and Border Patrol, they're able to place an alert on their computer databases to any attempt to travel in or out of the country by land, sea, or air on an individual.
Okay. And is that a system that Lacey Police Department is able to access, or is that something where you rely on a notification back from those federal partners?
The latter. We rely on contact from the federal partner.
And if there is a notification associated with the alert that you've requested, is that something you would get via an automated system, or something that someone would have to verbally or email-wise communicate with you?
I don't receive them directly from an automated system. It is through a third party.
Okay. And when you said you put out an alert, is there a particular name for that? Is there an area where that alert goes? What does that system look like?
I haven't seen the system myself, but it's at the ports of entry, again, land, sea, and air, and it's called a travel alert.
What is a National Target Training Center? What is that?
It's a federal entity that monitors travel.
Okay. Is that travel alert that you've identified connected to that National Target Training Center?
I don't believe the word training is part of the acronym, but it is, yes.
Okay. What is the acronym?
I believe it's TECS, Treasury Enforcement Communication System, if I'm not mistaken.
Okay. And so did you engage any other, outside of those federal partners and setting that alert, did you engage any other systems associated with tracking travel of the family that you recall?
No.
Okay. And did you engage with CPS in this case?
I did.
Okay. At some point during the course of this, were you aware of Miss Ali's, Zahraa Ali's location?
Yes.
Okay. At some point, did you have to make any coordinations with any agencies regarding Mrs. Ali's location?
I did.
Okay. Where or who did you make those communications or coordinations with?
With the Whatcom County Sheriff's Office.
Okay. And where is Whatcom County?
On a northern border of the state of Washington.
And what do you mean by a northern border?
Bordering the country of Canada.
Okay. And when you made coordinations with the Whatcom County, what was your intent in making that coordination?
To arrange for custody transfer.
And transfer to where?
Thurston County.
Okay. And were you able to complete that coordination?
I was.
Okay. Did you specifically retrieve or do the collection of Miss Ali?
No.
Okay. Do you know if she was returned to Thurston County?
I do.
Okay. Sergeant Knight, what other, outside of that flight notification, the coordination regarding Miss Ali with Whatcom County, and I believe the initial travel confirmation that you testified to, did you take any other acts associated with this case or have any other involvement?
I did.
And what involvement was that?
I assisted in the service of a search warrant on the Ali residence in November.
Okay, in November of 2024?
Correct.
Do you remember what the date of that was?
I believe it was the 20th.
The 20th of November?
Correct.
Okay. So by November 2024, would that have been approximately a month after the initial incident?
Correct.
Okay. And based on that execution, was there anything of evidentiary value located at that time based on your involvement?
No.
I have nothing additional. Thank you.
Thank you. Mr. Keating, do you have any cross-examination?
I do not.
Mr. O'Leary?
Good afternoon, Sergeant.
Good afternoon.
All right, so you had requested of a federal partner to have basically alert for travel of any of the Ali family members, correct?
Correct.
And you said land, air, or sea, correct?
Correct.
So if they got on a plane, you would, let's say they flew to Spokane, would you have known?
That I'm not sure. That was focused on out of the country.
Okay. So if they got on a plane to leave the country, you would be alerted?
Correct.
took, the Victoria Clipper up to Canada by sea, or crossed a land border crossing either on foot or by car, correct?
Correct.
Okay. And so, so they necessarily would have had contact with Border Patrol, correct? Is your understanding?
If done properly, yes.
I'm sorry, would you?
If done properly.
Okay. And so if they had crossed illegally, this travel alert would not have told you, correct? Unless they were captured.
Correct.
Okay. So if they're doing it legally by buying a plane ticket, buying a boat ticket, buying a pass on a boat, or driving or walking through a port of entry, they're going to get flagged and you're going to be notified.
That's correct.
Okay. And that is by Homeland Security or Immigration Customs Enforcement?
All under Homeland Security umbrella, I believe.
Okay. And you're not aware of how the system works, correct?
Not in detail, no.
Okay. But they present a passport or something, correct?
Correct.
And the person puts it in, that information is then generated, and then that is communicated to you, correct?
In essence.
Okay. And you don't know, do you know how she got there by land, air, or sea?
Got where?
Or how the alert was prompted?
That was an attempted border crossing by land.
And how did you get that information?
From more than one federal partner.
And so is that a person called you, emailed you? How was that information
I
conveyed?
received at least one phone call and I believe an email.
Okay. And the email was from a person?
Yes.
Okay. Nothing further. Thank you.
Anything further, Ms. Stone?
No, Your Honor. Thank you.
All right, we're going to go ahead and have you step.
All right. So the issue here was essentially hearsay. Now, he put out this all points bulletin that if any of the Ali family tried to travel outside the country, he was to be notified. He was, in fact, notified that Zahraa had gone up trying to get from Washington State to Canada. He was notified, went up, picked her up. The information that he was questioned about was whether he could talk about what he was told by the border agents, because again, that's hearsay. But it seems as though the way he testified was satisfactory to the judge. It's mostly his knowledge, or really all of his knowledge. So she decided.
Yep. She's right.
Take you back into court now, where he's actually on the
Oh,
stand testifying.
damn,
in front
that's
of the jury.
fast. They're already back in. Look, he
detective
just had to
unit.
talk for a minute. Damn, take a break and talk.
And were you employed by the Lacey Police Department
Now
in
he's actually
October
in front of the
2024?
jury.
Yes, ma'am.
Are you familiar with an event that occurred at Timberline High School on October 18th of 2024?
I am.
Were you actually at the scene of that event?
No.
How did you become involved in that event?
The following Monday,
We have-
on October 21st, I was briefed about the incident by the school resource officer,
Who was that school resource officer?
Officer Alicia Howard.
And was Officer Howard you said she's a school resource officer. Were detectives involved in that case at that time?
No, ma'am.
Did you assign any detectives to that case at that time?
I did.
Who did you assign?
Detective Julie Mullen.
Okay. And what was Detective Mullen's role or purpose in that investigation?
I had asked Detective Mullen to liaise with and assist School Resource Officer Howard with the investigation that was ongoing.
Okay. And after your initial interaction with Officer Howard, did you reach out to any federal partners associated with this case?
Yes, I did.
Who did you reach out to?
I first contacted Customs and Border Patrol at the Seattle-Tacoma International Airport.
Okay. And what was the purpose of doing that?
I inquired if any international travel had occurred involving any of the Ali family.
Okay. And did you reach out to any other federal partners or engage any other federal resources as part of that query?
I did.
And what or who was that?
Both Customs and Border Patrol and a task force officer with the FBI were involved with my request to place a travel alert on members of the Ali family.
What is a travel alert?
The travel alert is entered into a federal system database
So he's going to
that
testify.
alerts-
I'm going to pause it just for a second because, they'll end up going to break before long anyways, I'm sure. So he's testifying about that Zahraa went to the Canadian border and tried to leave the country. They put out a travel alert for the federal, border crossings to be aware that these people might be trying to leave the country.
Points of entry by land, sea, or air of any attempt to travel.
And how does that work? How do you do that? Does that question make sense? Meaning, is there a system that automatically generates that, or is it something different?
There is a system when you check in for travel at, say, an airport, and they're scanning your passport or other ID. That's being checked in a database that includes this particular database that would alert them if there was an entry in there for a travel alert.
Thank you. Did you engage with Child Protective Services throughout the pendency of this case?
I did.
Okay. And
he checked with Child Protective Services?
Okay. Meeting with Officer Howard, assigning Detective Mullen, setting up the travel alert. Were you engaged in any search warrants executed in this case?
Yes, ma'am.
Okay. When was that, if you recall?
80s.
Approximately a month later, I believe it was November 20th of 2024.
Okay. And you said November 20th of 2024?
Correct.
And where did you execute that warrant?
At the Ali residence in Lacey.
And by the time you executed that warrant on November 20th of 2024, was there anything of evidentiary value located at that residence?
No, ma'am.
Did you have any other involvement following that in this case?
No.
Thank you. I have no further questions at this time.
Mr. Kading, cross-examination.
No questions, Your Honor.
Mr. O'Leary.
No questions. Thank you.
All right, we're going to take a break right
No
here, folks. But
questions.
before we do, we'd like to welcome our viewers who are joining us today.
Okay, be quiet. No questions. Okay. I don't know why they're going to take a break. I don't know what they're going to do. That see, I want to know right now. I would just love to know. So, are they discussing was that the last witness? Is there going to be another witness? What is going? I don't like that. I don't like it this way. Okay, y'all. I'm gonna quit complaining. We're gonna go back to Mr. Barnes. I'm gonna quit complaining. We're gonna make it through this shit show of a trial. I'm not sugarcoating nothing today. It's a shit show, y'all. I'm a cusser. I'm a cusser, and I'm using it today. I'm older. I'm privileged and allowed to do that kind of stuff. I'm over 50.
Okay. And that's because parents make decisions for their kids, right?
Yes, we are able to.
Okay. Now, you knew that Fatima was not supposed to be dating Isaiah, right?
Yes.
Okay. But you knew he was, right?
Yes.
Okay. So you did not have a rule against him dating her?
Yes.
You did have a rule?
Yes.
Okay. And so it was not allowed?
We did not want them dating.
Okay. But they were dating?
Yes.
And it continued?
Yes.
For quite some time?
I don't know how long quite some time is.
Okay. Did you ever go to the Ali's home?
No.
Did you ever have a conversation with the Ali's of any real substance?
Yes.
When was that?
September 16th or 17th.
Okay. Now, was that in relation to this incident that your son was involved in at the school?
Yes.
Okay. So you talked to them at some point after an incident your son had at the school with Mrs. Ali?
Correct.
And you spoke to Mr. Ali?
Correct.
Okay. Is that what you talked about?
Yes.
Okay. You didn't talk about other topics?
Yes.
You did talk about other topics?
Well, we talked about keeping the kids, keeping his wife away from my child.
Related to that incident, right?
Correct.
Okay.
And he wanted to keep the kids separate.
Okay.
So his result to that was yanking her out of school.
I'm going to move to strike, Your Honor.
It's responsive to the question, Your Honor.
Not responsive.
Just a moment.
Look at Mr. Barnes being all cool and collected there. You know, he just wants to punch air right now. See, even this dead air, I would rather
Is to non-responsive.
go through this and do it myself.
In the year that your kids were friends and dating, you talked to Mr. Ali one time.
Once over the phone and once in person when they came to our house.
Okay. All right. And fair to say you're not friends with them.
Very fair.
Okay. And do you, well, it would be wrong for you to make parenting decisions for them, wouldn't it?
Yes.
What a question.
Okay. I have no further questions. Thank you.
Mr. Larry, cross-examination.
Good morning, Mr. Barnes.
Good morning, sir.
Thank you for being here. I'll follow up on a couple of things. So after the September 16th around incident, you had a conversation with Mr. Ali, correct?
Correct.
Was there contact between my client and your son after September 16th, as far as you're aware?
Not to my knowledge.
Okay. So we have the incident mid-September, and I've heard a couple of different dates, but so basically around the 16th, on the 16th?
16th or 17th, one of those days.
Okay. And so then you go to court on October 14th to petition for an anti-harassment order, correct?
Correct.
And you described where it was, correct?
Correct.
And that is, so you fill out paperwork in advance, and then you walk into court and say, here's what I would like. Is that accurate?
Correct.
Okay. And it's a walk-in calendar, correct?
Yes.
So it's not like you reserve a date in front of a judge. It's you go in, you sign up and say, here's my request. I'd like the judge to hear the request, correct?
Correct.
And so Mrs. Ali would not have any idea that you were going in that day, correct?
I'm not sure.
Well, I mean, you didn't tell her, right?
Correct.
Okay. And so you have no reason, you had no, and I'm not suggesting you should have, but there was no attempt to notify her. That's not how this works, correct? And the purpose is that if there is a temporary order granted, she gets an opportunity to then respond on the October 24th date, correct? Is that a yes?
Correct.
Okay.
Yes.
And so were asked on direct as to whether Ms. Ali was present at the temporary order. You said you weren't sure, correct?
I didn't see her when I was there.
Okay. So, but just to be clear, there was no reason to think that she would have been there, correct?
Not if she wasn't notified.
Exactly. And there's nothing to suggest that she was notified. Fair?
That's fair.
Okay. All right. So, and she didn't sign the temporary order because that's why you had the police officer had to go and give her the paperwork, right?
Correct.
Right. Okay. And so, and the thrust or the reason that you talked about going to get the order in October was the September 16th incident, correct?
Correct.
Okay. Nothing further. I appreciate it. Thank you.
Redirect.
Okay. They are just switching left and right. So let me back up, back to court. We have a new witness. We don't know her name yet because they just jump right in feet first.
Too far or too close, okay? All right. Were you employed by Timberline High School on October 18th of 2024?
Yes.
Were you working on that day?
No,
Do you know, are you familiar with the students at your high school?
I am.
Okay. Do you know a student by the name of Fatima?
Ew.
And how long have you known Fatima?
Since she started at the school, I believe she started the middle of her freshman year. And this was the beginning of her junior year in 2024.
So approximately
Oh,
3
here's my
years, as you
chance.
recall, or 2 years, give
Here's
or
my
take?
chance.
Yeah.
Damn it.
And are you familiar with another student? Do you know how long you've known Isaiah?
Oh, assistant.
Since he started at Timberline High School.
Okay. Are you aware of anything of significance that occurred on October 18th, 2024, as it related to those two students at your high school?
I am aware that there was.
Just yes or no?
Oh, yes.
Okay. And without repeating what you've heard, how did you become aware of these events?
Well, I was alerted on my phone originally that there was a lockdown at the school.
Okay. As the assistant principal, do you get those notices? Are you responsible for getting those notices when they come up?
Yes.
Based on your education, well, have you ever had experience with runaways at your school?
Yes.
Okay. Based on your education, training, and experience, are there situations where the school may not immediately notify law enforcement or immediately notify parents if contact with that child is made?
Yes, if the student has disclosed safety concerns, where we would notify CPS or notify law enforcement.
And does the school have staff or nonprofit assistance in such a case to potentially provide support to that student?
Yes.
Do you know if on October 18th, 2024, whether that student, Fatima Ali, was enrolled in your school?
Fatima was not enrolled in our school on October 18th.
And you indicated that she had previously been enrolled in your school. When had she become unenrolled at your school?
My recollection is it was the end of September. I believe it was like September 27th.
Okay. And about how long, well, was she still a student of the North Thurston School District?
Yes, she was. She had been at an online school.
What was the name of that online school, if you know?
Summit.
And do you know how her enrollment in the online school occurred? What was the process in getting her into that online school?
So I believe it was September 16th, 17th or 18th. Mrs. Ali had met with North Thurston High School and or had her transfer to Fatima's transfer to North Thurston High School denied. And she reached out to appeal that to our assistant superintendent, Nikki Grubbs, who handles that. From that point, we worked with Mrs. Ali and the other schools to see where would be a good fit for Fatima. I was involved in those meetings as well as some other district and other high school staff.
And was Summit Online, as an educator, was that your first choice for Fatima?
No.
Whose choice was that?
That was one of the choices, but that was the choice that Mrs. Ali wanted for Fatima.
And you talked about that happening somewhere around, a request for that transfer occurring somewhere around September 17th or 18th. Are you familiar whether there was an incident at school prior to that regarding Mrs. Ali?
Yes, there was an incident prior to that regarding Mrs. Ali on September 16th.
Okay. And as a result, well, who, without relaying any details, who was that incident between Mrs. Ali with?
With Isaiah.
Incident with Isaiah. School or school district take any specific actions as a result?
As a result of that, I put in a no trespass with Mrs. Ali, and she was no longer allowed on Timberline or North Thurston District. Okay. North Thurston.
All right, we're going to step aside here for a short break. When we come back, testimony in the attempted murder trial of Ihsan and
Lola, stop, baby. Go play. Okay, we are going to watch Isaiah's testimony while we let them do their next break. Y'all know they got to have their break, so we're working through this.
Throughout this time, are his arms still on her neck?
Yes, ma'am.
During this time, could you see Fatima?
A little bit, yes.
Okay. And how did Fatima appear to you?
Her face. It was looking like
her rolling back.
They were rolling back in the.
Do you want to take a break?
All right, now come to your television set. Look at this. So this is the central piece of evidence. An
important piece of the puzzle, if it's to be believed.
Michael, really appreciate it. Punched Fatima's dad.
Gives you a punch in the head.
Punched Fatima's dad.
He turns around and gives you a punch in the head, right?
Yes, sir.
Okay. And then after that, he's trying to take her away some more, right?
Yes, sir.
Okay. And you decided that you didn't want that to happen.
Yes, sir.
So you went and you punched him.
Yes, sir, because he
knocked
punched
him
me
to the ground.
Yes,
right?
sir.
And then while he was on the ground, you continued to punch him in rapid succession, right?
Yes, sir.
And maybe hit him 30 or 40 times?
Yes, sir.
Okay. And maybe kicked him in the head 3 or 4 times?
Yes, sir.
All right. Okay, who do I start? You both have a lot to say. I can tell by looking at your faces here. My gosh. You know what, Michael J. Brown, I'll start with you this time since I started with John last time. What did you think there?
Well, a couple of things, and John's probably thinking the same thing. There were no objections. This prosecutor is throwing everything he wants into the words of the witness, and the witness is
it was
agreeing
cross.
with him.
I'm sorry. It was cross. Yeah.
Oh,
cross,
was that cross?
Cross.
Okay.
Yep.
All right. Then I'm the stupid one. Okay, good.
No, you're not. No, I'm sorry if that was unclear, Michael.
Okay. By what?
For what my dad did.
Okay. Did you have any fear?
Yes.
About what?
Of dying.
Where inside the school?
Straight to the office.
Did you tell them anything when you got there?
Yes.
And what did you say when you walked in?
He was trying to kill me.
Okay, it was tough to hear there, but in the first clip she said fear of dying, and she started to choke up, and then she told the school staff when she went in to get to safety, that she was being victimized by her father, trying to kill her, were her words. He was trying to kill me. Michael J. Brown, how did those words from this victim's mouth help shape the point you were illustrating earlier?
Well, okay. That wasn't a lot of testimony.
Yeah, in front of the school, there's a pack of kids that looked like they were fighting. So pulled into the turn lane to stop the fight.
Okay. And when you say the school, what school you were?
Timberline High School.
Okay. So when I ask questions, I'm just going to ask you to pause for just a second. It's natural for people to talk over each other. So we have a court reporter and she has to write it down. So if you can just pause for a second, okay? So you said Timberline High School, is that right?
Yes.
And you said you saw a pack of kids. Where was that pack of kids? Where was this event occurring?
At the bus stop in front of the school.
Okay. And what did you do when you observed that incident?
I pulled into the turn lane and exited my vehicle and approached the kids.
Why did you approach the kids? I mean, let me ask this a different way. Have you seen fights before?
Yes.
Okay. Do you stop your vehicle in the middle of the road for fights?
If it's a one-on-one fight, I wouldn't stop necessarily. But it was a huge mob of kids, and to me, that's unjust.
Okay. And so as you see that, was this a different scenario?
Yes.
Okay. When you got out of your vehicle and you got closer, did your opinion about what was occurring change?
Absolutely. I realized it was not.
Okay. I'm going to ask you some follow-up questions, okay? When you got closer, what did you see?
I seen a grown man choking a young teenage girl.
And you say choking, what does that mean to you?
He was on his back and had the young girl on top of him in a rear naked choke.
That is a pretty specific term. So tell me what you mean by that. Why do you use that term?
That's what I know it is called. He had his arm wrapped around her neck.
How do you know that?
Okay. They're back.
Yeah.
Forgot to switch tabs.
Okay. Do you recall?
Hold up. We're going to rewind her just a minute because I've screwed up. I got overexcited.
North Thurston School District property?
Yeah, thank you.
Okay. And do you recall whether that trespass notice was ever served on Mrs. Ali?
Yes, it was served to Mrs. Ali on September 17th.
And so if I understand, the incident happens on or about September 16th. The trespass order is served on or about the 17th, and the request for the transfer of Fatima happens somewhere around the 17th or the 18th, the same day. Is that correct? Or shortly thereafter?
Yes.
Not to jinx it or anything, but hey guys, we got a full screen picture momentarily. I don't know how long it's going to last, but I'm excited.
Okay. Do you recall, is at any point during this Fatima still going to school, or is she withdrawn from school?
Fatima was still attended school the 16th and 17th, and then did not show up the 18th or thereafter.
Was she withdrawn from school by her parents?
She was not in attendance. She eventually was withdrawn to go to Summit.
Okay, do you recall when she was withdrawn?
I believe the transfer to Summit happened September 27th.
Okay. And during the course of your, well, let me back that up. Is there actually a withdrawal notice or form, so to speak?
Once a student is accepted into another North Thurston Public Schools school, it goes from one registrar to the other. So they just request that student come over, and then we all get notices about that, emails.
Okay.
The student has withdrawn emails.
Oh, okay. And during the course of your decision making to have her go to the online school, were there any other decisions or any other alternatives or options made available?
Envision Career Academy was.
What is that?
It's one of our high schools. It's an alternative learning option. It's an in-person high school. It's smaller, has a smaller campus, and that was one, they had open enrollment at that time for Fatima, and two, Fatima does better in school and it's in person, by what she told us and what we thought would fit for her. And having her have access to adults, we thought would be helpful to her during that time.
May I approach you?
You may.
Ms. Waltermeyer, I'm going to ask you to look at what's been marked as States Exhibit 113, as well as what's been marked as States Exhibit 121. Can you please look at those silently to yourself and then look up at me when you're done? And Ms. Waltermeyer, do you recognize what I've handed you?
Yes.
Okay, and what are those?
This is the no trespass order that I issued.
Okay, and States Exhibit 113, you picked up a document. Was that States Exhibit 113?
Yes.
Okay, and that is a copy of the trespass order that you issued regarding Mrs. Ali from September 16th. Is that correct?
Yes.
Is it the 16th or the 17th?
The incident happened on the 16th. We met on the 17th.
Okay. And is States Exhibit 113 a true and accurate copy of the order that you issued?
Yes.
Okay. And I'd like you to look at States Exhibit 121 now. And when you look at States Exhibit 121, aside from a reduction, is that a true and accurate copy of States Exhibit 113?
Yes.
Okay. And based on those exhibits, well, how do you know that those exhibits are the trespass letters? I know it sounds like a silly question.
Because I have a copy, because that's my signature.
Okay, thank you. Your Honor, this time the state would move to admit States Exhibit 113 and 121. Or excuse me, 121 only.
121 only. Mr. Kading?
No objection.
Mr. Larry?
Okay.
121 shall be admitted.
May I retrieve those, Your Honor?
You may.
I'm going to ask you some additional questions, Ms. Waltermeyer. You indicated that there was the incident on the 16th. Is that correct?
Yes.
And regarding that incident, you issued this trespass letter. Is that correct?
Yes.
And prior to issuing that trespass letter, do you do anything to confirm or corroborate that that trespass letter should be issued, meaning that there's a basis for issuing it?
Yes, I looked at video footage on September 16th.
Okay, thank you. And is that a decision you make? Is that a decision that the principal makes? How does that decision occur?
I made that decision to find the footage.
Okay. And when you made the decision to trespass Miss Ali, where was Miss Ali trespassed from? Where, what parts was she trespassed from?
Timberline High School, and in that letter it says all North Thurston public school properties.
And you indicated you had a meeting with her, is that correct?
I did.
Okay. And so how was that notice served on her? Can you describe how that meeting went? Without repeating anything anyone said to you, how did that meeting go? What does that look like?
We met in person that day. And so it was Mrs. Ali, Officer Howard, and I, and Haneen came in, the daughter.
And where did you meet?
In my office.
And you said initially, well, Mrs. Ali's daughter, do you know what Mrs. Ali's daughter's name is?
Haneen.
Okay. It's not a test.
Okay.
When Haneen came, was Haneen there at the beginning of the meeting, in the middle of the meeting, at the end of the meeting, or something else?
She was there towards the beginning of the meeting. We waited for Haneen to get there.
Okay. So initially, I'm sorry?
At Mrs. Ali's.
All right, we're going to take a break here. And on the other side, the assistant principal describes her interaction with Zahraa and her other daughter.
No break, sir. We're going to take that down. Let him get through his break. Because they keep taking these breaks. And we're running later tonight than we usually do because of all these breaks. So I can tell you that tomorrow we will not be starting this early because I will not be doing this. We will be in Coburger tomorrow. So we may, Coburger is tomorrow, and they say it may run into Thursday. So I don't know, depending on how I feel tomorrow, if I want to just after Coburger run this into the evening, and that'll give me the opportunity to zip through all the breaks and stuff. I'll just have to see how I feel tomorrow after the Coburger stuff. I'm excited. It says it's supposed to be 11 a.m. my time. So that's central. So I'm kind of excited about that. Yeah. 9:30. No, that's typical, William. No, that's summertime. That's why I'm in tank tops. I'm telling you, I do not do heat very well. I hate the heat. I have a fan blowing over here on me. And yeah, I don't do the heat. So that's why I wear tank tops every day. Every day. You hardly ever see me with anything on my shoulders. I used to be all like crazy about that, mental, and like not want to, like, I don't know. It was a deal about being fat, you know. I've always been fat all my life, so I had a fear of showing my shoulders and my arms. I'm like, you know what? They're arms. If you don't like them, don't look. You know, I'm above and beyond all that anymore. It's just hey Lola, pretty girl. You want to see the camera? You want to see the camera? Say hi, Lola. Say hi. Say hi, baby. Say hi, Lola. Mommy's girl. Mommy's girl. Mommy's girl. Yeah, here's a good baby. Here's a good baby. Oh, Jealous over here. He's going to cry because I didn't include him. Yeah, see, he's such a baby. He's dogs. It's almost 2 a.m. in there. It's 62. Oh, my gosh. Yeah, it's 6:45 here. And it's 93. It's 6:45 in the evening. I mean, and that's just typical. And that's what, when Mom came in the other day and she was talking about 120, that's what she was talking about was the temperature. She said it was supposed to be a feel-like temperature of 120. And she read it wrong. It wasn't. It was supposed to be 112. That's my Lola. That's my Lola. Baby girl, stop. She keeps trying to get up here. She don't understand. She's a puppy and she's not supposed to be up here. She still thinks she can jump up here in my lap like nothing. Get down, baby. Get down. 87 degrees. Feels warmer. I mean, it's just, oh, I hate the heat. I hate the heat. Yeah, Texas is no place. No, I've always lived in Texas. I've never lived anywhere else, so I guess I'm used to it. I mean, but I know how to dress for the weather because I've always lived here. So I know, tank tops are my friend, and I wear sweaters in the winter. I don't like the cold, but it doesn't get very cold here. Usually it's just like December, January, maybe February. It's about all that it's ever cold here. And by cold, I mean like in the 60s. It might drop into the 50s, but we don't get like the. I think I've seen snow in Texas 3 times in my life, and I'm 53 years old, and I've seen snow 3 times. It was in the 80s, and then 4 times. Once in the late 90s, and then in 2005 we had snow, and 60 is cold. Yeah, 60 is cold for us. And then last not this past winter, but the winter before, we had a big snow that blanketed the area. So yeah, I mean, and that's why I always wear my hair up in a ponytail. I don't like it on my neck. I don't want to be sweaty. I don't, I'm gonna be in my house. I'm gonna be comfortable. It is what. Hey, little girl. Hey. Yeah, I'm about being comfortable. We keep it as laid back. It can be -10 in the winters, 20. I couldn't even fathom that. I remember back in 2014, I guess it was, I went up into Nevada, and I went to a town called it was New Mexico. I went to New Mexico, a town called Cloudcroft, New Mexico. And that was the first time I ever got to see like real snow packed on the side of the road. I'd never seen like piles of snow. Like, we get snows where you can make just a snowball and hope that it stays together in order to throw it. Okay, like I said, only 4 times in my life I've seen snow like that here. So when we went to Cloudcroft, New Mexico, it was like I could stand beside it and it was up to my waist. The snow was so amazing. Okay, they are back in court. Finally, they are back in court. We're going to throw this up.
And Officer Howard met in your office for that meeting. And then, if I understand your testimony, Henning arrived later?
Yes.
Okay. And you waited based on mom's request, is that correct?
Yes.
While you were waiting for Mrs. Ali, Henning to arrive at Mrs. Ali's request, were you able to engage with Mrs. Ali?
Yes.
Okay. And how would you describe, without repeating anything anyone said, how would you describe the nature of that interaction?
Overall, the nature was good. She was telling us, communicating about an incident over the weekend.
Okay. Was that communication with you ongoing in English or something else?
In English.
Okay. Prior to Henning arriving, had you provided her with the trespass letter? Or do you recall telling her what the meeting was about?
Yes, we did tell her what the meeting was about. We did present the trespass order, as I recall. That's what I recall. Officer Howard did ask if she wanted an interpreter, and she asked for Henning instead. And so at that point, we paused to wait for Henning. That's my recollection.
Okay, so when you had that initial interaction, if I understand your testimony correctly, you offered her an interpreter and that was declined. Is that correct?
Yes.
When you say interpreter, what did that look like? How do you have Arabic interpreters in the school, or would you have used something else? What did that mean to you?
Officer Howard was going to use their language line, and the school district does have a language line, but Officer Howard was going to use theirs.
Okay. Did you feel prior to Haneen arriving, you were able to communicate with Mrs. Ali?
Yes.
Did you communicate about one topic, several topics, no topics, or something else?
We communicated about the trespass. So we communicated.
Again, without relaying what that conversation is, just a number of different topics.
A number of different topics, yeah. We communicated about something over the weekend, and we talked about Fatima overall, like academics and how she was doing in school and some of Mom's concerns for Fatima.
So overall, there was a number of topic areas that you discussed, and all of that was in English. Is that correct?
Yes.
And then when Haneen arrives, what happens when Haneen arrives?
When Haneen arrives, we go over the trespass letter again. Haneen does relay the information to Mrs. Ali, and they talk back and forth. Mrs. Ali would ask questions, so would Haneen. Some of it went from Mrs. Ali in their native language to Haneen, and then Haneen would ask the question, or Haneen would clarify for Mrs. Ali.
Okay. At any point during your interaction with Mrs. Ali, did she indicate she didn't understand the order?
No.
With Haneen present, did either Mrs. Ali or Haneen on behalf of Mrs. Ali communicate any clarifying questions about the order's parameters, meaning the limitations on that order?
I think that Mrs. Ali asked about pickup, and we talked about how Haneen could come and pick her up, or Mr. Ali could come and pick up the kids, but she was no longer allowed to be at school. But other than that, no.
Was she given an opportunity to ask questions about the order before Haneen arrived?
Yes.
And what about after Haneen arrived?
Yes.
And throughout this interaction, did she indicate whether she affirmatively understood the order itself?
Yes, she understood the order.
My question was whether she indicated she understood.
So I'll sustain that the answer was non-responsive. The question did not call for speculation.
So just listen to the question. Did Mrs. Ali indicate to you that she understood the order?
Yes.
And did you provide her, not just show her that order, but did you provide her with her own copy of that order as well?
Yes.
Okay. When you say that Haneen was present, was Haneen, and Haneen came later, did you have then one conversation? Let me strike that. If I understand your testimony, it sounds like you talked about the trespass order before Haneen came, in part or in full, and then talked about it again when Haneen got there. Is that correct?
Yes.
Okay. And that order, the copy of that order, was that presented when Haneen was present?
Yes.
May I publish 121, please, Your Honor?
You may.
And Mrs. Waltermeyer, can you tell the jury what we're looking at on State's Exhibit 121? First of all, what's at the top of that page as you're looking at it on the screen?
That is the North Thurston Public Schools symbol. I can't think of the right word for it. And it's our letterhead.
And do you recognize the third name down on the upper right-hand side?
Yes.
Whose name is that, ma'am?
That is my name.
Okay. And underneath of all of the names, what is indicated there as to where this is being generated from?
Timberline High School.
Okay. Is there a date associated with this letter?
2 dates, yes. September 17th.
And what date is September 17th? indicated up here? What is that intended to indicate?
The day that it was issued.
Okay, and who is it issued to?
Zahraa Ali.
All right, that's going to wrap up our coverage for tonight. Thanks to Noah Pines for joining us. I'm Michael Ayala. It's been a pleasure being with you. Thank you so much, as always, for being with me. Up next, it's closing arguments. Ted Rowland is in for...
Stop it. That they didn't even let her finish testifying. We didn't get to see the end of it. I am so disgusted with court TV right now. I am sorry. I'm going to say that out loud. I am not happy with them. I am serious. They just, the middle of her talking, just cut it off and said they're done. No, sir, that's not how we do trials. That is not right. Meat's saying something. He's over here pissed too. That's right. Dog bark says it all. Oh my gosh. What in the actual heck? Oh, I'm so angry. Okay. So I feel like we got nowhere today with this trial. We finished Dr. Gilbert, and we got the school counselor teacher, and she got done. We did the Sergeant Jeremy Knight, he got done, and the assistant principal was cut off, and we didn't get to hear her finish. So I don't know. It is what it is. Tomorrow we will be doing Koberger. So if that happens, then if he rolls into Thursday, he shouldn't roll into Thursday. We'll see what happens. But if not, we will just use Thursday's stream to zip through all these breaks and get through all this stuff. So we'll see what happens with Koberger tomorrow. And we will look for Denise. I'll be looking forward to my messages from her. And that's going to be that. So until tomorrow, I want y'all to have a great night. I'm going to go play with the doggos and enjoy the rest of my evening with them. I'm thinking about, I might do a pop-up live later tonight. I don't know. But on the other channel, on the Rubber Ramada channel. So we will see. I'm not making any promises. But until then, I will see y'all later tomorrow. Peace. Rubber out. Y'all have a great night.